1. Endocrine glands can be made up of a glandular epithelium. B. Neurosecretory tissue. C. Ducts leading to major arteries. D. Both A and B. D. Both A and B. 2. In comparison with the nervous system, the regulatory effects of the endocrine system are rapid to appear but short-lived. B. Slow to appear but long-lasting. C. Rapid to appear and long-lasting. D. Slow to appear and short-lived. B. Slow to appear but long-lasting. A. Chemical messenger travels a short distance. 4. A molecule secreted by neurosecretory cells and then travels in the bloodstream to interact with specific target cells at a distance rather than across a synapse is called a neurotransmitter. B. Neurohormone. C. Signaling hormone. D. Anabolic hormone. B. Neurohormone. 5. Tropic hormones that target other endocrine glands and stimulate their growth and secretion. B. Target reproductive tissues. C. Stimulate anabolism in their target cells. D. Do all of the above. A. Target other endocrine glands and stimulate their growth and secretion. 6. All of the following are non-steroid hormones except oxytocin. B. Calcitonin. C. Cortisol. D. Glucagon. C. Cortisol. 7. The last step in the non-steroid hormone mechanism of action is adjoining with the G protein on the cell membrane. B. Protein kinases activate other enzymes. C. Adenyl cyclase is activated. D. KIMP is formed. B. Protein kinases activate other enzymes. 8. Hormones can be steroids. B. Peptides. C. Glycoproteins. D. All of the above. D. All of the above. 9. Steroids are able to pass easily through a target cell's plasma membrane because they are synthesized from amino acids. B. Synthesized from carbohydrates. C. Lipid soluble. D. Synthesized from nucleic acids. C. Lipid soluble. 10. When a small amount of one hormone allows a second hormone to have its full effect, the phenomenon is called a synergism. B. Permissiveness. C. Antagonism. D. Augmentation. B. Permissiveness. 11. Which of the following non-steroid hormones bind to receptors associated with a DNA molecule within the nucleus of the target cell? A. Thyroxine. B. Triiodothyronine. C. Prolactin. D. Both A and B. D. Both A and B. 12. The compound that is referred to as a tissue hormone is a growth hormone. B. Prostaglandin. C. Adrenocorticotropic hormone. D. Thyroxine. B. Prostaglandin. C. Aspirin produces some of its effects by increasing PGE synthesis. 14. The type of prostaglandin that play a role in the development of a fever is A. PGAB, PGEC, PGFD, PGA and PGE. B. PGE. C. Cells can have receptors for hormones or for neurotransmitters but not for both. 16. The production of thyroid hormone is stimulated by another hormone from the A. Anterior pituitary, B. Posterior pituitary, C. Thyroid gland, D. Parathyroid gland. A. Anterior pituitary. 17. The many hormones secreted by endocrine tissues can be classified simply as blank hormones. A steroid or non-steroid, B. Anabolic or catabolic, C. Sex or non-sex, D. Tropic or hypotropic. A steroid or non-steroid. 18. Which of the following is not true of steroid hormones? A. They are lipid-soluble. B. They are derived from a fatty acid molecule. C. They can pass through the cell membrane. D. All of the above are true about steroid hormones. B. They are derived from a fatty acid molecule. 19. Which of the following is not a description of hormone interaction explained in the text? A. Suppression, B. Antagonism, C. Synergism, D. Permissiveness. A. Suppression. 20. The immediate effect of a steroid hormone on a cell is the A. Formation of CAMP, B. Increase of enzyme-controlled intracellular reactions, C. Transcription of RNA, D. Activation of adenyl cyclase. C. Transcription of RNA. 21. One of the later effects of steroid hormones on the cell could be the A. Transcription of RNA, B. Making of enzymes, C. Formation of CAMP, D. Activation of kinases. B. Making of enzymes. 22. Which of the following does not act as a second messenger for non-steroid hormones? A. Inositol triphosphate, B. Guanosine monophosphate, C. Calcium comedulin complex, D. All of the above act as second messengers. D. All of the above act as second messengers. 23. Which of the following is not a functional classification of hormones? A. Steroid, B. Tropic, C. Anabolic, D. Neither A nor B is a functional classification of hormones. A. Steroid. 24. Which of the following is not a chemical classification of hormones? A. Steroid, B. Anabolic, C. Tropic, D. Neither B nor C is a chemical classification of hormones. D. Neither B nor C is a chemical classification of hormones. 25. The common molecule from which all steroid hormones are derived is the phospholipids. B. Cholesterol, C. lecithin, D. triglycerols. B. Cholesterol. 26. Which of the following is not a source of non-steroid hormones? A. Cholesterol, B. Protein, C. Protein joined with a carbohydrate, D. Individual amino acids. A. Cholesterol. 27. When a hormone attaches to a target cell, which of the following can occur? A. It can initiate protein synthesis. B. It can open or close ion channels. C. It can activate certain enzymes in the cell. D. All of the above can occur. D. All of the above can occur. 28. The term down-regulation refers to the A. decrease in hormone production as we age. B. Negative feedback system of hormone regulation. C. Reduction of the number of hormone receptors in a cell. D. Movement of regulating hormones from the hypothalamus down to the pituitary gland. C. Reduction of the number of hormone receptors in a cell. B. Two hormones working together to enhance each other's impact on a target cell. 30. Hormones that regulate activity in the secreting cell itself are called the prostaglandins. B. Paracrine hormones. C. Autocrine hormones. D. Leukotriene hormones. C. Autocrine hormones. 31. Which of the following is not a protein hormone? A. Oxytocin. B. Insulin. C. Parathyroid hormone. D. All of the above are protein hormones. A. Oxytocin. 32. Which of the following is not a peptide hormone? A. Oxytocin. B. Insulin. C. Antidiuretic hormone. D. All of the above are peptide hormones. B. Insulin. 33. Which of the following is not an amino acid derivative hormone? A. Epinephrine. B. Norepinephrine. C. Thyroid hormones. D. All of the above are amino acid derivative hormones. D. All of the above are amino acid derivative hormones. 34. Which of the following is not true of prostaglandins? A. Contain a 20-carbon unsaturated fatty acid chain. B. Contain a 5-carbon ring. C. Made from membrane phospholipid molecules. D. All of the above are true of prostaglandins. D. All of the above are true of prostaglandins. 1. The structure referred to historically as the master gland is the A. Pituitary. B. Adrenals. C. Hypothalamus. D. Thyroid. A. Pituitary. 2. Which of the following hormones is not secreted by the basophils? A. Prolactin. B. Luteinizing hormone. C. Follicle-stimulating hormone. D. Thyroid-stimulating hormone. A. Prolactin. 3. The hormone most likely to cause a shift from glucose catabolism to fat catabolism is a antidiuretic hormone. B. TSHC adrenocorticotropic hormone. D. Somatotropin. D. Somatotropin. 4. Gonadotroph secrete A. GHB, LH and FSHC. TSHD prolactin. B. LH and FSH. 5. Growth of the ovarian follicle occurs because of A. LHB estrogen. C. Progesterone. D. FSH. D. FSH. 6. Prolactin effects of the adrenal cortex. B. Body growth. C. Skin color. D. Milk secretion. D. Milk secretion. 7. The principal action of thyrotropin-releasing hormone is stimulating the A release of ACTH-B secretion of growth hormone. C. Release of TSH. D. Release of FSH and LH. C. Release of TSH. 8. The vascular link between the hypothalamus and the adenohypophysis is called the A. Circulatory system. B. Hypophyseal portal system. C. Vascular system. D. Releasing inhibiting connection. B. Hypophyseal portal system. 9. Which hormones are produced by the hypothalamus to control the adenohypophysis? A. Tropic hormones. B. Releasing hormone. C. Melanocyte-stimulating hormones. D. Basophils. B. Releasing hormones. 10. The hypothalamus produces A. Somatotropin. B. Oxytocin. C. Lactogenic hormone. D. Melanocyte-stimulating hormone. B. Oxytocin. 11. The neurohypophysis serves as a storage and release site for A. ADHB, oxytocin. C. Prolactin. D. Both A and B. D. Both A and B. 12. The principal thyroid hormone is a tetraiodothyronine. B. Triiodothyronine. C. Calcitonin. D. PTH. B. Triiodothyronine. 13. Calcitonin decreases calcium storage in bones. B. Raises blood calcium levels. C. Has the opposite effect of parathyroid hormone. D. Reveals thyroid functioning in the protein-bound iodine test. C. Has the opposite effect of parathyroid hormone. 14. Parathyroid hormone increases calcium absorption in the intestines by activating of vitamin A, B, vitamin C, vitamin D, iron. C. Vitamin D. 15. Which of the following depends on maintaining normal levels of calcium in the blood? A. Blood clotting. B. Cell membrane. C. Neuromuscular excitability. D. All of the above. D. All of the above. 16. The hormone that causes ejection of milk into the mammary ducts is a prolactin. B. Estrogen. C. Oxytocin. D. Progesterone. C. Oxytocin. 17. An abnormally high metabolic rate could be associated with the functioning of the A. Thyroid gland. B. Parathyroid gland. C. Posterior pituitary. D. Thymus. A thyroid gland. C. The juxtaglomerular apparatus secretes renin into the blood in response to a fall in the blood pressure within the kidney. 19. Which of the following is not true of glucocorticoids? A. Stress causes their release. B. They cause an increase in the body's defense mechanisms. C. They stimulate gluconeogenesis. D. They are hyperglycemic. B. They cause an increase in the body's defense mechanisms. 20. The mineralocorticoids of the adrenal cortex regulate or influence blank balance. A. Calcium and sodium. B. Sodium and chloride. C. Sodium, potassium, and hydrogen. D. Hydrogen and oxygen. C. Sodium, potassium, and hydrogen. 21. Secretion of blank is controlled mainly by the renin-angiotensin mechanism and blood potassium concentration. A. Aldosterone. B. Cortisol. C. Adrenal estrogens. D. Norepinephrine. A. Aldosterone. 22. The adrenal medulla secretes A. ACTH-B cortisol. C. Epinephrine. D. Glucagon. C. Epinephrine. 23. The gland that serves in both an exocrine and an endocrine capacity is the A. Pituitary. B. Pancreas. C. Adrenal. D. Ovary. B. Pancreas. 24. Which of the following is a function of glucagon? A. Promotes the entry of glucose into tissue cells. B. Tends to decrease blood glucose concentration. C. Tends to increase blood glucose concentrations. D. Converts glucose into glycogen. C. Tends to increase blood glucose concentrations. 25. Insulin tends to lower blood concentrations of glucose, amino acids, and fatty acids. B. Promotes metabolism of glucose by tissue cells. C. Is produced by beta cells. D. All of the above are true of insulin. D. All of the above are true of insulin. 26. Insulin and glucagon affect the body's use of A. Sodium. B. Potassium. C. Glucose. D. Calcium. C. Glucose. 27. The major hormone produced by the corpus luteum is progesterone. B. Estrogen. C. LTHD chorionic gonadotropin. A. Progesterone. 28. Human chorionic gonadotropin is produced by the A. testes. B. ovaries. C. heart. D. placenta. D. placenta. 29. Thymosin is a hormone that plays a role in the rate of metabolism. B. body growth. C. immunity. D. maintaining early pregnancy. C. immunity. 30. Which of the following is true of T4? A. It contains 3 atoms of iodine. B. It binds more efficiently to target cell receptors than does T3. It is a prohormone for T3D. All of the above are true of T4. C. It is a prohormone for T3. 31. Which is not part of the pituitary gland? A. Sella turcica. B. Infundibulum. C. Adenohypophysis. D. Neurohypophysis. A. Sella turcica. 32. The type of cells that secrete ACTH are somatotrophs. B. lactotrophs. C. thyrotrophs. D. corticotrophs. D. corticotrophs. 33. High blood levels of ADH would be found in someone who has just eaten a meal high in sugar or other carbohydrates. B. Been working in high temperatures and is dehydrated. C. High level of calcium in the blood. D. Low level of calcium in the blood. B. Been working in high temperatures and is dehydrated. 34. One of the few hormones that functions on a positive feedback loop is A. ADH. B. calcitonin. C. oxytocin. D. insulin. C. oxytocin. 35. The structure in the body that provides the mind-body link is the A. anterior pituitary gland. B. hypothalamus. C. posterior pituitary gland. D. pineal gland. B. Hypothalamus. 36. Release of PTH in the body would cause A. Increase in blood calcium. B. Decrease in blood phosphate. C. Decrease in vitamin D production. D. All of the above are correct. A. Increase in blood calcium. 37. Mineralocorticoids are released from which part of the adrenal gland? A. Zona fasciculata. B. Zona reticularis. C. Zona glomerulosa. D. Adrenal medulla. C. Zona glomerulosa. 38. High levels of HCG in the body would indicate that the production of thyroid hormone needs to be increased. B. There was too much calcium in the blood. C. A pregnancy. D. The glucose concentration of the blood was too low. C. A pregnancy. 39. The target cells for ADH are found in the A. kidney. B. Muscles in the walls of arteries. C. Osteoblasts in the bone. D. Both A and B are correct. D. Both A and B are correct. 40. Which hormone stimulates uterine contractions? A. Oxytocin. B. FSHD. LHD. Both B and C. A. Oxytocin. 41. Which of the following statements is not true of the pineal gland? A. It is located on the dorsal aspect of the diencephalon. B. Melatonin is stimulated by the presence of sunlight. C. It produces melatonin. D. All of the above are true of the pineal gland. B. Melatonin is stimulated by the presence of sunlight. 42. Which of the following statements is not true of the thyroid gland? A. It usually consists of two lobes connected by an isthmus. B. It is located in the mediastinum in the chest. C. It contains a protein iodine complex called thyroglobulin. D. All of the above are true of the thyroid gland. B. It is located in the mediastinum in the chest. 43. Glucocorticoids are released by which part of the adrenal glands? A. Zona glomerulosa. B. Zona fasciculata. C. Zona reticularis. D. Both B and C. D. Both B and C. 44. Gonadocorticoids are released by which part of the adrenal gland? A. Zona glomerulosa. B. Zona fasciculata. C. Zona reticularis. D. Both B and C. D. Both B and C. 45. Which is not true of the hormone somatostatin? A. It is produced by the delta cells of the pancreas. B. It inhibits the secretion of glucagon. C. It stimulates the secretion of insulin. D. Both B and C are not true of the hormone somatostatin. C. It stimulates the secretion of insulin. 46. Which is not true about the testes? A. They are composed mainly of sperm-producing seminiferous tubules. B. Interstitial cells produce testosterone. C. Testosterone is regulated mostly by LHD. All of the above are true of the testes. D. All of the above are true of the testes. 47. Which hormone is used by some people to keep themselves youthful or to boost athletic performance? A. Prolactin. B. Thyroid-stimulating hormone. C. Human growth hormone. D. Oxytocin. C. Human growth hormone. 48. The hormones that are produced by muscle tissue are called inhibins. B. Cytokines. C. Leptins. D. Myokines. D. Myokines. 1. Which of the following is involved in determining a person's total blood volume? A. HB. Body type. C. Sex. D. All of the above. D. All of the above. 2. Blood volume per kilogram of body weight varies inversely with the skeletal volume. B. Body fat. C. Water weight. D. Height. B. Body fat. 3. A hematocrit of 56% would be an indication of a leukocytosis. B. Anemia. C. Leukemia. D. Polycythemia. D. Polycythemia. 4. Which mature cell has no nucleus, mitochondria, or ribosomes? A. Erythrocyte. B. Leukocyte. C. Platelet. D. Neutrophil. A. Erythrocyte. 5. A normal adult red blood cell count ranges from blank million per microsyn LA. 4.2 to 6.2 bits, 5.5 to 6.5, circa 6.5 to 7.5 D. 7.5 to 8.5. A. 4.2 to 6.2. 6. Which of the following cell types can carry oxygen? A. Leukocyte. B. Thrombocyte. C. Platelet. D. Erythrocyte. D. Erythrocyte. 7. A hematocrit of 40% means that in every 100 milliliters of whole blood, there are A. 40 red blood cells and the remainder is fluid plasma. B. 40 milliliters of fluid plasma and 60 milliliters of red blood cells. Circa 40 milliliters of red blood cells and 60 milliliters of fluid plasma. D. 2 liters of fluid plasma. Circa 40 milliliters of red blood cells and 60 milliliters of fluid plasma. 8. Under the microscope, erythrocytes appear as biconcave discs without nuclei. B. Circular discs with centrally located nuclei. C. Circular discs with several nuclei. D. Oval discs with multilobe nuclei. A. Biconcave discs without nuclei. 9. Erythropoiesis is the formation of a platelets. B. Red blood cells. C. White blood cells. D. All of the above. B. Red blood cells. 10. Many types of blood cells are produced in the A. Liver. B. Red bone marrow. C. Spleen. D. Pancreas. B. Red bone marrow. 11. In the formation of blood cells, the megakaryoblast ultimately develops into a lymphocytes. B. Platelets. C. Monocytes. D. Both A and B. B. Platelets. B. Released by the liver to stimulate red blood cell formation. 13. Which of the following is not a leukocyte? A. Basophil. B. Reticulocyte. C. Neutrophil D. Monocyte. B. Reticulocyte. 14. Carbon dioxide is transported as bicarbonate ions because of a chemical reaction catabolized by the enzyme albumin. B. Fibrinogen. C. Carbonic anhydrase. D. Globulin. C. Carbonic anhydrase. 15. All blood cells are derived from reticulocytes. B. Proerythroblasts. C. Basophilic erythroblasts. D. Hemocytoblasts. D. Hemocytoblasts. 16. Hemoglobin is broken down into what pigment, which is excreted in bile? A. Amino acids. B. Iron. C. Bilirubin. D. Melanin. C. Bilirubin. 17. Which of the following cell types are classified as agranulocytes? A. Neutrophils and monocytes. B. Basophils and lymphocytes. C. Neutrophils and basophils. D. Lymphocytes and monocytes. D. Lymphocytes and monocytes. 18. Which types of white blood cells are thought to play a role in the prevention of clotting? A. Eosinophils. B. Monocytes. C. Basophils. D. Neutrophils. C. Basophils. 19. Which of the following is an example of a leukocyte? A. Monocyte. B. Thrombocyte. C. Platelet. D. Erythrocyte. A. Monocyte. 20. Which types of white blood cells play a major role in immunity to infectious diseases? A. Monocytes. B. Eosinophils. C. Lymphocytes. D. Basophils. C. Lymphocytes. 21. Which of the following are the most proficient at phagocytosis in the tissues? A. Neutrophils and basophils. B. Lymphocytes and eosinophils. C. Basophils and monocytes. D. Neutrophils and monocytes. D. Neutrophils and monocytes. 22. Thrombocytes are involved with a blood clotting. B. Body defense. C. Transport of glucose. D. Transport of oxygen. A blood clotting. 23. Which of the following Rh factor combinations could cause agglutination of an offspring's red blood cells? A. Mother, father plus, infant plus. B. Mother, father, infant. C. Mother plus, father, infant plus. D. Mother plus, father plus, infant. A. Mother, father plus, infant plus. 24. People with type AB blood are considered universal recipients because their blood A does not contain the Rh antigen. B does not contain either anti-A or anti-B antibodies. C is absent of both antigen A and antigen B in the red blood cells. D. Both B and C are correct. B does not contain either anti-A or anti-B antibodies. 25. Which type of protein constitutes more than half of the total proteins in blood plasma? A. Globulin. B. Fibrinogen. C. Albumin. D. Heme. C. Albumin. 26. Which factor in the clotting process is the anti-hemophilic factor? A. IVB. 8 circa. IXD. X. B. 8. 27. Which factor in the clotting process is the Christmas factor? A. IVB. 8 circa. IXD. X. Circa. IX. 28. Calcium is used in the clotting process during a stage IB stage the second. C stages I and the second. D neither stage I nor stage the second. C stages I and the second. 29. In stage the second of clot formation, prothrombin is converted to a fibrin. B. Fibrinogen. C. Thrombin. D. Thromboplastin. C. Thrombin. 30. In the formation of a clot, the insoluble network of fine threads in which the cellular elements of blood are trapped is called the fibrinogen. B. Fibrin. C. Thrombin. D. Thromboplastin. B. Fibrin. 31. Which of the following is an anticoagulant? A. Calcium ions. B. Vitamin K. C. Thromboplastin. D. Heparin. D. Heparin. 32. Which of the following statements is not true of plasma? A. It is about 90% water. B. It contains both electrolytes and non-electrolytes. C. It contains both colloids and crystalloids. D. All of the above statements are true of plasma. D. All of the above statements are true of plasma. 33. Which plasma protein plays an important role in blood clotting? A. Fibrinogen. B. Albumin. C. Globulin. D. Plasminogen. A. Fibrinogen. 34. The major ingredient in hemoglobin that allows oxygen to be transported is a sodium. B. Zinc. C. Iron. D. Copper. C. Iron. 35. Which plasma protein plays an important role in the immune system? A. Fibrinogen. B. Albumin. C. Globulin. D. Plasminogen. C. Globulin. 36. Which of the following formed elements assist in coagulation? A. Leukocytes. B. Erythrocytes. C. Thrombocytes. D. Monocytes. C. Thrombocytes. 37. Which of the following are not found in the Buffy count? A. Erythrocytes. B. Leukocytes. C. Thrombocytes. D. All of the above are found in the Buffy count. A. Erythrocytes. 38. A person with only antibody B in his or her plasma would have which blood type? A. AB. BC. ABD. O. A. 39. Which of the following does not hasten clotting? A. Rough spot in the endothelium. B. Abnormally slow blood flow. C. Heparin. D. All of the above hasten clotting. C. Heparin. 40. The function of blood is to carry food to the cells. B. Remove waste from the cells. C. Assist the body in temperature regulation. D. Do all of the above. D. Do all of the above. 41. A hematocrit value of 38 milliliters per 100 milliliters of blood would be the average for a man. B. In the low normal range for a woman. C. In the high normal range for a woman. D. In the low normal range for a man. B. In the low normal range for a woman. 42. When whole blood is spun down in a centrifuge, the buffer coat can be found between the plasma and red blood cells. B. At the very top of the test tube. C. At the very bottom of the test tube. D. In the plasma below the water but above the soluble proteins. Between the plasma and red blood cells. 43. One hemoglobin molecule contains a 1 molecule of heme. B. 1 molecule of globin. C. 4 iron atoms. D. All of the above. C. 4 iron atoms. 44. What part of the hemoglobin molecule combines with carbon dioxide? A. Globin. B. Heme. C. Iron atoms. D. Hemoglobin does not combine with carbon dioxide. A. Globin. 45. Which are the only cells in the differentiation process of red blood cells that can be found circulating in the blood? A. Proerythrocytes. B. Reticulocytes. C. Basophilic erythrocytes. D. Polychromic erythrocytes. B. Reticulocytes. 46. Which is not an end product of the breakdown of hemoglobin? A. Amino acids. B. Bilirubin. C. Free oxygen. D. Iron. C. Free oxygen. 47. Which of the following substances is not secreted by platelets? A. ATP. B. Thromboxane. C. Arachidonic acid. D. All of the above are secreted by platelets. A. ATP. 48. Whole blood constitutes about what percent of total body weight? A. 0.8%. B. 5.3%. Circa 8%. D. Between 12% and 15%, depending on body type. Circa 8%. 49. Which characteristic of blood makes it especially effective in temperature regulation? A. Low specific heat capacity. B. High specific heat capacity. C. High evaporative potential. D. Both A and C. B. High specific heat capacity. 50. If you give a unit of blood in a blood drive, and you are an average-sized adult, you have given about what percent of your blood? A. 1%. B. 5%. Circa 10%. D. 15%. Circa 10%. 51. The approximate blood volume in a human can be determined by using A. The direct method. B. The indirect method. C. A radioisotope. D. Both B and C. D. Both B and C. 52. Which is not a formed element of the blood? A. Albumin. B. Platelet. C. Erythrocyte. D. Neither A nor B are formed elements of the blood. A. Albumin. 53. The presence of spectrin in the red blood cell makes it better able to carry oxygen. B. More flexible. C. Better able to carry carbon dioxide. D. Able to produce hemoglobin. B. More flexible. C. Proerythroblasts, basophilic erythroblasts, polychromic erythroblasts, and reticulocytes. 55. Which of the following is not an agranulocyte? A. Monocyte. B. Lymphocyte. C. Eosinophil. D. All of the above are agranulocytes. C. Eosinophil. 56. Which of the following is not true of white blood cells? A. More brightly colored than red blood cells. B. Larger than red blood cells. C. Contain a nucleus. D. All of the above are true of white blood cells. A. More brightly colored than red blood cells. 57. Some white blood cells are capable of diapedesis, which means they can A. Eat bacteria or damaged cells. B. Migrate out of blood vessels into tissue spaces. C. Engage in protein synthesis because they have a nucleus. D. Change from one type of white blood cell to another. B. Migrate out of blood vessels into tissue spaces. 58. Which white blood cell helps protect against parasitic worms? A. Eosinophil. B. Neutrophil. C. Basophil. D. Monocyte. A. Eosinophil. 59. The most mature developing red blood cell that still contains a nucleus is a reticulocyte. B. Polychromic erythroblast. C. Basophilic erythroblast. D. Proerythroblast. B. Polychromic erythroblast. 60. Which white blood cell contains granules filled with histamine? A. Eosinophil. B. Neutrophil. C. Basophil. D. Monocyte. C. Basophil. 61. A person with neither A nor B antibodies in the blood plasma would have which blood type? A. B. BC. ABD. O. C. AB. 62. A person with neither A nor B antigens on the red blood cell would have which blood type? A. B. BC. ABD. O. D. O. 63. A person with an antigen on the red blood cell and a different antibody in the plasma might have which of the following blood type? A. B. ABC. OD. Both A and C. A. 64. What substance involved in the process of blood clot formation is not made by the liver? A. Fibrinogen. B. Prothrombin. C. Vitamin K. D. All of the above are made by the liver. C. Vitamin K. 65. What substance does not assist in the formation of a blood clot? A. Fibrinogen. B. Plasmin. C. Vitamin K. D. All of the above assist in the formation of a blood clot. B. Plasmin. 66. A woman could have Rh antibodies in her blood if A. Rh plus blood was given in a transfusion. B. An Rh plus fetus was developing within. C. Rogeum was given. D. Both A and B occurred. D. Both A and B occurred. B. The hemoglobin in a red blood cell makes up about 70% of the cell's dry weight. 68. Which of the following statements is not true of platelets? A. They develop from megakaryoplasts. B. They release substances that cause vasoconstriction. C. They have a lifespan of about 7 days. D. All of the above statements are true of platelets. D. All of the above statements are true of platelets. D. Newborns often have a reduced number of platelets, which are needed to clot blood, and both of the actions taken by the physician will help the umbilical cord stop bleeding. D. Globin is converted to amino acids and used as an energy source or for protein building. 71. Which kind of connective tissue makes blood cells for the body? A. Myeloid. B. Lymphoid. C. Reticular. D. Both A and B. D. Both A and B. 72. In RBCs, the red color of hemoglobin changes hue depending on the relative proportion of oxyhemoglobin. B. Deoxyhemoglobin. C. Carbaminohemoglobin. D. Iron. A. Oxyhemoglobin. 1. The sac-like structure around the heart is the A. Epicardium. B. Myocardium. C. Endocardium. D. Pericardium. D. Pericardium. 2. Which of the following is another name for the visceral layer of the pericardium? A. Endocardium. B. Epicardium. C. Fibrous pericardium. D. Myocardium. B. Epicardium. 3. The thickest layer of tissue in the heart wall is the A. Epicardium. B. Pericardium. C. Myocardium. D. Endocardium. C. Myocardium. 4. The muscular layer of the heart wall is the A. Epicardium. B. Pericardium. C. Myocardium. D. Endocardium. C. Myocardium. 5. The internal layer of tissue in the heart is the A. Epicardium. B. Pericardium. C. Myocardium. D. Endocardium. D. Endocardium. 6. The right atrioventricular valve is also called the A. bicuspid. B. tricuspid. C. mitral. D. aortic. B. tricuspid. 7. Which of the following is not an atrioventricular valve? A. Aortic. B. Mitral. C. Bicuspid. D. Tricuspid. A. Aortic. 8. The cavity of the heart that normally has the thickest wall is the A. right atrium. B. left atrium. C. right ventricle. D. left ventricle. D. left ventricle. 9. The valve that guards the left atrioventricular orifice is called the blank valve. A. bicuspid. B. mitral. C. tricuspid. D. Both A and B are correct. D. Both A and B are correct. 10. Which of the following is a semilunar valve? A. Aortic. B. Mitral. C. Tricuspid. D. Bicuspid. A. Aortic. B. Both atria receive their blood supply from branches of the right and left coronary arteries. 12. The structure referred to as the pacemaker of the heart is the AV node, B. SA node, C. Cardiac plexuses, D. Both A and B are correct. B. SA node. 13. The structural components of the circulatory system include the A. heart and lungs, B. heart and lymph nodes, C. heart and blood vessels, D. heart, vessels, and lymph nodes, C. heart and blood vessels. 14. The correct order of the layers of the heart from deep to superficial is a myocardium, pericardium, and endocardium. B. Epicardium, myocardium, and pericardium. C. Epicardium, myocardium, and endocardium. D. Endocardium, myocardium, and epicardium. D. Endocardium, myocardium, and epicardium. 15. The pulmonary and aortic valves are also called blank valves. Acuspid. B. Semilunar. C. Aortic. D. Pulmonary. B. Semilunar. 16. Respectively, the right and left atrioventricular valves are also known as a tricuspid, mitral, B. Bicuspid, tricuspid, C. Mitral, bicuspid, D. Bicuspid, mitral. A tricuspid, mitral. 17. Atrioventricular valves prevent backflow of blood into the A. atria, B. lungs, C. vena cava, D. ventricles. A. atria. 18. The ventricle of the heart that ejects blood toward the lungs is the A. right atrium, B. right ventricle, C. left atrium, D. left ventricle. B. right ventricle. 19. Which of the following is a cuspid valve? A. Aortic. B. Pulmonary. C. Mitral. D. Both A and B. C. Mitral. 20. Chordae tendino are associated with which structure? A. Aortic valve. B. Mitral valve. C. Tricuspid valve. D. Both B and C. D. Both B and C. 21. The pulmonary arteries carry blood to the A. lungs, B. left atrium, C. right atrium, D. None of the above are correct. A. lungs. 22. The pulmonary arteries empty blood into the A. right atrium, B. right ventricle, C. left atrium, D. left ventricle. A. right atrium. 23. Which of the following is not true of the myocardium? A. Cells are joined by intercalated discs. B. The muscle cells are autorhythmic. C. The muscle cells can quickly summate contractions to produce tetanus. D. It is made of electrically coupled functional units called syncytia. C. The muscle cells can quickly summate contractions to produce tetanus. 24. Which of the following is not true of the atria? A. They have thinner myocardial walls than do ventricles. B. They are the same structure as the auricle. C. They are called receiving chambers of the heart. D. All of the above are true of the atria. B. They are the same structure as the auricle. D. All of the above are true of the ventricles. 26. If damaged, which valve could allow blood to leak back into the left ventricle? A. Bicuspid. B. Tricuspid. C. Aortic semilunar. D. Pulmonary semilunar. C. Aortic semilunar. 27. If damaged, which valve could allow blood to leak back into the right atrium? A. Bicuspid. B. Tricuspid. C. Aortic semilunar. D. Pulmonary semilunar. B. Tricuspid. D. All of the above are true about the nerve supply to the heart. 29. The heart begins beating in the fetus at about what stage of development? A. 4th month. B. 2nd month. C. After about 4 weeks. D. After about 2 weeks. C. After about 4 weeks. 30. Which of the following statements is not true of the location of the heart? A. It lies in the mediastinum. B. It lies to the right of the midline of the body. C. It lies behind the body of the sternum. D. All of the above are true about the location of the heart. B. It lies to the right of the midline of the body. A. The heart of an adult is proportionally larger than the heart of an infant. 32. Pericardial fluid can be found between the A myocardium and the epicardium, B myocardium and the endocardium, C pericardium and the ribs, D epicardium and the pericardium. D epicardium and the pericardium. 33. Cuspid valves open into A the aorta, B the pulmonary artery, C the ventricles of the heart, D both A and B. C the ventricles of the heart. 34. Semilunar valves open into A the aorta, B the pulmonary artery, C the ventricles of the heart, D both A and B. D both A and B. 35. Blood from the superior vena cava enters which part of the heart? A. Right atrium. B. Right ventricle. C. Left atrium. D. Left ventricle. A. Right atrium. 36. If the chordae tendineae in the right side of the heart were damaged, it might cause blood to leak into the A pulmonary artery during heart contraction, B right ventricle during heart contraction, C right atrium during heart contraction, D right ventricle during heart relaxation. C right atrium during heart contraction. B. Because they form a syncytium, muscle cells can pass an action potential along a large area of the heart wall, stimulating contraction in each muscle fiber of the syncytium. 38. The blood entering the aorta has just left which heart chamber? A. Right atrium. B. Right ventricle. C. Left atrium. D. Left ventricle. D. Left ventricle. C. It is a compression of the heart that empowers its pumping action and makes immediate pericardial drainage necessary. 40. If the AV node were forced to assume pacemaker activity, the resulting pulse rate would be blank beats per minute. A. 10 to 30 beats, 20 to 40, circa 30 to 50. D. 40 to 60. D. 40 to 60. D. SA node, AV node, bundle of His and subendocardial branches. 42. Which of the following most accurately describes what is measured by an electrocardiogram? A. Electrical conductivity. B. Number of contractions per minute. C. The speed and strength of contractions. D. Any abnormal functioning. A. Electrical conductivity. 43. Which of the following would not cause an ectopic beat? A. Bundle of His. B. Subendocardial branches. C. SA node. D. AV node. C. SA node. 44. The QRS complex represents the depolarization of the atria. B. Repolarization of the atria and depolarization of the ventricles. C. Depolarization of both the atria and ventricles. D. Repolarization of the ventricles. B. Repolarization of the atria and depolarization of the ventricles. 45. Heart sounds are made by the blank valves. A. Closing of the AV. B. Closing of the semilunar. C. Movement of blood through the D. Both A and B are correct. A. Closing of the AV. 46. A cause of a heart murmur may be an incomplete closing of a valve. B. Incomplete contraction of the atria. C. Narrowing of a valve. D. Both A and C. D. Both A and C. 47. Hypokalemia can cause an increase in the size of which of the following? A. P wave. B. QRS complex. C. T wave. D. U wave. D. U wave. 48. The first heart sound heard, or the lub sound, is caused by the blank and the blank valves closing. A. Ventricles contracting. AVB. Atria contracting. SLC. Atria contracting. SAD. Ventricles relaxing. AV. A. Ventricles contracting. AV. 49. On an ECG, the T wave represents the depolarization of the atria. B. Repolarization of the atria. C. Depolarization of the ventricles. D. Repolarization of the ventricles. D. Repolarization of the ventricles. 50. Depolarization of the ventricles is clearly depicted by the QRS complex. B. Masked by the massive ventricular depolarization. C. Masked by the massive ventricular repolarization. D. None of the above. A. Clearly depicted by the QRS complex. 51. Which part of the QRS complex represents the repolarization of the atria? A. Q wave. B. R wave. C. S wave. D. None of the above. D. None of the above. 52. Which of the following is true of the conduction system of the heart? A. It is made of cardiac muscle. B. It is made of nervous tissue. C. It continues its contractile role even while conducting an impulse. D. Both A and C are true of the conduction system of the heart. A. It is made of cardiac muscle. 53. Which part of the conduction system of the heart is referred to as the pacemaker? A. Purkinje fibers. B. Sinoatrial node. C. Atrioventricular node. D. Atrioventricular bundles. B. Sinoatrial node. 54. The period between the closure of the semilunar valve and the opening of the atrioventricular valves is called atrial systole. B. Isovolumetric ventricular contraction. C. Isovolumetric ventricular relaxation. D. Passive ventricular filling. C. Isovolumetric ventricular relaxation. 55. The period between the filling of the ventricles and the opening of the semilunar valves is called atrial systole. B. Isovolumic ventricular contraction. C. Isovolumic ventricular relaxation. D. Passive ventricular filling. B. Isovolumic ventricular contraction. 56. The period during which blood is pumped out of the atria and into the ventricles is called atrial systole. B. Isovolumic ventricular contraction. C. Isovolumic ventricular relaxation. D. Passive ventricular filling. A. Atrial systole. 57. Atrial systole causes blood to leave the heart. B. Move through the semilunar valves. C. Move through the cuspid valves. D. Do both A and B. C. Move through the cuspid valves. 58. Which of the following are considered great vessels of the heart? A. Aorta. B. Pulmonary trunk. C. Superior and inferior vena cava. D. All of the above are great vessels of the heart. D. All of the above are great vessels of the heart. D. It would construct detours around blocked coronary arteries and return oxygen-rich blood flow to the coronary arteries. 1. Which of the following vessels do not have the ability to constrict and dilate? A. Arterioles. B. Arteries. C. Capillaries. D. Veins. C. Capillaries. 2. Both the tunica media and the tunica adventitia are absent in the arteries. B. Veins. C. Capillaries. D. Both B and C. C. Capillaries. 3. The tissue layers of blood vessels from exterior to interior are tunica media, tunica intima, and tunica adventitia. B. Tunica adventitia, tunica media, and tunica intima. C. Tunica intima, tunica media, and tunica adventitia. D. Tunica media, tunica adventitia, and tunica intima. B. Tunica adventitia, tunica media, and tunica intima. 4. Smooth muscle in blood vessels is located in the tunica adventitia. B. Intima. C. Media. D. All of the above are correct. C. Media. 5. Which of the following act as blood reservoirs? A. Arteries. B. Arterioles. C. Capillaries. D. Veins. D. Veins. 6. The structural components of the circulatory system include the A. heart and lungs, B. heart and lymph nodes, C. heart and blood vessels, D. heart, vessels, and lymph nodes. C. heart and blood vessels. 7. In fetal circulation, the ductus arteriosus and foramen ovale take blood from the fetus to the placenta. B. Connect the pulmonary artery with the aorta. C. Bypass the lungs. D. Shunt blood from the right atrium into the left atrium. C. Bypass the lungs. 8. After birth, the umbilical vessels remaining in the infant's body have become fibrous cords that remain throughout life. B. Are shed in about 6 weeks. C. Shrink to eventually become capillaries. D. Remain as possible shunts for use later in life. A. Become fibrous cords that remain throughout life. 9. The order of blood flow through the vessels is arterioles, venules, capillaries, arteries, and veins. B. Arteries, arterioles, capillaries, venules, and veins. C. Veins, venules, capillaries, arterioles, and arteries. D. Arterioles, arteries, capillaries, veins, and venules. B. Arteries, arterioles, capillaries, venules, and veins. 10. Which of the following vessels carries blood from the lungs to the heart? A. Aorta. B. Pulmonary artery. C. Pulmonary vein. D. Inferior vena cava. C. Pulmonary vein. 11. All arteries of the systemic circulation branch from the A. Superior vena cava. B. Pulmonary artery. C. Innominate artery. D. Aorta. D. Aorta. 12. As the external iliac artery enters the thigh, its name changes to the blank artery. A. Subclavian. B. brachial. C. femoral. D. popliteal. C. femoral. 13. A vein that returns blood from the head is the A. carotid. B. innominate. C. azygos. D. jugular. D. jugular. 14. Which of the following is a superficial vein in the lower arm? A. Great saphenous. B. Cephalic. C. Brachial. D. Axillary. C. Brachial. 15. Blood from the stomach and intestines goes to the liver through the A. Hepatic portal vein. B. Hepatic vein. C. Renal vein. D. Inferior vena cava. A. Hepatic portal vein. 16. Regarding fetal circulation, the small vessel connecting the pulmonary artery with the descending thoracic aorta is called the A. ductus arteriosus. B. foramen ovale. C. ductus venosus. D. umbilical artery. A. ductus arteriosus. 17. In fetal circulation, the ductus venosus takes blood from the fetus to the placenta. B. Connects the pulmonary artery with the aorta. C. Bypasses the liver. D. Shunts blood from the right atrium into the left atrium. C. Bypasses the liver. 18. Atherosclerosis is characterized by the deposition of lipids in the tunica intima. B. Adventitia. C. Media. D. All of the above are correct. A intima. 19. Which of the following is a stretching of the artery walls? A. Varicose veins. B. Anastomosis. C. Phlebitis. D. Aneurysm. D. Aneurysm. 20. The pulmonary arteries carry blood to the A. lungs. B. left atrium. C. right atrium. D. None of the above are correct. A. lungs. 21. Which statement is true of arteries? A. They always carry oxygenated blood. B. They always carry blood away from the heart. C. They are the capacitance vessels of the body. D. Both A and B are true of arteries. B. They always carry blood away from the heart. 22. Which statement is true of veins? A. They always carry non-oxygenated blood. B. They can be either muscular or elastic. C. They always carry blood back to the heart. D. All of the above are true of veins. C. They always carry blood back to the heart. 23. The most important blood vessels in the cardiovascular system are the A. capillaries, B. arteries, C. veins, D. arterioles. A. capillaries. C. vein, because it is draining blood from a capillary bed. 25. Which of these blood vessels are called resistance vessels? A. venules. B. muscular arteries. C. arterioles. D. elastic arteries. C. arterioles. 26. Which of the following are thought to promote angiogenesis, act as mesenchymal stem cells, and facilitate the health of endothelial cells? A. podocytes. B. pinocytic vesicles. C. precapillary sphincters. D. pericytes. D. pericytes. 27. After birth the ductus venosus closes and allows blood to flow to the lungs. B. allows blood to flow to the liver. C. prevents blood from moving from the right to the left atrium. D. stops blood flow to the placenta. B. allows blood to flow to the liver. C. The foramen ovale may not be closed, causing backflow of blood into the lungs. The physician will re-examine the infant frequently because the foramen ovale may take as long as 9 months to heal. 1. All of the following will increase heart rate except a sympathetic stimulation. B. a decrease in aortic blood pressure. C. a decrease in carotid blood pressure. D. stimulation of cold receptors in the skin. D. stimulation of cold receptors in the skin. 2. Which of the following is not true of the baroreceptors? A. They are stretch receptors. B. They are sensitive to changes in the oxygen content of the blood. C. They send afferent nerve impulses to the cardiac control centers. D. They are located in the carotid sinus and the aorta. B. They are sensitive to changes in the oxygen content of the blood. 3. Which of the following factors increases heart rate? A. Sudden, intense pain of visceral organs such as the intestines and the gallbladder. B. Stimulation of skin receptors by cold. C. Anxiety and fear. D. Grief. C. Anxiety and fear. 4. Peripheral resistance is affected primarily by the length of myocardial fibers. B. Blood viscosity and the diameter of arterioles. C. The capacity of the blood reservoirs. D. Elasticity of the heart. B. Blood viscosity and the diameter of arterioles. 5. Which of the following is not a mechanism that increases blood volume, and therefore venous return of blood to the heart? A. Antidiuretic hormone. B. Aldosterone. C. Atrial natriuretic hormone. D. Renin-angiotensin mechanism. C. Atrial natriuretic hormone. C. In can be computed by using Fick's formula. A flows only when a pressure gradient is absent. 8. An increase in heart rate tends to increase a cardiac output. B. Arterial blood volume. C. Blood pressure. D. All of the above. D. All of the above. 9. Cardiac output is determined by the A. Return of blood to the heart and the heart rate. B. Strength of contraction of the left ventricle. C. Stroke volume and heart rate. D. Systolic discharge and stroke volume. C. Stroke volume and heart rate. A. Local vasodilation is also referred to as active hyperemia. 11. The Fick formula is used for determining a cardiac output. B. Blood vessel resistance. C. Mean pressure of the arteries. D. Cardiac cycle. A cardiac output. 12. The greatest resistance to blood flow occurs in the A. Arteries. B. Arterioles. C. Venules. D. Capillaries. B. Arterioles. 13. Which of the following events would tend to cause a decrease in blood viscosity? A. An increase in red blood cell count. B. Marked anemia. C. An increase in blood protein concentration. D. Both A and C. B. Marked anemia. 14. A decrease in total plasma volume results from the blank mechanism. A. Atrial natriuretic hormone. B. Antidiuretic hormone. C. Renin-angiotensin. D. Aldosterone. A. Atrial natriuretic hormone. C. Pressure gradient divided by the resistance. 16. Which artery in the arm is used for measuring blood pressure? A. Brachial. B. Radial. C. Ulnar. D. Axillary. A. Brachial. B. Systolic sound, indicating the contraction of the ventricles. 18. Which of the following blood vessels has the largest total cross-sectional area? A. Capillary. B. Aorta. C. Vena cava. D. Arterial. A. Capillary. D. Difference between the systolic and the diastolic blood pressures. 20. The pulse in the neck is felt over which artery? A. Temporal. B. Common carotid. C. Esophageal. D. Vertebral. B. Common carotid. 21. The pulse in the wrist is felt over which artery? A. Radial. B. Brachial. C. Ulnar. D. Axillary. A. Radial. 22. Which of the following arteries is not one of the 6 major pressure points used to stop arterial bleeding? A. Brachial. B. Femoral. C. Subclavian. D. Axillary. D. Axillary. 23. Vasomotor control mechanisms influence a diameter of capillaries. B. Stroke volume. C. Cardiac output. D. Diameter of arterioles. D. Diameter of arterioles. 24. A collection of mechanisms that influence the circulation of the blood is the definition for baroreceptors. B. Hemodynamics. C. Minute volume. D. The Fick law. B. Hemodynamics. 25. The blood in the subclavian vein of the chest at a P1 of 15 mm Hg. For the blood to flow back to the heart, the P2 in the superior vena cava would have to be greater than 25. B would have to be between 15 and 25. C would have to be less than 15. D could be at any value. C would have to be less than 15. 26. Which of the following statements is true? A. Stimulation by the vagus nerve slows the heart rate. B. Stimulation by the cardiac nerve slows the heart rate. C. Parasympathetic stimulation occurs through the cardiac nerve. D. Both B and C are true. A. Stimulation by the vagus nerve slows the heart rate. 27. Peripheral resistance to blood flow comes about because of a friction between the blood cells and vessel walls. B. An increase in arterial runoff. C. Constriction of the veins at the end of the capillary bed. D. Both A and C. A friction between the blood cells and vessel walls. C. Sympathetic stimulation of the heart to increase cardiac output. 29. Blood in the veins of which organ is not considered part of the blood reservoir system? A. Skin. B. Skeletal muscle. C. Spleen. D. Liver. B. Skeletal muscle. 30. The chemoreceptors in the carotid bodies are particularly sensitive to a hypercapnia. B. Hypoxia. C. A decrease in blood pH. D. An increase in the hydrogen ion concentration of the blood. A. Hypercapnia. 31. The effect of what substance is to increase the total blood volume? A. ADH. B. ANHC. Aldosterone. D. Both A and C. D. Both A and C. 'A. For the body to survive, all parts of the body must be equally supplied with blood. 33. Which of the following tasks must the circulation control mechanism accomplish? A. Maintain circulation. B. Vary the volume and distribution of the blood circulated. C. Make sure that all cells receive the same amount of blood to maintain nutrient and oxygen levels. D. Both A and B are correct. D. Both A and B are correct. 34. The Latin word lamina means a pump. B. Heart. C. Lyre. D. Flow. Ciliary. D. All the above are means by which venous blood returns to the heart. 36. Which of the following factors would cause fluid to leave the blood vessel at the arterial end of the capillary? A. High hydrostatic pressure of the blood. B. High hydrostatic pressure of the interstitial fluid. C. High colloid pressure of the plasma proteins. D. All of the above. A. High hydrostatic pressure of the blood. 37. Which of the following factors would cause fluid to be reabsorbed into the blood vessel at the venous end of the capillary? A. High hydrostatic pressure of the blood. B. High colloid pressure of the plasma proteins. C. Hydrostatic pressure of the interstitial fluid. D. Both B and C. D. Both B and C. 38. Circulatory shock caused by an acute allergic reaction is called blank shock. A cardiogenic. B. Hypovolemic. C. Anaphylactic. D. Septic. C. Anaphylactic. 39. Circulatory shock caused by the effects of infectious agents is called blank shock. A cardiogenic. B. Hypovolemic. C. Anaphylactic. D. Septic. D. Septic. 40. Circulatory shock caused by a drop in the amount of blood in the circulatory system is called blank shock. A cardiogenic. B. Hypovolemic. C. Anaphylactic. D. Septic. B. Hypovolemic. 1. The main difference between the composition of lymph and interstitial fluid and the composition of plasma is the blank percentage of blank in lymph and interstitial fluid. A lower. Proteins. B. Higher. Proteins. C. Lower. Fats. D. Higher. Fats. A lower. Proteins. C. Lymph from the entire body, except the upper right quadrant, drains eventually into the thoracic duct. 3. Lymph capillaries called lacteals are located in the A. Spleen. B. Liver. C. Thymus. D. Small intestine. D. Small intestine. 4. Lymphatics resemble veins except that lymphatics have thinner walls. B. Contain more valves. C. Contain lymph nodes located at certain intervals along their course. D. All of the above are correct. D. All of the above are correct. 5. All of the following are functions of the lymphatic system except a transporting interstitial fluid back to the bloodstream. B. Providing immunological defenses. C. Transporting absorbed fats from the intestine to the blood. D. Filtering metabolic wastes. D. Filtering metabolic wastes. 6. Which of the following is not a lymph organ? A. Thymus. B. Spleen. C. Pancreas. D. Tonsils. C. Pancreas. 7. The thymus undergoes involution during early childhood. B. Puberty. C. Old age. D. Fetal development. C. Old age. 8. Lymph ducts empty into the circulatory system, draining into the A. Jugular vein. B. Subclavian veins. C. Superior vena cava. D. Inferior vena cava. B. Subclavian veins. 9. The percentage of the total proteins that leak out of the capillaries into the tissue fluid on a daily basis is A. 40% B. 50% circa 60% D. 70% B. 50%. 10. The lymph pressure gradient is established by breathing movements. B. Skeletal muscle contractions. C. Parasympathetic stimulation. D. Both A and B. D. Both A and B. 11. If lymphatic return is blocked, the blood protein concentration soon falls below normal. B. Blood osmotic pressure soon falls below normal. C. Fluid imbalance and death will result. D. All of the above will occur. D. All of the above will occur. 12. Lymph flows through the thoracic duct and re-enters the general circulation at the rate of about _liter per day. A. 1 bit 0.5 circa 3D. 5. Circa 3. 13. Lymph circulation is maintained by all of the following except at the heart. B. Inspiration. C. Skeletal muscle contractions. D. Valves. At the heart. 14. The size of lymph nodes varies from blank mm to more than blank mm in diameter. A. 1. 20 bits 10. 35 circa 20. 45 D. 30. 65. A. 1. 20. 15. Which of the following is a lymphokinetic factor? A. Arterial pulsations. B. Postural changes. C. Passive compression of the body's soft tissues. D. All of the above. D. All of the above. 16. Which of the following is a function of lymph nodes? A. Hematopoiesis. B. Filtration. C. Phagocytosis. D. All of the above. D. All of the above. 17. The lymph nodes located just above the bend of the elbow are called the blank lymph nodes. A. Inguinal. B. Axillary. C. Superficial cervical. D. Superficial cubital. D. Superficial cubital. 18. The lymph nodes located in the groin are called the A. Inguinal lymph nodes. B. Axillary lymph nodes. C. Submaxillary group. D. Submental group. A. Inguinal lymph nodes. 19. An infection in the thumb may result in enlargement of the blank nodes. A. Submental. B. Inguinal. C. Superficial cervical. D. Superficial cubital. D. Superficial cubital. 20. The lymph nodes located in the neck along the sternocleidomastoid muscle are called the A. Submental and submaxillary groups. B. Superficial cervical lymph nodes. C. Supratrochlear lymph nodes. D. Superficial cubital lymph nodes. B. Superficial cervical lymph nodes. 21. The cluster of lymph nodes found in the underarm and upper chest regions is referred to as blank nodes. A. Superficial cervical. B. Inguinal. C. Axillary. D. Superficial cubital. C. Axillary. 22. A type of blood cell produced by lymph nodes is called a eosinophil. B. Erythrocyte. C. Neutrophil. D. Monocyte. D. Monocyte. D. Both A and B are correct. 24 blank of the lymph from the breast enters the lymph nodes of the axillary region. A. Less than 50% B. Less than 25% C. More than 85% D. More than 95%. C. More than 85%. 25. The cutaneous lymphatic plexus drains lymph from the A forearm, B facial areas, C breast, D leg, C breast. 26. In advanced old age, the thymus may be largely replaced by fat, B protein, C scar tissue, D cartilage. A fat. 27. The thymus is located in the A right hypochondriac region, B left hypochondriac region, C mediastinum, D neck, C mediastinum. 28. The size of the thymus is the largest at a birth. B. 2 years of age. C. Puberty. D. Approximately 25 years of age. C. Puberty. 29. The tonsils located near the posterior opening of the nasal cavity are called the blank tonsils. A. Palatine, B. Pharyngeal, C. Lingual, D. Laryngeal. B. Pharyngeal. 30. The tonsils located near the base of the tongue are called the blank tonsils. A. Palatine, B. Pharyngeal, C. Lingual, D. Laryngeal. C. Lingual. 31. Which of the following is not true of the thymus gland? A. Relative size is largest in early childhood. B. It is the primary central organ of the lymphatic system. C. It functions in the immune mechanism. D. It functions mostly in adult life. D. It functions mostly in adult life. 32. The spleen blank during infectious diseases and blank in old age. A. Atrophies. Hypertrophies, B. Hypertrophies. Atrophies, C. Secretes hormones. Stops functioning, D. None of the above is correct. B. Hypertrophies. Atrophies. 33. The spleen is located in the blank region. A. Right hypochondriac, B. Left hypochondriac, C. Epigastric, D. Left lumbar. B. Left hypochondriac. A. It serves as the final site of lymphocyte development before birth. 35. The part of the lymphatic system that secretes a hormone is the A. Spleen, B. Thymus, C. Lymph nodes, D. Palatine tonsils. B. Thymus. 36. The pulp of the spleen and its venous sinuses allow it to store up to blank ml of blood. A. 100 bits 150 circa 250 D. 350. D. 350. 37. Which of the following is not a function of the spleen? A. White blood cell destruction, B. Platelet destruction, C. Reservoir for blood, D. Hematopoiesis. A. White blood cell destruction. 38. The vast majority of the body's lymph is drained by the blank duct. A. Right lymphatic, B. Left lymphatic, C. Thoracic, D. Abdominal. C. Thoracic. 39. Adenoids is an infected adenoid. B. An infected lymph node. C. Tissue swelling. D. None of the above. B. An infected lymph node. 40. The lymph nodes perform which of the following functions? A. Control blood pressure. B. Defense. C. Hematopoiesis. D. Both. B and C. D. Both. B and C. 41. Lymph enters a node via afferent lymph vessels. B. Efferent lymph vessels. C. Sinuses. D. Trabeculae. Afferent lymph vessels. 42. The thymus secretes A. T3B. T4C. Thymosin. D. Both. A and C. C. Thymosin. 43. Relative to the rest of the body, the thymus is largest at blank years of age. A. 2 bits 10 circa 20 D. 50. A. 2. 44. Peyer's patches are isolated nodules of lymph tissue in the A. intestinal wall. B. Bronchial tree of the lung. C. Throat. D. Bladder and urethra. A. Intestinal wall. 45. The high concentration of protein in the thoracic duct results from the protein-rich lymph that drains from the A. skeletal muscle groups. B. Bronchial tree of the lung. C. Liver. D. Both A and C are correct. C. Liver. 46. The cisterna chyli originates in the right lymphatic duct. B. Originates in the thoracic duct. C. Is the storage area for hormones made by the thymus gland. D. Filters the chyle coming from the small intestine. B. Originates in the thoracic duct. 47. Lacteals drain into the right lymphatic duct. B. Are the lymphatics in the villi of the small intestines. C. Are able to absorb fat from the digestive system. D. Both B and C are correct. D. Both B and C are correct. 48. Which of the following is not true of lymph nodes? A. They are oval or lima bean shaped. B. They have one afferent vessel. C. They act as a biological filter. D. They are divided by trabeculae. B. They have one afferent vessel. 49. Which tonsils are known as adenoids when they become swollen? A. Lingual. B. Sublingual. C. Pharyngeal. D. Palatine. C. Pharyngeal. 50. Hassle corpuscles are part of the A. thymus. B. Spleen. C. tonsils. D. Thoracic duct. A. Thymus. 51. Which of the following is not part of the lymphatic system? A. Thymus. B. Spleen. C. Thyroid. D. Peyer's patches. C. Thyroid. 52. Which of the following is not part of the lymphatic system? A. Tonsils. B. Bone marrow. C. Liver. D. All of the above are part of the lymphatic system. C. Liver. 53. The lymph taken from what location has the highest concentration of protein? A. Thoracic duct. B. Cisterna chyli. C. Spleen. D. Thymus. A. Thoracic duct. 54. About half of the lymph flowing through the thoracic duct comes from the A. liver, B. small intestine, C. spleen, D. Both A and B are correct. D. Both A and B are correct. 55. What structure drains lymph from about 3/4 of the body into the subclavian vein? A. Right lymphatic duct. B. Thoracic duct. C. Cisterna chyli. D. Spleen. B. Thoracic duct. 56. The tonsils found at the base of the eustachian tubes are called the palatine tonsils, B. tuval tonsils, C. lingual tonsils, D. adenoids. B. tuval tonsils. C. The high degree of permeability of the lymphatic capillary wall permits very large molecules and even particulate matter, which cannot be absorbed into the blood capillary, to be removed from the interstitial space. C. Reticuloendothelial cells lining the spleen remove microorganisms from the blood, and destroy them by phagocytosis in a fashion similar to that of white blood cells. 59. Which would you predict would occur if a disease blocked the flow of lymph? A. Lymphokinesis would increase. B. Hematopoiesis would not occur. C. The liver might become enlarged or lymphedema may occur. D. The affected extremity would begin to shrink and become useless. C. The liver might become enlarged or lymphedema may occur. D. Increased external pressure from muscle contraction also increases lymphatic pressure, which results in keeping lymph moving in only one direction. A. A single cell of a primary cancer tumor can spread to other areas of the body through the lymphatic system and cause metastasis. D. Produce fewer T cells, thus reducing the effectiveness of the immune system. C. Lymph flow in the body is the result of contracting skeletal muscles. 64. Michael, a 43-year-old man, was in a serious car accident. He has a rigid and tender left hypochondrium region. His blood pressure is dropping, and he is in pain. What organ might be involved in this injury? A. Kidney. B. Liver. C. Pancreas. D. Spleen. D. Spleen. 65. Blank lymph nodes include the preaortic group that drain various digestive and the paraortic group that drain the iliac lymph nodes. A. Preauricular. B. Axillary. C. Periaortic. D. Superficial cervical. C. Periaortic. 66. The mechanism that allows tissue fluid carrying waste from the brain to drain back to the bloodstream is called the ameningeal system. B. Lymphatic system. C. Lymphokinetic system. D. Cortical system. B. Lymphatic system. 1. All of the following represent examples of nonspecific immunity except a species resistance. B. Phagocytosis. C. Cell-mediated immunity. D. Mechanical and chemical barriers. C. Cell-mediated immunity. 2. The body's first line of defense is the A. Skin. B. Mucous membranes. C. Inflammatory response. D. Both A and B are correct. D. Both A and B are correct. 3. Inflammation mediators include a histamine, B. Kinins, C. Prostaglandins, D. All of the above. D. All of the above. 4. The most numerous type of phagocyte is the A. Neutrophil, B. Histocyte, C. Microglia, D. Kupffer cell. A neutrophil. 5. The type of immune mechanism that provides a general defense by acting against anything recognized as not self is called a nonspecific immunity. B. Specific immunity. C. Autoimmune. D. None of the above. A nonspecific immunity. 6. All of the following are major types of interferon except blank interferon. A cartilage, B. leukocyte, C. immune, D. fibroblast. A cartilage. 7. Which of the following does not describe phagocytosis? A. The ingestion and destruction of microorganisms or other small particles. B. Part of the inflammatory response. C. A major component of the body's third line of defense. D. A nonspecific defense. C. A major component of the body's third line of defense. 8. Interferon inhibits the spread of viruses. B. Bacteria. C. Cancer. D. Yeast. A viruses. 9. Which type of cells is not involved in nonspecific immunity? A. Monocytes. B. Lymphocytes. C. Neutrophils. D. Macrophages. B. Lymphocytes. 10. Which of the following is not a chemical used as a chemical barrier to pathogens? A. Hydrochloric acid. B. Sebum. C. Complement. D. Hydrolyzing enzymes. C. Complement. 11. Which of the following is not a characteristic of inflammation? A. Heat. B. Redness. C. Swelling. D. All of the above are characteristics of inflammation. D. All of the above are characteristics of inflammation. 12. The ability of our immune system to attack abnormal or foreign cells but spare our own normal cells is called innate immunity. B. Nonspecific immunity. C. Self-tolerance. D. Adaptive immunity. C. Self-tolerance. 13. Adaptive immunity is also called blank immunity. A. Innate. B. Specific. C. Nonspecific. D. Species. B. Specific. 14. Which substance produced by the skin contains pathogen-inhibiting agents? A. Hydrochloric acid. B. Mucus. C. Enzymes. D. Sebum. D. Sebum. 15. Which substance can destroy pathogens by chemically hydrolyzing them? A. Hydrochloric acid. B. Mucus. C. Enzymes. D. Sebum. C. Enzymes. 16. Which substance can destroy pathogens by lowering the pH to a level at which they cannot function? A. Hydrochloric acid. B. Mucus. C. Enzymes. D. Sebum. A. Hydrochloric acid. 17. Which of the following is not part of the inflammation response? A. The release of chemicals that attract white blood cells. B. The formation of antibodies. C. The increase of blood flow to the inflamed area. D. All of the above are part of the inflammation response. B. The formation of antibodies. 18. Which of the following is not part of the inflammation response? A. The release of histamine. B. The increase in vascular permeability. C. The stimulation of fibroblast growth. D. All of the above are part of the inflammation response. D. All of the above are part of the inflammation response. A. The white blood cell engulfs the microorganism, and then lysosomal enzymes destroy it. B. Complement is activated by antibodies to drill a hole into foreign cells, thus causing cytolysis. C. It would inhibit the chickenpox infection from developing. 22. Which of the following complements are thought to be among the agents of the cytokine storm that occurs in some patients with COVID-19? A. Opsonins. B. Inflammatory. C. Alternate. D. Cascade. B. Inflammatory. 1. B-cell mechanisms are classified as blank immunity, a nonspecific B antibody-mediated C-cell mediated. D. Both A and B are correct. B antibody-mediated. 2. Macromolecules that induce the immune system to make certain responses are called antigens. B. Plasma proteins. C. Antibodies. D. Prostaglandins. Antigens. 3. Memory cells immediately secrete antibodies when they are formed. B. Are supporting cells, and are not related to antibody production. C. Are special type of T cell. D. Become plasma cells when exposed to an antigen. D. Become plasma cells when exposed to an antigen. 4. The constant region of the light chain in an antibody consists of blank amino acids. A. 50 bit 77 circa 160. 168. Circa 106. 5. An immunoglobulin, or antibody molecule, consists of blank heavy and blank light polypeptide chains. A 2. 2 bits 4. 2C2. 4D4. 4. A 2. 2. 6. The antibody normally constituting the highest percentage of antibodies in the blood is A. IgB. IgGC. IgMD. IgA. B. IgG. 7. The antibody produced after initial contact with an antigen is A. IgB. IgGC. IgMD. IgA. C. IgM. 8. The antibody commonly found in tears and saliva is A. IgB. IgDC. IgMD. IgA. D. IgA. 9. The function of which antibody is basically unknown. A. IgB. IgDC. IgMD. IgA. B. IgD. 10. The antibody associated with allergic reaction is A. IgB. IgGC. IgMD. IgA. A. Ig. 11. The major class of antibody present in the mucous membranes of the body is A. IgB. IgC. IgD. IgD. C. IgA. 12. The predominant antibody of a secondary response is A. IgB. IgGC. IgMD. IgA. B. IgG. 13. The most abundant circulating antibody, the one that normally makes up about 75% of all the antibodies in the blood, is A. IgB. IgC. IgD. IgM. A. IgG. 14. Complement can best be described as a enzyme in blood. B. Lymphokine. C. Antibody. D. Hormone. A. Enzyme in blood. 15. The complement system can be activated by the binding of complement protein 1 to the complement binding site on the antibody molecule. B. The binding of complement protein 3 to bacteria or viruses in the presence of propertin. C. Nonspecific immune mechanisms. D. All of the above. D. All of the above. 16. According to the clonal selection theory, antigens select lymphocyte clones by the chemicals secreted by the lymphocytes. B. The proximity of the lymphocytes to the antigens. C. The shape of receptors on the lymphocyte's plasma membrane. D. Producing toxins. C. The shape of receptors on the lymphocyte's plasma membrane. 17. Which of the following can activate complement? A. T cells. B. Interferon. C. Propertin. D. Lymphokine. C. Propertin. 18. Which of the following is true of lymphokines? A. They are produced by B cells. B. They inhibit macrophage activity. C. Lymphotoxin is an example of a lymphokine. D. They are produced by helper T cells. C. Lymphotoxin is an example of a lymphokine. 19. Specific immunity is controlled by two classes of lymphocytes called antigens and antibodies. B. T cells and B cells. C. Red blood cells and white blood cells. D. Agglutinogens and agglutinins. B. T cells and B cells. 20. Which of the following can activate, or turn on, an inactive B cell? A. Binding to its specific antibody. B. Binding to its specific antigen. C. Helper T cell. D. All B cells are activated when an infant is born. B. Binding to its specific antigen. 21. The part of the antibody that combines with the antigen is the A variable region. B constant region. C carbohydrate chain. D complement binding site. a variable region. 22. The chemical messengers that T cells release into inflamed tissues are called pathogens. B. Lymphokines. C. Lymphotoxins. D. Suppressor cells. B. Lymphokines. 23. The type of immunity produced by vaccination would be blank immunity. A. Active natural. B. Passive natural. C. Active artificial. D. Passive artificial. C. Active artificial. 24. When a child develops measles and acquires immunity to a subsequent infection, this type of immunity is called blank immunity. A. Acquired. B. Natural. C. Active. D. All of the above are correct. D. All of the above are correct. 25. Examples of lymphocytes are A. B cells. B. T cells. C. Both A and B. D. None of the above. C. Both A and B. 26. Macrophages sensitize A. T cells. B. B cells. C. T cells and B cells. D. None of the above. A. T cells. 27. Which antibody has 10 antigen binding sites? A. IgM. B. IgC. IgD. IgG. A. IgM. 28. Which antibody had 4 antigen binding sites? A. IgM. B. IgC. IgD. IgG. B. IgA. 29. Which antibody has 2 antigen binding sites? A. IgM. B. IgC. IgD. Both A and B. C. IgG. 30. Which of the following is not caused by complement protein activity? A. Vasodilation. B. Agglutination of antigens. C. Cytolysis. D. All of the above are caused by complement protein activity. B. Agglutination of antigens. 31. When an antigen attaches to a naive B cell, it becomes a blank cell. A memory B. Plasma. B. C. Effector. B. D. All of the above are correct. D. All of the above are correct. 32. In the first stage of their development, B cells are known by all the following terms except blank. B cells. A. Effector. B. Naive. C. Inactive. D. Virgin. A. Effector. B. The person's body is responding to the initial exposure to an antigen. 34. Systemic lupus erythematosus is an example of A. B cell-mediated condition. B. T cell-mediated condition. C. Autoimmune condition that is caused by self-antigens being attacked. D. Isoimmune condition that is caused by self-antigens being attacked. C. Autoimmune condition that is caused by self-antigens being attacked. 35. When a patient starts to have rejection problems with a transplanted organ, the problems are usually caused by a B cell-mediated condition. B. Human leukocyte antigens. C. Self-antigens. D. Severe combined immune deficiency. B. Human leukocyte antigens. 36. The human immunodeficiency virus damages the immune system by blank cells. A. Invading memory. B. Invading T. C. Overproduction of B. D. Overproduction of plasma. B. Invading T. A. After a person is infected, the signs of AIDS infection might not be apparent for years. A. The immune system sometimes reacts against foreign antigens in the grafted tissue, causing what is often called a rejection syndrome. Immune suppression drugs reduce the immune system's ability to attack the foreign antigens in the donated tissue. C. It would reduce the antigen-antibody reactions caused by the allergen. D. He developed active immunity as the result of having mumps as a child. 41. Which of the following terms applies to the severe overreactions of the immune system that involve immunity regulators called cytokines? A. Immunodeficiency. B. Cytokine storm. C. Cytokine regulation. D. Congenital immunity. B. Cytokine storm. 1. Which of the following is not characteristic of the Seeley stress syndrome? A. Adrenal atrophy. B. Shrinkage of the thymus. C. Bleeding gastrointestinal ulcers. D. Shrinkage of lymphatic organs. A. Adrenal atrophy. 2. Increased blank is characteristic of the alarm stage of stress. A. Lymphocytes. B. Glucocorticoids. C. Parasympathetic activity. D. Eosinophils. B. Glucocorticoids. 3. Which of the following is the name for the second stage of the general adaptation syndrome? A. Reinforcement. B. Transition. C. Resistance. D. Defense. C. Resistance. 4. Which of the following is not characteristic of the exhaustion stage of stress? A. It occurs less frequently than the other stages. B. It may develop over a long period of stress. C. It decreases the body's ability to adapt. D. The body's resistance eventually produces adaptation. D. The body's resistance eventually produces adaptation. 5. The level of glucocorticoids would be at their lowest during which stage of stress? A. Exhaustion. B. Alarm. C. Resistance. D. Recovery. A. Exhaustion. C. Cerebral cortex, hypothalamus, sympathetic nerve fibers, adrenal cortex. 7. All of the following are true statements except as stresses are extreme stimuli. B. Stresses are always injurious, unpleasant, or painful. C. The emotions of fear, anxiety, and grief can act as stressors. D. Stresses differ in different individuals. B. Stresses are always injurious, unpleasant, or painful. 8. An effect of cortisol is the increased protein catabolism. B. Decreased blood sugar. C. Increased immune response. D. Increased allergic reactions. A. Increased protein catabolism. 9. Which of the following would not occur as a body responds to stress? A. Increased systolic blood pressure. B. Increased epinephrine in the urine. C. Constriction of the pupils. D. Increased adrenocorticoids in the urine. C. Constriction of the pupils. 10. Which of the following would not be a useful measure for assessing stress? A. Total blood cholesterol. B. Eosinophil count. C. Lymphocyte count. D. Adrenocorticoid levels. A. Total blood cholesterol. 11 blank refers to the cumulative effect of long-term exposure to stress. A. Stress syndrome. B. Stress response. C. Allostatic load. D. Allostatic overload. C. Allostatic load. 12. Corticotrophin-releasing hormone is released by the blank in response to stress. Adrenal medulla. B. Adrenal cortex. C. Anterior pituitary. D. Hypothalamus. D. Hypothalamus. 13. In response to stress, the adrenal cortex secretes a norepinephrine. B. Norepinephrine and cortisol. C. Cortisol and aldosterone. D. Norepinephrine and aldosterone. C. Cortisol and aldosterone. 14. Severe stress may result in all of the following except A. An overactive immune system. B. An increase in heart rate. C. A rise in adrenaline levels. D. Changes in breathing patterns. A. An overactive immune system. 15. Which of the following conditions may accompany stress? A. Depression. B. Sleep disorders. C. Low blood pressure. D. Both A and B. D. Both A and B. 16. All of the following are components of the stress triad observed by Hans Selye except A. Enlarged adrenals. B. Hypertrophied skeletal muscles. C. Shrunken lymphatic organs. D. Bleeding gastrointestinal ulcers. B. Hypertrophied skeletal muscles. 17. Which of the following determine which stimuli are stressors for each individual? A. Heredity. B. Past experiences. C. Either extreme of the continuum. D. All of the above. D. All of the above. 18. The general adaptation syndrome includes all of the following stages except the A. Alarm reaction. B. Immune response. C. Stage of resistance or adaptation. D. Stage of exhaustion. B. Immune response. 19. Alarm reaction responses resulting from the hypertrophy of the adrenal cortex include A. Hyperglycemia. B. Decreased immunity. C. Decreased allergic responses. D. All of the above. D. All of the above. 20. Alarm reaction responses resulting from increased sympathetic activity include all of the following except A. Decreased digestion. B. Decreased and prolonged sympathetic responses. C. Hyperglycemia. D. Increased systolic blood pressure. B. Decreased and prolonged sympathetic responses. 21. One characteristic of the stage of resistance of the general adaptation syndrome is an increased rate of secretion by the adrenal cortex. B. Decreased allergic responses. C. Hyperglycemia. D. Normal rate of secretion by the adrenal medulla. D. Normal rate of secretion by the adrenal medulla. 22. Which of the following is characteristic of the stage of exhaustion? A. Initially increased glucocorticoid secretion but eventually marked decreased secretion. B. Loss of resistance to stressor. may lead to death. C. Stress triad. D. All of the above. D. All of the above. 23. Type A individuals have been found to be at greater risk for elevated systolic blood pressure. B. Coronary disease. C. Heart attacks. D. All of the above. D. All of the above. 24. According to the current concepts of the stress syndrome, stress may be defined as any factor that stimulates the A. posterior pituitary, B. anterior pituitary, C. hypothalamus to release CRH, D. hypothalamus to release ADH, C. hypothalamus to release CRH. 25. According to the current concepts of the stress syndrome, an example of stress that stimulate the hypothalamus indirectly would be stress stimulating the limbic lobe first. B. Stress stimulating other parts of the cerebral cortex first. C. Hypoglycemia. D. Both A and B. D. Both A and B. 26. Which of the following is a category that classifies stressful experiences? A. Positive stress. B. Tolerable stress. C. Toxic stress. D. All of these are categories that classify stressful experiences. D. All of these are categories that classify stressful experiences. 27. The stress triad refers to alarm, exhaustion, and resistance. B. Hypertrophied adrenals, atrophied thymus and lymph nodes, and bleeding ulcers. C. Stressor, stress, and response. D. Health, stress, and disease. B. Hypertrophied adrenals, atrophied thymus and lymph nodes, and bleeding ulcers. 28. Which of the following is not an alarm reaction response resulting from hypertrophy of the adrenal cortex? A. Hyperglycemia. B. Decreased digestion. C. Decreased immunity. D. Decreased allergic responses. B. Decreased digestion. 29. The anterior pituitary gland is stimulated by A. CRH. B. ACTH. ADHD. Epinephrine. A. CRH. 30. Which of the following is not an effect of cortisol? A. Increased protein catabolism. B. Decreased allergic responses. C. Fight or flight responses. D. Decreased immune responses. C. Fight or flight responses. 31. The amount of stress a person is feeling can be directly measured by an electrocardiogram. B. Measuring the amount of adrenaline in the blood. C. Measuring the systolic blood pressure. D. None of the above. D. None of the above. 32. A person with a high blood level of adrenaline would be in what stage of the general adaptation response? A. Alarm. B. Resistance. C. Exhaustion. D. Either A or C. A. Alarm. 33. Which is not a response to the release of the hormone neuropeptide Y? A. Platelet aggregation. B. Atrophy of the vascular smooth muscle. C. Vasoconstriction. D. All of the above are responses to neuropeptide Y. B. Atrophy of the vascular smooth muscle. 34. All of the following disciplines have added to our understanding of stress except genetics. The endocrinology, C. Sociology. D. All of the above disciplines have added to our understanding of stress. D. All of the above disciplines have added to our understanding of stress. 35. According to Seeley, stress can be defined as a state or condition produced by a physical trauma. B. Psychological trauma. C. Diverse noxious agents. D. Emotional trauma. C. Diverse noxious agents. 36. Release of corticotrophin-releasing hormone directly causes an increase in glucose, which corrects the hypoglycemia. B. The posterior pituitary gland to release ACTH. The release of cortisol. D. None of the above. D. None of the above. 37. Hyperglycemia is an indication that the alarm reaction response is finished and the body is moving on to the resistance stage. B. Result of sympathetic activity in the alarm reaction. C. Result of hypertrophy of the adrenal cortex in the alarm reaction. D. Both B and C are correct. D. Both B and C are correct. 38. Which of the following is an indication that a person is in the exhaustion stage? A. Dissipation of the fight or flight response. B. An increase in glucocorticoid secretions from the adrenal gland. C. Development of a bleeding ulcer in the stomach or duodenum. D. Both B and C. C. Development of a bleeding ulcer in the stomach or duodenum. A. Stress stimulates the hypothalamus to release CRH, which acts as a trigger that initiates many diverse changes in the body. C. Frequent decrease in coping skills, alteration of limbic lobe, and hypothalamus excitability. B. Stage of resistance or adaptation. D. Stress. B. Failure to adapt to repeated stress. 44. Which of the following is not a category of stressful experiences? A. Negative stress. B. Positive stress. C. Tolerable stress. D. Toxic stress. A. Negative stress. 45. A condition that can produce allostatic load include a frequent stress from multiple stressors. B. Failure to adapt to repeated stress. C. The inability to shut off allostatic responses when a threat is removed. D. All of these are conditions that can produce allostatic load. D. All of these are conditions that can produce allostatic load. 1. Which of the following does not distribute air? A. Trachea. B. Bronchus. C. Alveolus. D. Nose. C. Alveolus. 2. Which of the following is not a function of the respiratory system? A. Assists with homeostasis of body pH. B. Distributes oxygen to cells. C. Filters air. D. Warms air. B. Distributes oxygen to cells. 3. Which of the following is true of the cribriform plate? A. It separates the nasal and cranial cavities. B. It forms the lateral aspects of the nose. C. It separates the internal nose from the mouth. D. It forms a midline separation in the nasal cavity. A. It separates the nasal and cranial cavities. 4. The small openings in the cribriform plate function to allow air to move between the nostrils. B. Allow branches of the olfactory nerve to enter the cranial cavity and reach the brain. C. Provide a filtering system for the inspired air. D. Do both A and B. B. Allow branches of the olfactory nerve to enter the cranial cavity and reach the brain. 5. The external openings to the nasal cavities can be referred to as the nostrils. B. Anterior nares. C. External nares. D. All of the above. D. All of the above. 6. The upper respiratory tract includes all of the following structures except the A. Larynx. B. Trachea. C. Oropharynx. D. Nasopharynx. B. Trachea. 7. The hollow nasal cavity is separated by a midline partition called the A septum. B. Conchae. C. Cribriform plate. D. Turbinates. A septum. 8. Which of the following is not lined with a ciliatic mucous membrane? A. Vestibule. B. Posterior nares. C. Trachea. D. Primary bronchi. A. Vestibule. C. Anterior nares vestibule, inferior, middle, and superior meatus posterior nares. 10. The largest of the paranasal sinuses is the A. maxillary. B. frontal. C. ethmoid. D. sphenoid. A. maxillary. 11. The respiratory portion of the nasal passage is lined with a mucous membrane made up of blank epithelium. A. stratified columnar. B. pseudostratified columnar. C. simple squamous. D. simple columnar. B. pseudostratified columnar. 12. Paranasal sinuses are normally filled with a bone marrow. B. A serous fluid. C. Mucus. D. Air. D. Air. 13. Which of the following is not a function of the pharynx? A. Aids in forming vowel sounds. B. Provides pathway for food. C. Determines the quality of the voice. D. Provides pathway for air. C. Determines the quality of the voice. 14. Olfactory epithelium is found aligning the nasopharynx. B. Covering the superior turbinate. C. Lining the paranasal sinuses. D. And all of the above. B. Covering the superior turbinate. 15. The more common name for the pharynx is the A. throat. B. windpipe. C. voice box. D. nasal cavity. A. throat. 16. The structures that deflect air as it passes through the nose are called the choanae. B. Paranasal sinuses. C. conchae. D. vibrissae. C. conchae. B. Provide an initial filter to screen particulate matter from air that is entering the system. 18. The anatomical division of the pharynx that is located behind the mouth from the soft palate above to the level of the hyoid bone below is called the A. nasopharynx. B. oropharynx. C. laryngopharynx. D. sphenopharynx. The oropharynx. 19. The lower border of the cavity of the larynx is formed by the A. epiglottis, B. cricoid cartilage, C. glottis, D. thyroid cartilage. B. cricoid cartilage. 20. The fauces, one of the 7 openings found in the pharynx, opens into the A. oropharynx, B. nasopharynx, C. esophagus, D. Both A and B are correct. A. oropharynx. 21. The structure in the neck known as the Adam's apple is the A. epiglottis, B. cricoid cartilage, C. glottis, D. thyroid cartilage. D. thyroid cartilage. 22. The eustachian tube connects the middle ear with the A. trachea, B. nose, C. nasopharynx, D. oropharynx. C. nasopharynx. 23. The small, leaf-shaped cartilage behind the tongue and hyoid bone is the A. cricoid cartilage, B. thyroid cartilage, C. corniculate cartilage, D. epiglottis. D. epiglottis. 24. The approximate length of the trachea, or windpipe, is blank cm. A. 5 bits 11 circa 17 d. 24. B. 11. 25. Which of the following is true of the intrinsic muscles of the larynx? A. Their origin is the hyoid bone. B. They move the larynx as a whole. C. They serve in voice production. D. Both A and B are correct. C. They serve in voice production. 26. The smallest branches of the bronchial tree are A. primary bronchi, B. secondary bronchi, C. tertiary bronchi, D. bronchioles. D. bronchioles. 'D'. Raising the ribs decreases the depth and width of the thorax. 28. Gas exchange, the lungs' main and vital function, takes place in the A. bronchioles, B. secondary bronchi, C. primary bronchi, D. alveoli. D. alveoli. 29. The function of surfactant is to transport oxygen from the air to the blood, B. transport carbon dioxide from the blood to the air, C. prevent each alveolus from collapsing as air moves in and out during respiration, D. trap foreign particles as they enter the bronchial tree, C. prevent each alveolus from collapsing as air moves in and out during respiration. 30. In the right lung, the superior and middle lobes are separated by the A. horizontal fissure, B. oblique fissure, C. bronchopulmonary segments, D. hilum. A horizontal fissure. 31. The divisions of the thoracic cavity include all of the following except the A. left pleural cavity, B. right pleural cavity, C. respiratory cavity, D. mediastinum. C. respiratory cavity. 32. Which of the following is not a paranasal sinus? A. Frontal, B. Maxillary, C. Mandibular, D. Sphenoid. C. Mandibular. 33. Which of the following is not a subdivision of the thoracic cavity? A. Left pleural division. B. Right pleural division. C. Medial pleural division. D. Mediastinum. C. Medial pleural division. C. The longer a cilia is exposed to a toxin, the more effectively it moves to expel it. 35. Which of the following is not an accessory structure of the respiratory system? A. Oral cavity. B. Trachea. C. Ribcage. D. Diaphragm. B. Trachea. 36. Cellular respiration occurs in the alveoli. B. On the red blood cell. C. In the mitochondria. D. In both A and B. C. In the mitochondria. 37. The vomeronasal organ A is the structure that joins the nasal cavity and the vomer bone. B is vestigial with no known function in the adult. C may be able to respond to complex chemicals called pheromones. D. Both A and C are correct. D. Both A and C are correct. 38. Air inhaled through the mouth would be blank than air inhaled through the nose. A warmer B. Dirtier. C. Moister. D. All of the above are correct. B. Dirtier. 39. The length of the pharynx is about blank cm. A. 3.5 bits. 8.5 circa 12.5 D. 17.5 circa 12.5. 40. Which of these is not an opening in the pharynx? A. Trachea. B. Eustachian tube. C. The fauces. D. Esophagus. A. Trachea. 41. Which of these structures is not a part of the glottis? A. True vocal cords. B. Rima glottata. C. False vocal cords. D. Both B and C. C. False vocal cords. 42. Which of the following is a paired cartilage in the larynx? A. Thyroid. B. Cuneiform. C. Epiglottis. D. None of the above. B. Cuneiform. 43. Which of the following is not part of the respiratory membrane? A. Ciliated respiratory mucosa. B. Alveolar epithelium. C. Capillary epithelium. D. All of the above are part of the respiratory membrane. A. Ciliated respiratory mucosa. 44. Ciliated cells lining the respiratory tract help move air into and out of the lungs. B. Trap and phagocytize microorganisms. C. Help move the mucus blanket toward the pharynx. D. Do both B and C. C. Help move the mucus blanket toward the pharynx. 45. The total number of lobes in both lungs is A. 6. B. 5 circa 4D. 3. B. 5. 46. Which of these structures is not part of the lower respiratory tract? A. Larynx. B. Trachea. C. Lungs. D. All of the above are part of the lower respiratory tract. A. Larynx. 47. Which of the following is not part of the external portion of the nose? A. Nasal bones B. Palatine bone C. Alar cartilages D. All of the above are part of the external portion of the nose. B. Palatine bones. 48. The cribriform plate is part of the A. Nasal bone, B. Palatine bone, C. Ethmoid bone, D. Nasal conchae. C. Ethmoid bone. 49. Which of these structures is not part of the nasal septum? A. Perpendicular plate of the ethmoid bone B. Vomer bone C. Vomeronasal cartilage D. All of the above are part of the nasal septum. D. All of the above are part of the nasal septum. 50. Which of the following is not a characteristic of the paranasal sinuses? A. They are air-filled. B. They are named after the bones in which they are located. C. They drain or open into the oropharynx. D. All of the above are true of the paranasal sinuses. C. They drain or open into the oropharynx. 51. At the level of the hyoid bone, the alaryngopharynx becomes the esophagus. The oropharynx becomes the laryngopharynx. C. Nasopharynx becomes the oropharynx. D. Nasopharynx becomes the laryngopharynx. The oropharynx becomes the laryngopharynx. 52. Which is a pyramid-shaped cartilage that is an attachment point of the vocal cords? A. Arytenoid B. Thyroid C. Epiglottis D. Adam's apple. A. Arytenoid. 53. Which is the most proximal part of the air distribution system that no longer contains cartilage? A. Primary bronchi B. Secondary bronchi C. Bronchioles D. Alveolar ducts. C. Bronchioles. 54. For purposes of study, the respiratory system can be divided into what two parts? A. Air distribution and gas exchange B. Upper respiratory tract and lower respiratory tract C. Trachea and lungs D. Cranial and thoracic. B. Upper respiratory tract and lower respiratory tract. 55. The more correct name for a sore throat is rhinitis. B. Laryngitis. C. Pharyngitis. D. Tonsillitis. C. Pharyngitis. 56. Which of these is the only opening to the oropharynx? A. The fauces B. Eustachian tube C. Posterior nares D. The esophagus. A. The fauces. 57. Which pair of tonsils is located in the oropharynx? A. Pharyngeal tonsils B. Palatine tonsils C. Lingual tonsils D. Both B and C. D. Both B and C. 58. Which pair of tonsils is located in the nasopharynx? A. Pharyngeal tonsils B. Palatine tonsils C. Lingual tonsils D. Both B and C. A. Pharyngeal tonsils. 59. Gas exchange occurs across the A. respiratory mucosa, B. respiratory membrane, C. visceral pleura, D. pulmonary membrane. B. respiratory membrane. 60. Which of these structures is not found in the left lung? A. Oblique fissure. B. Secondary bronchi entering the superior lobe. C. Secondary bronchi entering the inferior lobe. D. Horizontal fissure. D. Horizontal fissure. B. Turbinate surface baffles to provide a large, mucus-covered surface area over which air must pass before reaching the pharynx. B. Surfactant helps reduce surface tension within the alveoli, thus preventing each alveolus from collapsing as air moves in and out during respiration. C. The right bronchus is slightly larger and more vertical than the left. This anatomical fact helps explain why aspirated foreign objects frequently lodge in the 1. Which of the following is not a regulated process associated with the functioning of the respiratory system? A. Transport of gases. B. Gas exchange in lungs and tissues. C. Control of cell metabolism rate. D. Pulmonary ventilation. C. Control of cell metabolism rate. 2. Standard atmospheric pressure is blank mmHg. 650 bit 700 circa 760 d. 800 circa 760. 3. Boyle's law states that the volume of a gas varies blank with pressure at a blank temperature. A directly. Constant. B inversely. Constant. C directly. Constantly changing. D inversely. Constantly changing. B inversely. Constant. 4. Which muscles are used for forced expiration? A. Sternocleidomastoid and abdominal muscles. B. Sternocleidomastoid and intercostal. C. External intercostals and pectoralis muscles. D. Abdominal muscles and internal intercostals. D. Abdominal muscles and internal intercostals. 5. When the pressure in the lung is greater than atmospheric pressure, A. Inspiration occurs. B. Expiration occurs. C. Lung tissue has collapsed. D. The bronchioles are obstructed. B. Expiration occurs. B. Inspiratory reserve volume, tidal volume, and expiratory reserve volume. 7. The term used to describe the volume of air exchanged during normal inspiration and expiration is inspiratory and expiratory reserve volume. B. Vital capacity. C. Tidal volume. D. Residual volume. C. Tidal volume. 8. During inspiration, the expansion of the lungs causes a cohesion of visceral and parietal pleura. B. A pressure gradient from alveoli to atmosphere. C. A decrease in alveolar pressure. D. An increase in intrathoracic pressure from about -6 to -4 mm Hg. C. A decrease in alveolar pressure. A maximum volume of air that can be moved into and out of the lungs during forced respiration. 10. Excessive fluid in the pleural cavity would be most likely to cause a increased residual volume. B. Decreased vital capacity. C. Increased functional reserve volume. D. Decreased tidal volume. B. Decreased vital capacity. 11. Which of the following constitutes total lung volume? A. Residual volume and vital capacity B. Tidal volume, inspiratory reserve volume, and expiratory reserve volume C. Residual volume and tidal volume D. Vital capacity and tidal volume. A. Residual volume and vital capacity. 12. If the tidal volume of a given individual is 500 milliliters, then the anatomical dead space is approximately blank ml. A. 50 bits 100 circa 150 d. 200. Circa 150. 13. A type of breathing characterized by gradually increasing tidal volume for several breaths followed by several breaths with gradually decreasing tidal volume is a dyspnea. B. Apnea. C. Biobreathing. D. Cheyne-Stokes respiration. D. Cheyne-Stokes respiration. 14. Normal, quiet breathing is known as orthopnea. B. Hyperpnea. C. Dyspnea. D. Eupnea. D. Eupnea. 15. Which type of breathing is characterized by repeated sequences of deep gasps and apnea, and is usually seen in people with increased intracranial pressure? A. Hyperpnea. B. Dyspnea. C. Bios breathing. D. Eupnea. C. Bios breathing. 16. Labored or difficult breathing is known as apnea. B. Hyperpnea. C. Dyspnea. D. Eupnea. C. Dyspnea. Because a reflex slowing of respirations. A. Increased PCO2, decreased arterial pressure, decreased pH, decreased PO2. 19. Which muscle is not used in quiet inspiration? A. Serratus anterior. B. External intercostal muscle. C. Diaphragm. D. Neither A nor B. A. Serratus anterior. 20. Which muscle is used in quiet expiration? A. Internal intercostals. B. External intercostal. C. Abdominal muscles. D. None of the above. D. None of the above. 21. Which of the following will cause brief apnea? A. Sudden painful stimulus. B. Increase in carbon dioxide in the blood. C. Sudden cold stimulus applied to the skin. D. Both A and C. D. Both A and C. 22. The tendency of the thorax and lungs to return to the pre-inspiration volume is called a compliance. B. Elastic recoil. C. Expiration. D. Ventilation. B. Elastic recoil. 23. Which gas law deals with the solubility of gases in solution? A. Dalton. B. Henry. C. Boyle. D. Charles. B. Henry. 24. Alveolar ventilation is inspired air minus A. Anatomical dead airspace. B. Tidal volume. C. Reserve volume. D. Residual volume. A. Anatomical dead airspace. 25. The amount of air left in the lung after a normal expiration is called a anatomical dead airspace. B. Physiological dead airspace. C. Functional residual capacity. D. Vital capacity. C. Functional residual capacity. 26. If the tidal volume were 600 milliliters, the alveolar ventilation would be about blank ml. A. 550 bits 400 circa 300 D. 250. B. 400. 27. The inspiratory center is located in what part of the nervous system? A. Pons. B. Medulla. C. Cerebellum. D. Cerebrum. B. Medulla. 28. The apneustic center is located in what part of the nervous system? A. Pons. B. Medulla. C. Cerebellum. D. Cerebrum. A. Pons. 29. Internal respiration can be defined as the exchange of gases between the lung and the blood capillaries in the lung. B. Pulmonary ventilation. C. The exchange of gases between the blood capillaries and the tissue cells. D. Both A and B. C. The exchange of gases between the blood capillaries and the tissue cells. 30. External respiration can be defined as the exchange of gases between the lung and the blood capillaries in the lung. B. Pulmonary ventilation. C. The exchange of gases between the blood capillaries and the tissue cells. D. Both A and B. D. Both A and B. B. When atmospheric pressure is greater than the pressure within the lungs, air flows down this gas pressure gradient. Then air moves from the atmosphere into the lungs. 1. The approximate partial pressure of oxygen at standard atmospheric pressure is about blank mmHg. 23 bits 160 circa 300 D. 590. B. 160. B. Lower atmospheric pressure lowers the PO2 and the diffusion gradient between the blood and the atmosphere is less. B. Directly related to the concentration of that gas in the mixture and D. All of the above help determine the amount of oxygen that diffuses into the blood each minute. 5. By the time the blood leaves the lung capillaries to return to the heart, what percentage of the blood's hemoglobin has united with oxygen? A. 55%. B. 63%. Circa 82%. D. 97%. D. 97%. 6. 100 milliliters of arterial blood contains approximately what volume percent of oxygen? A. 10%. B. 15%. Circa 20%. D. 25%. Circa 20%. 7. Which of the following would have the greatest accelerating effect on the dissociation of oxygen from hemoglobin? A. Increased PO2. B. Decreased PCO2. C. Decreased PO2 and decreased PCO2. D. Decreased PO2 and increased PCO2. D. Decreased PO2 and increased PCO2. 8. The major form by which carbon dioxide is transported in the circulatory system is in solution. B. As bicarbonate ions. C. As carbaminohemoglobin. D. None of the above. B. As bicarbonate ions. 9. Which of the following is not a means of transporting oxygen in the blood? A. As oxyhemoglobin B. Combined with the bicarbonate ion C. Dissolved in the plasma D. All of the above are used to transport oxygen in the blood. B. Combined with the bicarbonate ion. D. Bicarbonate ion, carbaminohemoglobin, and dissolved in plasma. 11. The symbol HbNCOH is used for a carbonic anhydrase. B. Carbaminohemoglobin. C. The heme group. D. The bicarbonate ion. B. Carbaminohemoglobin. 12. The pCO2 in the atmosphere is less than in the alveolar air. B. Greater than in the alveolar air. C. Equal to the alveolar air. D. Greater than arterial blood. A. Less than in the alveolar air. 13. The pCO2 in alveolar air is blank blood. A. Less than in the systemic venous. B. Greater than in the systemic venous. C. Equal to the systemic arterial. D. Both A and C are correct. D. Both A and C are correct. 14. A drop in the body's production of carbonic anhydrase would hinder the formation of a carbonic acid. B. Oxyhemoglobin. C. Carbaminohemoglobin. D. All of the above are correct. A carbonic acid. 15. Each hemoglobin molecule can carry how many oxygen molecules? A. 1b. 2c. 4d. 8. C. 4. 16. Each hemoglobin molecule can carry how many carbon dioxide molecules? A. 2 bits. 4c. 8d. Hemoglobin cannot carry carbon dioxide molecules. B. 4. B. Anything that decreases alveolar PO2 tends to decrease the alveolar blood oxygen pressure gradient, and, therefore, tends to decrease the amount of oxygen entering the blood. 18. About 98.5% of the oxygen carried by systemic arterial blood is attached to a bicarbonate ions. B. Hemoglobin. C. Carbaminohemoglobin. D. Chloride ions. B. Hemoglobin. 1. The walls of the GI tract are composed of blank layers of tissue. A 2 bits 3C4D5. C4. 2. All of the following are classified as accessory organs of the digestive system except the A. Tongue. B. Mouth. C. Liver. D. Pancreas. B. Mouth. 3. Which of the following organs has a mucosa layer composed of stratified squamous epithelium that resists abrasion? A. Esophagus. B. Stomach. C. Small intestine. D. Large intestine. A. Esophagus. 4. The flap of tissue suspended from the midpoint of the posterior border of the soft palate is the A. fauces. B. frenulum. C. uvula. D. gingiva. C. uvula. 5. The type of tissue designed for absorption and secretion found throughout much of the GI tract is blank epithelium. A. Simple columnar. B. Stratified squamous. C. Simple squamous. D. Pseudostratified. A. Simple columnar. 6. The hard palate consists of portions of the 4 bones, 3 maxilla and 1 palatine. B. 2 bones, 1 maxilla and 1 palatine. C. 4 bones, 2 maxilla and 2 palatines. D. 2 bones, 2 palatines. C. 4 bones, 2 maxilla and 2 palatines. 7. An incision into the wall of the GI tract would cut, in order, from superficial to deep mucosa, submucosa, muscularis, and serosa. B. Serosa, submucosa, muscularis, and mucosa. C. Serosa, muscularis, submucosa, and mucosa. D. Muscularis, submucosa, mucosa, and serosa. C. Serosa, muscularis, submucosa, and mucosa. 8. Which of the following organs has a mucosal layer that is composed of columnar epithelium with a brush border of microvilli to enhance absorption? A. Esophagus. B. Large intestine. C. Small intestine. D. Stomach. C. Small intestine. 9. The more common term for deglutition is a chewing. B. Swallowing. C. Mechanical digestion. D. Vomiting. B. Swallowing. C. Extrinsic muscles insert into the tongue but have their origin. 11. Approximately how much saliva do the 3 pairs of compound tubuloalveolar glands secrete each day? A. 200 milliliters. B. 500 milliliters, circa 750 milliliters. D. 1 liter. D. 1 liter. 12. The numerous small elevations on the surface of the tongue that support taste buds are called the cilia. B. Rugae. C. Villi. D. Papillae. D. Papillae. 13. Which of the following papillae of the tongue lack taste buds? A. Vellic. B. Fungiform. C. Filiform. D. Lingual. C. Filiform. 14. The substance that forms the outer covering of the neck and root of a tooth is enamel. B. Dentin. C. Cementum. D. Pulp. C. Cementum. 15. Which of the following salivary glands produces only a mucus type of saliva? A. Sublinguals. B. Parotids. C. Submandibulars. D. Both A and B. A. Sublinguals. 16. The greatest proportion of the tooth shell consists of enamel. B. Dentin. C. Gingivae. D. Cementum. B. Dentin. 17. A permanent set of teeth normally consists of blank teeth. A. 26 bits 30 circa 32. D. 36. Circa 32. 18. Under normal conditions, how many deciduous teeth are there? A. 16 bits 20 circa 24. D. 32. B. 20. 19. The tooth type that is not part of a deciduous set of teeth is incisors. B. Canines. C. Second molars. D. Premolars. D. Premolars. 20. Which of the following structures controls the opening of the stomach into the small intestine? A. Fundus. B. Cardiac sphincter. C. Pyloric sphincter. D. Body. C. Pyloric sphincter. 21. In the stomach, hydrochloric acid is secreted by the A. Chief cells, B. Parietal cells, C. Lymph nodules, D. Both A and B are correct. B. Parietal cells. 22. Hydrochloric acid is released from cells in the A. Stomach, B. Pancreas, C. Small intestine, D. Large intestine, E. All of the above are correct. A stomach. 23. The chief cells in the stomach secrete a gastrin, B. Mucus, C. Intrinsic factor, D. Digestive enzymes. D. Digestive enzymes. 24. Which of the following is not associated with the large intestine? A. Pyloric sphincter. B. Cecum. C. Appendix. D. Transverse colon. A. Pyloric sphincter. 25. The contents of the stomach are emptied into the A. Duodenum, B. Ileum, C. Jejunum, D. Cecum. A duodenum. 26. Which of the following is not a duct leading from the salivary glands to the oral cavity? A. Wharton ducts. B. Ranvier ducts. C. Stenson ducts. D. Ravanus duct. B. Ranvier ducts. 27. Which of the following is not a function of the stomach? A. It serves as a reservoir for storage of food. B. It destroys pathogenic bacteria. C. It begins the absorption of proteins. D. All of the above are functions of the stomach. C. It begins the absorption of proteins. 28. The lamina propria is found in which level of the GI wall? A. Mucosa. B. Submucosa. C. Muscularis. D. Serosa. A. Mucosa. 29. The mesenteric plexus is found in which layer of the GI wall? A. Mucosa. B. Submucosa. C. Muscularis. D. Serosa. C. Muscularis. 30. Meissner plexus is found in which layer of the GI wall? A. Mucosa. B. Submucosa. C. Muscularis. D. Serosa. B. Submucosa. 31. Heartburn is often caused by acid reflux. Which of the following might aggravate the reflux? A. Smoking. B. Obesity. C. Spicy foods. D. All of the above. D. All of the above. 32. Which of the following is not a division of the stomach? A. Ruchi. B. Body. C. Pylorus. D. Fundus. A. Ruchi. 33. Which of the following is not a function of the stomach? A. Secretes gastric juices. B. Secretes intrinsic factor. C. Produces the hormone gastrin. D. Begins deglutition. D. Begins deglutition. C. They form a tube through the body called the alimentary canal. 35. Which of the following is not made up of nerves running through the walls of the digestive system? A. Meissner plexus. B. Auerbach plexus. C. Intramural plexus. D. All of the above are nerves running through the walls of the digestive system. D. All of the above are nerves running through the walls of the digestive system. 36. The oral fissure divides the A. upper lip from the lower lip. B. cheek muscle from the teeth. C. right and left sides of the palate. D. right side of the tongue from the left side of the tongue. A. upper lip from the lower lip. 37. Which structure helps anchor the tongue to the floor of the mouth? A. Philtrum. B. Plica fimbriata. C. Frenulum. D. Fauces. C. Frenulum. 38. Which of the following is not a main part of the tooth? A. Crown. B. Enamel coat. C. Root. D. Neck. B. Enamel coat. 39. Which part of the stomach actually lies above the entrance of the esophagus? A. Fundus. B. Pylorus. C. Body. D. Lesser curvature. A. Fundus. 40. The fauces opens into the A. larynx. B. laryngopharynx. C. oropharynx. D. nasopharynx. C. oropharynx. 41. Dentin comes in direct contact with what substance above the gum line? A. Enamel. B. Cementum. C. The periodontal membrane. D. Both B and C. A. Enamel. 42. Dentin comes into direct contact with what substance below the gum line? A. Enamel. B. Cementum. C. The periodontal membrane. D. Both B and C. B. Cementum. 1. After leaving the stomach, food enters the A. large intestine. B. small intestine. C. esophagus. D. rectum. B. small intestine. 2. The longest portion of the small intestine is the A. duodenum. B. ileum. C. jejunum. D. colon. B. ileum. 3. Which of the following is not an anatomical part of the small intestine? A. Duodenum. B. Cecum. C. Ileum. D. Jejunum. B. Cecum. 4. Which of the following structures is anatomically the longest? A. Esophagus. B. Duodenum. C. Jejunum. D. Ileum. D. Ileum. 5. The part of the colon that lies in the vertical position, on the left side of the abdomen, extending from a point below the stomach and spleen to the level of the iliac crest is the blank colon. A. ascending. B. transverse. C. descending. D. sigmoid. C. descending. 6. The proper anatomical order for the divisions of the colon is a descending, transverse, sigmoid, and ascending. B. Ascending, transverse, sigmoid, and descending. C. Sigmoid, ascending, transverse, and ascending. D. Ascending, transverse, descending, and sigmoid. D. Ascending, transverse, descending, and sigmoid. 7. Microvilli can be found in the A. Stomach. B. Small intestine. C. Large intestine. D. Both B and C are correct. D. Both B and C are correct. 8. The right angle between the transverse colon and the ascending colon is the A. Costal angle. B. Hepatic flexure. C. Left colonic bend. D. Splenic flexure. B. Hepatic flexure. 9. A barium enema study is used to detect and locate a polyps. B. Tumors. C. Diverticula. D. All of the above. D. All of the above. 10. The fan-shaped projection of peritoneum that connects the small intestine to the posterior abdominal wall is the A. Visceral peritoneum. B. Greater omentum. C. Lesser omentum. D. Mesentery. D. Mesentery. 11. Phagocytic cells lining liver sinusoids are called blank cells. Achieve B. Alpha C. Kupfer. D. Hepatic. C. Kupfer. 12. Bile salts aid in the digestion and absorption of fats. B. Proteins. C. Carbohydrates. D. Calcium, magnesium, and certain other minerals. Fats. 13. Surgical removal of the gallbladder is referred to as a cholelithiasis. B. Cholecystitis. C. Cholecystectomy. D. Choledocography. C. Cholecystectomy. 14. The most essential part of bile is bile salts. B. Bile pigments. C. Cholesterol. D. Bilirubin. Bile salts. 15. Bile is secreted by parietal cells. B. Crypts of Leberkuhn. C. Kupfer cells. D. Hepatic cells. D. Hepatic cells. 16. Which of the following is not a lobe of the liver? A. Right lobe. B. Medial lobe. C. Left lobe. D. Caudate lobe. E. Quadrate lobe. B. Medial lobe. 17. Which of the following is not a function of the liver? A. Detoxification. B. Secretion of insulin. C. Storage of iron and vitamins. D. Production of bile. B. Secretion of insulin. 18. Which of the following organs is classified as a dual gland? A. Gallbladder. B. Liver. C. Pancreas. D. Both A and C. C. Pancreas. 19. The hormone glucagon is produced by acinar units. B. Beta cells. C. Alpha cells. D. Brunner glands. C. Alpha cells. 20. The cells that produce insulin are known as acinar units. B. Beta cells. C. Alpha cells. D. Brunner glands. B beta cells. 21. Which of the following is not a function of the pancreas? A. It produces digestive enzymes. B. It produces bile. C. It produces insulin. D. All of the above are functions of the pancreas. B. It produces bile. 22. The right angle formed by the transverse colon and the descending colon is called the ahepatic flexure. B. Sigmoid colon. C. Splenic flexure. D. Secondary colonic flexure. C. Splenic flexure. D. None of the above are true statements. D. The gallbladder empties bile into the stomach to assist in fat digestion. (25) Which of the following is not a function of the liver? A. Stores vitamin A-B. Carries on numerous steps in the metabolism of fats, carbohydrates, and proteins. C. Secretes bile. D. Stores bile. D. Stores bile. D. It is made in liver, stored in the gallbladder, and emptied into the duodenum. D. They are changed into non-toxic compounds by a series of chemical reactions. 28. The common bile duct merges with the pancreatic duct, forming an expansion called the A major duodenal papilla. B. Greater omentum. C. Hepatopancreatic ampulla. D. Hepatic flexure. C. Hepatopancreatic ampulla. 1. Which of the following is not one of the openings that must be blocked when food moves from the pharynx into the esophagus? A. Oropharynx. B. Nasopharynx. C. Larynx. D. Mouth. A. Oropharynx. 2. The process of swallowing is known as a mastication. B. Deglutition. C. Peristalsis. D. Segmentation. B. Deglutition. 3. Which of the following is a true statement? A. The oral stage of swallowing is involuntary and under the control of the cerebral cortex. B. The pharyngeal stage of deglutition is voluntary. C. The esophageal stage of swallowing is involuntary. D. Both B and C are correct. C. The esophageal stage of swallowing is involuntary. 4. Which of the processes of mechanical digestion involves the esophagus? A. Deglutition. B. Peristalsis. C. Churning. D. Both A and B. D. Both A and B. 5. The enterogastric reflex causes a secretion of digestive enzymes in the small intestine. B. Secretion of digestive enzymes in the stomach. C. Inhibition of gastric peristalsis. D. Acceleration of gastric peristalsis. C. Inhibition of gastric peristalsis. 6. Which of the following is not true of enzymes? A. They accelerate chemical reactions. B. They change chemically and are in the end products of the reaction. C. They are vital to chemical reactions. D. Many contain vitamins in their structure. B. They change chemically and are in the end products of the reaction. 7. Which step of deglutition is under voluntary control? A. Oral stage. B. Pharyngeal stage. C. Esophageal stage. D. Gastric phase. A. Oral stage. 8. The purpose of peristalsis is to break apart chunks of food and mix it in digestive juices. B. Propel food forward along the GI tract. C. Absorb food. D. Enable swallowing. B. Propel food forward along the GI tract. 9. The hormone that inhibits gastric muscle, slowing passage of food into the duodenum, is called a gastric inhibitory peptide. B. Interrogastrone. C. chyme. D. cholecystokinin. A gastric inhibitory peptide. 10. Structurally, enzymes are lipids. B. Carbohydrates. C. Proteins. D. Inorganic compounds. C. Proteins. 11. When classified according to the kind of chemical reactions catalyzed, digestive enzymes are referred to as blank enzymes. A. Oxidation reduction. B. Hydrolyzing. C. Phosphorylating dehydrase. B. Hydrolyzing. 12. Hydrolysis refers to a breaking down a molecule of water to hydrogen and oxygen gas. B. Using water to split larger compounds into smaller ones. C. Using water to build larger compounds from smaller ones. D. None of the above. B. Using water to split larger compounds into smaller ones. 13. Polysaccharides are hydrolyzed into disaccharides by enzymes known as lipase. B. Proteases. C. Maltase. D. Amylase. D. Amylase. A. Most enzymes catalyze a chemical reaction in only one direction. 15. The final product of carbohydrate digestion is a disaccharide. B. Monosaccharide. C. Polysaccharide. D. Fatty acid. B. Monosaccharide. 16. Which of the following is a disaccharide? A. Glucose. B. Starch. C. Sucrose. D. Glycogen. C. Sucrose. 17. The major final product that results from the digestion of carbohydrates is a glucose. B. Sucrose. C. Lactose. D. Maltose. A glucose. 18. The process of fat emulsification consists of chemically breaking down fat molecules. B. The secretion of digestive juices for fat digestion. C. Absorption of fats. D. Breaking fats into small droplets. D. Breaking fats into small droplets. 19. The enzyme pepsin begins the digestion of carbohydrates. B. Protein. C. Fat. D. Nucleic acids. B. Protein. 20. An end product of fat digestion is a glycerol. B. Glucose. C. Glycogen. D. Galactose. A glycerol. 21. Cellulose is a residue of digestion that comes from a carbohydrates. B. Meat proteins. C. Undigested fats. D. Undigested connective tissue. A. Carbohydrates. 22. The hormone that stimulates the release of bicarbonate substance from the pancreas is the enterogastrone. B. Secretin. C. Gastrin. D. Cholecystokinin pancreasamin. B. Secretin. 23. The hormone that stimulates the gallbladder to release bile is the enterogastrone. B. Insulin. C. Gastrin. D. Cholecystokinin. D. Cholecystokinin. 24. Which phase of gastric secretion is stimulated by the sight, taste, and smell of food? A. Intestinal phase. B. Cephalic phase. C. Gastric phase. D. All of the above. B. Cephalic phase. 25. The major site for the absorption of the end products of digestion is the A. Stomach. B. Small intestine. C. Cecum. D. Large intestine. B. Small intestine. 26. The sodium cotransport or coupled transport acts to transport sodium ions and glucose molecules blank the GI lumen. A. Passively out of. B. Passively into. C. Actively out of. D. Actively into. A. Passively out of. 27. The intestinal hormone cholecystokinin causes the pancreas to increase exocrine secretions high in enzyme content. B. Opposes the influence of gastrin on gastric parietal cells. C. Stimulates the contraction of the gallbladder. D. Does all of the above. D. Does all of the above. 28. Bicarbonates are useful in the GI tract to neutralize hydrochloric acid. B. Break down fats. C. Activate secretin. D. Activate pepsin. A. Neutralize hydrochloric acid. 29. The hormone thought to be a messenger causing release of digestive enzymes from the intestinal mucosa is a vasoactive intestinal peptide. B. Enterogastrone. C. Secretin. D. Cholecystokinin pancreasamin. A vasoactive intestinal peptide. 30. Chylomicrons are formed to facilitate the transport of amino acids. B. Fats. C. Glucose. D. Vitamins. B. Fats. 31. Glucose moves from the GI tract into the circulatory system by the process of a diffusion. B. Cotransport. C. Facilitated diffusion. D. Filtration. B. Cotransport. 32. Which blood vessel carries absorbed food from the GI tract to the liver? A. Hepatic artery. B. Renal vein. C. Hepatic portal vein. D. Renal artery. C. Hepatic portal vein. 33. Rotavirus can cause what life-threatening condition in infants? A. Constipation. B. Diarrhea. C. Cholera. D. Pyloric stenosis. B. Diarrhea. 34. The substances absorbed into the lymphatic vessels are glycerol and fatty acids. B. Glucose and glycerol. C. Amino acids and fatty acids. D. Glucose and amino acids. a glycerol and fatty acids. 35. Which of these is not an example of mechanical digestion? A. Moistening the food. B. Changing food from large to small particles. C. Propelling food through the digestive tract. D. All of the above are examples of mechanical digestion. A. Moistening the food. 36. Which of the following does not cause a decrease in gastric peristalsis? A. The release of GIP. B. Increased deglutition. C. Acid in the duodenum. D. Distension of the duodenum. B. Increased deglutition. 37. An end product of the action of the enzyme phospholipase is a colipase. B. A triglyceride. C. A free fatty acid. D. Both B and C. C. A free fatty acid. 38. Which of the following is not a barrier to the absorption of glucose? A. Size of the molecule. B. The molecule's hydrophilia. C. The molecule's hydrophobia. D. Cell membrane's high concentration of lipids. C. The molecule's hydrophobia. 39. Which of the following is not true of segmentation? A. It moves food back and forth in one segment of the GI tract. B. It moves food through the GI tract. C. It facilitates absorption. D. It mixes food with digestive juices. B. It moves food through the GI tract. 40. The enzyme amylase functions best in a blank pH: A slightly acid. B. Slightly base. C. Neutral. D. Both A and C are correct. D. Both A and C are correct. 41. Contact digestion occurs in which location in the digestive system? A. Mouth. B. Esophagus. C. Stomach. D. Small intestine. D. Small intestine. 42. The disaccharide maltose is made up of which two saccharide units? A. Glucose and glucose. B. Glucose and fructose. C. Glucose and galactose. D. None of the above. A. Glucose and glucose. 43. The disaccharide lactose is made up of which two saccharide units? A. Glucose and glucose. B. Glucose and fructose. C. Glucose and galactose. D. None of the above. C. Glucose and galactose. 44. The disaccharide sucrose is made up of which two saccharide units? A. Glucose and glucose. B. Glucose and fructose. C. Glucose and galactose. D. None of the above. B. Glucose and fructose. 45. The process of emulsification is important in the digestion of a proteins. B. Fats. C. Polysaccharides. D. Disaccharides. B. Fats. 46. Saliva contains all of the following substances except amylase. B. Lipase. C. Intrinsic factor. D. Mucus. C. Intrinsic factor. 47. Gastric juice contains all of the following substances except intrinsic factor. B. Enterokinase. C. Hydrochloric acid. D. Pepsin. B. Enterokinase. 48. Pancreatic juice contains all of the following substances except amylase. B. Trypsinogen. C. Enterokinase. D. Lipase. C. Enterokinase. 49. Bile contains all of the following substances except bile salts. B. Lecithin. C. Amylase. D. Bilirubin. C. Amylase. 50. Pancreatic juice contains all of the following substances except chymotrypsin. B. Nucleases. C. Amylase. D. Pepsinogen. D. Pepsinogen. 51. Digestion uses the following methods in which order to accomplish its function? A. Ingestion, absorption, secretion. B. Ingestion, secretion, absorption. C. Absorption, secretion, ingestion. D. Absorption, ingestion, secretion. B. Ingestion, secretion, absorption. 52. The most important function of the digestive system is elimination. B. Absorption. C. Motility. D. Secretion. Elimination. 53. The first phase of deglutition or swallowing occurs in the A. Pharynx. B. Larynx. C. Esophagus. D. None of the above are correct. D. None of the above are correct. 54. Which of the following structures is not used to block an opening during swallowing? A. Glottis. B. Epiglottis. C. Soft palate and uvula. D. Tongue. A. Glottis. 55. Segmentation is different from peristalsis because a segmentation only occurs in the stomach. B. It is a type of mechanical digestion. C. It does not move food through the digestive tract. D. There is no difference between segmentation and peristalsis. C. It does not move food through the digestive tract. 56. Which of the following works with gastric inhibitory peptide to inhibit gastric peristalsis? A. Retropulsion. B. Cholecystokinin. C. The enterogastric reflex. D. Both B and C. C. The enterogastric reflex. 57. Which monosaccharide is found in all three of the most common disaccharides? A. Fructose. B. Glucose. C. Galactose. D. Levrulose. B. Glucose. 58. Which of the following protein digesting enzymes is made in the stomach? A. Trypsin. B. Chymotrypsin. C. Pepsin. D. Peptidase. C. Pepsin. 59. Which of the following is not a digestive enzyme for lipids? A. Bile. B. Lipase. C. Phospholipase. D. All of the above are digestive enzymes for lipids. A. Bile. 60. Which of the following is not a stage in deglutition? A. Gastric. B. Oral. C. Pharyngeal. D. Esophageal. A. Gastric. 61. The enzyme amylase is produced by the A. Stomach, B. Pancreas, C. Salivary glands, D. Both B and C are correct. D. Both B and C are correct. 62. The end product of carbohydrate digestion is a glucose, B. Maltose, C. Fructose, D. Sucrose. A glucose. 63. The end product of fat digestion is a fatty acids, B. Monoglycerides, C. Glycerol, D. All of the above. D. All of the above. 64. The parietal cells of the stomach do not produce which of the following? A. Pepsinogen, B. Hydrochloric acid, C. Intrinsic factor, D. The parietal cell of the stomach produces all of the above. A. Pepsinogen. 65. After the absorption of a large meal, high levels of glucose and amino acids would be found in the A. lacteals of the villi, B. blood of the inferior vena cava, C. blood in the hepatic portal system, D. Both A and C are correct. C. blood in the hepatic portal system. 66. After the absorption of a large meal, high levels of chylomicrons would be found in the A. lacteals of the villi, B. blood in the inferior vena cava, C. blood in the hepatic portal system, D. Both A and C are correct. A. lacteals of the villi. C. Chemical reaction in both directions means the direction and rate of the reaction is being governed by the rate law or law of mass action. For example, slowing of digestion when absorption is interfered with and the products of digestion accumulate. A. Amylase, sucrase, lactase, and maltase catalyze the breakdown of carbohydrates to glucose. A. Even though digestion includes the processes of mechanical and chemical breakdown of ingested food, the optimum goal of digestion is to absorb nutrients. D. Absorption is the passage of substances through the intestinal mucosa into the blood or lymph. 1. Which of the following is true of metabolism? A. It involves both a physical and a chemical breakdown of foods. B. It occurs both inside and outside of cells. C. It involves synthesis and decomposition. D. Energy is released from the process of anabolism and catabolism. C. It involves synthesis and decomposition. 2. Which of the following is not true of ATP? A. It is a high-energy substance. B. It is formed by the synthesis of ADP and phosphate. C. It releases energy when split. D. It cannot be recycled after it is broken down. D. It cannot be recycled after it is broken down. 3. Catabolism is a blank process involving the blank of energy. As synthesis. Release B. Decomposition. Release C. Synthesis. Use D. Decomposition. Use B. Decomposition. Release. 4. ADP is an abbreviation for adenine diphosphate. B. Adenine diphosphate. C. Adenosine diphosphate. D. Adenosine triphosphate. C. Adenosine diphosphate. 5. Which of the following is true of energy released by the breakdown of food substances? A. It is used to synthesize ATP. B. It is used to decompose ATP. C. It is changed to heat energy and used for cell functioning. D. It is used directly for cell functioning. A. It is used to synthesize ATP. 6. In which of the following cells is glucose phosphorylation reversible? A. Heart. B. Pancreas. C. Kidney. D. Muscle. C. Kidney. 7. The cycle in which an ATP high-energy bond is broken to yield a phosphate group, ADP, and energy and then recombined to form ATP is called the A conversion of monosaccharides. B. ATP conversion. C. ATP/ADP system. D. Metabolic pathway. C. ATP/ADP system. 8. The preferred energy fuel of the body is A. Fructose. B. Glucose. C. Amino acids. D. Fatty acids. B. Glucose. 9. The process of splitting glycogen is called a glycogenesis. B. Glycogenolysis. C. Gluconeogenesis. B. Glycogenolysis. 10. Glucose phosphorylation is catalyzed by which of the following enzymes? A. Amylase. B. Glucokinase. C. Phosphatase. D. Phosphorylase. C. Phosphatase. 11. Which of the following is the correct order of the body's energy fuel preference, starting with the first choice and ending with the third choice? A. Carbohydrates, fats, proteins. B. Carbohydrates, proteins, fats. C. Fats, carbohydrates, proteins. D. Proteins, carbohydrates, fats. A. Carbohydrates, fats, proteins. B. Glycolysis requires the use of oxygen. 13. Which of the following is not true of glycolysis? A. It occurs in the mitochondria. B. Glucose is split into two pyruvate molecules. C. It is an anaerobic process. D. A specific enzyme catalyzes each step of the reaction. A. It occurs in the mitochondria. 14. The citric acid cycle takes place in the A. ribosome. B. Cytoplasm. C. Mitochondria. D. Golgi apparatus. C. Mitochondria. 15. Which of the following names is not a term used for the aerobic breakdown of food substances? A. Citric acid cycle. B. Pyruvate cycle. C. Krebs cycle. D. Tricarboxylic acid cycle. B. Pyruvate cycle. 16. When the blood glucose level starts to decrease toward lower than normal, liver cells increase the rate at which they convert glycogen, amino acids, and fats to glucose. B. There is an increase in glycogenolysis. C. There is an increase in gluconeogenesis. D. All of the above occur. Do all of the above occur? 17. Which of the following types of cells contains phosphatase? A. Heart. B. Brain. C. Muscle. D. Kidney. D. Kidney. 18. Which of the following is most indicative of a normal blood sugar level? A. 60 to 80 mg per 100 milliliters. B. 80 to 90 mg per 100 milliliters, circa 110 to 125 mg per 100 milliliters. D. 135 to 150 mg per 100 milliliters. B. 80 to 90 mg per 100 milliliters. 19. An increased blood sugar level stimulates which of the following to occur? A. Glycogenolysis. B. Glycogenesis. C. Gluconeogenesis. D. Glycolysis. B. Glycogenesis. 20. The action of phosphatase enzyme is to catalyze the A combination of phosphate with glucose. B. Release of glucose from phosphate. C. Movement of glucose through the cell membrane. D. Formation of ATP. B. Release of glucose from phosphate. 21. The process of gluconeogenesis occurs in the A. Liver. B. Skeletal muscle. C. Brain. D. All of the above are correct. A. Liver. 22. The conversion of proteins to glucose is an example of a glycogenesis. B. Gluconeogenesis. C. Glycogenolysis. D. Glycolysis. B. Gluconeogenesis. 23. The process by which proteins are synthesized by the ribosomes in all cells is called protein catabolism. B. Anabolism. C. Metabolism. D. Transcription. B. Anabolism. 24. Deamination, the splitting off of an amino group from an amino acid molecule to form a molecule of ammonia, and one of keto acid, is the first step in protein catabolism. B. Anabolism. C. Metabolism. A. Catabolism. 25. Protein, or nitrogen, balance means protein anabolism equals protein catabolism. B. Anabolism exceeds protein catabolism. C. Catabolism exceeds protein anabolism. A. Anabolism equals protein catabolism. 26. Glucagon increases the activity of a phosphorylase. B. Phosphatase. C. Amylase. D. Glucokinase. A. Phosphorylase. 27. The enzyme that catalyzes glucose phosphorylation is a phosphorylase. B. Phosphatase. C. Amylase. D. Glucokinase. D. Glucokinase. 28. A hormone that stimulates the conversion of proteins to glucose is A. ACTH. B. Growth hormone. C. Thyroid hormone. D. TSH. A. ACTH. 29. ACTH affects metabolism by stimulating the release of epinephrine. B. Thyroxine. C. Glucagon. D. Glucocorticoids. D. Glucocorticoids. 30. The hormone capable of causing both protein anabolism and catabolism is a thyroid hormone. B. Growth hormone. C. Insulin. D. ACTH. A thyroid hormone. 31. The hormone that raises blood sugar level by causing a shift to fat catabolism is A. ACTH. B. Growth hormone. C. Thyroid hormone. D. Both A and B. D. Both A and B. 32. Which of the following hormones is not hyperglycemic? A. Glucagon. B. Glucocorticoid. C. Insulin. D. Epinephrine. C. Insulin. 33. Diets high in saturated fats and cholesterol tend to increase the blood concentration. A. HDL. B. LDL. C. VLDL. B. LDL. 34. Excess glucose and amino acids are converted to fatty acids. B. Glycerol. C. Triglycerides. D. Phospholipids. C. Triglycerides. 35. The hormone that has a tendency to inhibit fat catabolism is A. ACTH. B. Insulin. C. Growth hormone. D. Glucocorticoids. B. Insulin. 36. The most common lipids in the diet are phospholipids. B. Cholesterol. C. Triglycerides. D. Prostaglandins. C. Triglycerides. 37. All of the following hormones control lipid metabolism except A. ACTH. B. Glucocorticoids. C. Epinephrine. D. Insulin. C. Epinephrine. 38. Catabolism of fatty acids, without any other food product availability, causes the production of a glucose. B. Ketone bodies. C. Cholesterol. D. ADP. B. Ketone bodies. 39. Which of the following stimulates protein synthesis? A. Testosterone. B. Estrogen. C. Glucagon. D. ACTH. A. Testosterone. 40. Which of the following vitamins is not stored in significant amounts in the body, and must be continually supplied to the diet? A. DB. K. Circa. CD. E. Circa. C. 41. A deficiency in which of the following minerals leads to thyroid enlargement and a decrease in the metabolic rate? A. Potassium. B. Iodine. C. Calcium. D. Phosphorus. B. Iodine. 42. Metabolic rates are expressed as a normal or as a percentage above or below normal. B. The number of kilocalories of heat energy expended per hour or per day. C. Kilocalories per pound of body weight. D. Both A and B. D. Both A and B. 43. The basal metabolic rate is higher in all of the following situations except a youth compared with adult. B. Male compared with female. C. Hypothermia compared with fever. D. Excess of thyroid hormone compared with the normal level. C. Hypothermia compared with fever. 44. An increase of body temperature of 1 degree Celsius will necessitate an increase in metabolism of approximately A. 7% B. 11% circa 13% D. 15%. Circa 13%. 45. The appetite center is located in the A. Stomach, B. Small intestine, C. Hypothalamus, D. Cerebrum. C. Hypothalamus. 46. A person who consumes 6,000 kilocalories per day and burns only 5,000 kilocalories per day would gain approximately blank pounds over a 10-day period. A. 1 by 3 circa 5d. 7. B. 3. 47. Malnutrition includes a deficiency or imbalance of water, B. Food, C. Vitamins, D. Both B and C. D. Both B and C. 48. If 4 molecules of glucose were broken down by glycolysis, the cell would receive blank molecules of ATPA. 4 bits 8 circa 12d. 16. B. 8. 49. Which of the following is not a result of insulin deficiency? A. Low glycogen storage. B. Slow glycogenesis. C. Increased glucose catabolism. D. All of the above are results of insulin deficiency. C. Increased glucose catabolism. 50. Which of the following substances is not transported as part of a chylomicron? A. Glucose. B. Cholesterol. C. Phospholipid. D. All of the above are transported as part of a chylomicron. A. Glucose. 51. Which of the following vitamins can the body make? A. Vitamin D. B. Vitamin K. C. Biotin. D. The body can make all of the above vitamins. A. Vitamin D. 52. All of the following are a result of lipid anabolism except a cholesterol. B. Ketone bodies, C. Triglycerides, D. Prostaglandins. B. Ketone bodies. 53. Which of the following minerals is important in blood cell production? A. Magnesium. B. Iron. C. Manganese. D. Iodine. B. Iron. 54. Which of the following minerals is important in stomach acid production? A. Iron. B. Calcium. C. Chlorine. D. Sodium. C. Chlorine. 55. Which of the following minerals is important in the production of ATP, RNA, and DNA? A. Phosphorus. B. Iron. C. Calcium. D. Cobalt. A. Phosphorus. 56. Which of the following minerals is important in bone formation, blood clotting, and nerve function? A. Phosphorus. B. Iron. C. Calcium. D. Cobalt. C. Calcium. 57. Glucose cannot be secreted from what cells once glucose phosphorylation has occurred in them? A. Muscle cells. B. Kidney cells. C. Liver cells. D. Intestinal mucosa cells. A. Muscle cells. 58. Which of the following is not considered a macronutrient? A. Carbohydrates. B. Calcium. C. Iron. D. Neither B nor C is considered a macronutrient. C. Iron. 59. Which of the following is not considered a micronutrient? A. Zinc. B. Iodine. C. Sodium. D. All of the above are considered micronutrients. C. Sodium. 60. A term for substances such as sodium, chloride, calcium, and potassium is a bulk nutrient. B. Trace element. C. Macromineral. D. Both A and C. D. Both A and C. 61. A term for substances such as iron, iodine, zinc, and manganese is a bulk nutrient. B. Trace element. C. Macromineral. D. Both A and C. B. Trace element. 62. Occurs when nutrient molecules enter the cell and undergo many chemical changes is the textbook definition of a metabolism. B. Anabolism. C. Assimilation. D. Catabolism. C. Assimilation. 63. Which of the following carbohydrates cannot be absorbed directly into the cells? A. Cellulose. B. Polysaccharides. C. Disaccharides. D. None of the above carbohydrates can be absorbed directly into the cells. D. None of the above carbohydrates can be absorbed directly into the cells. 64. Carbohydrates must be converted to which molecule before entering the citric acid cycle? A. Citric acid. B. An acetyl group. C. Coenzyme. D. Pyruvate. B. An acetyl group. 65. Which of the following is a characteristic of an unsaturated fat? A. It is a solid at room temperature. B. It contains all the hydrogen it can hold. C. It has at least one double bond. D. None of the above are characteristics of an unsaturated fat. C. It has at least one double bond. 66. Which of the following is a characteristic of a saturated fat? A. It is a solid at room temperature. B. It contains all the hydrogen it can hold. C. It has at least one double bond. D. Both A and B are characteristics of a saturated fat. D. Both A and B are characteristics of a saturated fat. 67. Which of the following is a factor that reduces appetite? A. An increase in blood temperature reaching the hypothalamus. B. A decrease in blood temperature reaching the hypothalamus. C. A decrease in blood glucose. D. None of the above factors has an effect on appetite. A. An increase in blood temperature reaching the hypothalamus. 68. Which of the following is not part of basal conditions? A. Awake but lying down and not moving a muscle. B. In a pre-absorptive state. C. In a warm, comfortable environment. D. All of the above are part of basal conditions. B. In a pre-absorptive state. 69. What process has pyruvate N2 gained ATPs as end products? A. Krebs cycle. B. Anaerobic pathway. C. Glycolysis. D. Electron transport chain. C. Glycolysis. 70. What process uses high-energy electrons and hydrogen carriers to release energy? A. Krebs cycle. B. Anaerobic pathway. C. Glycolysis. D. Electron transport chain. D. Electron transport chain. 71. Which process produces lactate? A. Krebs cycle. B. Anaerobic pathway. C. Glycolysis. D. Electron transport chain. B. Anaerobic pathway. 72. Which process begins with acetyl-CoA and produces high-energy electrons and hydrogen carrier molecules? A. Krebs cycle. B. Anaerobic pathway. C. Glycolysis. D. Electron transport chain. A. Krebs cycle. 73. If 4 molecules of glucose were broken down by glycolysis, this cell would gain blank molecules of adenosine triphosphate. A. 4 bits 8 circa 12D. 16. B. 8. B. Orexigenic factors are hormones, neurotransmitters, and other factors that affect feeding centers in the hypothalamus that stimulate appetite. B. Catabolism breaks food molecules down into smaller molecular compounds, and, in so doing, releases energy from them. Anabolism does the opposite. C. Fewer carbohydrates would result in fats moving out of adipose tissue and being catabolized. A. Less, because BMR is about 55% to 60% of the TMR. 1. Which of the following is classified as an accessory organ of the urinary system? A. Ureters. B. Urinary bladder. C. Urethra. D. All of the above. D. All of the above. 2. The shape of the kidney could best be described as blank-shaped. A. Bean. B. Pear. C. Pea. D. Potato. A bean. 3. The calyces of the kidney join together to form a large collection reservoir called the A. Renal columns. B. Renal pyramids. C. Renal pelvis. D. hilum. C. Renal pelvis. 4. There are how many openings in the urinary bladder? A. 1B. 2C. 3D. 4. C. 3. 5. The function of the urinary bladder is to serve as a reservoir for urine before it leaves the body. B. Expel urine from the body, aided by the urethra. C. Help concentrate the urine in periods of dehydration. D. Do both A and B. D. Do both A and B. 6. One difference between the male urethra and the female urethra is the male urethra is a shorter B part of 2 different body systems. C. Unique in that there are no additional ducts that merge with it. D. Both B and C. B part of 2 different body systems. 7. At the beginning of the plumbing system of the urinary system, urine leaving the renal papilla is collected in the cup-like structures called renal columns. B. Renal pyramids. C. Calyces. D. Ureters. C. Calyces. 8. Urine is conducted from the kidney to the urinary bladder through a tube called the A. Renal column. B. Renal pelvis. C. Urethra. D. Ureter. D. Ureter. 9. Substances travel from the glomerulus into the glomerular capsule by the process of a diffusion. B. Active transport. C. Filtration. D. Osmosis. C. Filtration. 10. Of all the blood pumped per minute by the heart, approximately blank goes through the kidneys. A. 1/5 bit 1/3 circa a half t. 3/4. A. 1/5. 11. Cells called podocytes make up the A. Parietal layer of the glomerular capsule. B. Visceral layer of the glomerular capsule. C. Glomerulus. D. Proximal tubule. B. Visceral layer of the glomerular capsule. 12. The portion of the nephron that empties into a calyx is the A. Distal tubule. B. Nephron loop. C. Collecting duct. D. Proximal tubule. C. Collecting duct. 13. Which of the following is not a part of the glomerular capsular membrane? A. Parietal layer of the glomerular capsule. B. Visceral layer of the glomerular capsule. C. Glomerular endothelium. D. Basement membrane. A. Parietal layer of the glomerular capsule. 14. A portion of the nephron that can lie within the medulla is the A. Proximal tubule. B. Glomerular capsule. C. Distal tubule. D. Nephron loop. D. Nephron loop. 15. Approximately how much blood flows through the kidneys per minute? A. 500 milliliters. B. 750 milliliters circa 1200 ml. D. 3500 milliliters circa 1200 ml. 16. In the kidney, blood flows from the interlobular artery into the A. Glomerulus. B. Efferent arteriole. C. Afferent arteriole. D. Peritubular capillaries. C. Afferent arteriole. 2. A movement of molecules out of the tubule and into the peritubular blood. 18. Which of these statements is not true of the kidney? A. The kidney is usually located next to the vertebrae from T12 to L3. B. The kidney is retroperitoneal. C. The kidney is protected by a heavy layer of fat. D. All of the above are true of the kidney. D. All of the above are true of the kidney. 19. Which of the following is not a normal function of the kidneys? A. Synthesize prostaglandins. B. Regulate blood sugar. C. Produce hormones. D. Regulate blood electrolytes. B. Regulate blood sugar. 20. The normal osmotic pressure of the capsular filtrate is blank mmHg. 60 bits 32 circa 18 D. 0. D. 0. 21. A drop in systemic blood pressure would cause the filtration rate to increase. B. Decrease. C. Stay the same. D. Vary depending on the level of AHD in the blood. B. Decrease. 22. The ion most likely to be reabsorbed after the reabsorption of sodium ions is a potassium. B. Chloride. C. Phosphate. D. Both B and C. D. Both B and C. 23. Under normal conditions, most nutrients are reabsorbed in which portion of the nephron? A. Proximal tubule. B. Ascending nephron loop. C. Distal tubule. D. Collecting tubule. A. Proximal tubule. B. Chloride ions are actively transported into the blood plasma. 25. Which of the following is the approximate threshold level for the reabsorption of glucose? A. 100 mg per 100 milliliters. B. 300 mg per 100 milliliters. Circa 200 mg per 100 milliliters. D. 250 mg per 100 milliliters. B. 300 mg per 100 milliliters. 26. The substance most often measured to determine normal kidney function is a creatinine. B. Glucose. C. Sodium. D. Potassium. A creatinine. 27. The portion of the nephron tubule that is essentially always impermeable to water is the A. Proximal tubule. B. Distal tubule. C. Collecting tubule. D. Ascending nephron loop. D. Ascending nephron loop. 28. Filtrate. In which part of the nephron tubule has the highest osmolality? A. Proximal tubule. B. Ascending nephron loop. C. Descending nephron loop. D. Distal tubule. C. Descending nephron loop. 29. Urine formation involves all the following processes except filtration. B. Catabolism. C. Reabsorption. D. Secretion. B. Catabolism. C. The ureter is composed of two layers of tissue, an inner mucus layer and an outer fibrous layer. 31. When aldosterone is released, secretion of blank occurs. A. Ammonium. B. Hydrogen. C. Potassium. D. Sodium. C. Potassium. 32. In the ascending limb of the nephron loop, a sodium and chloride are reabsorbed from the tubule fluid. B. The tubule fluid becomes dilute. C. Antidiuretic hormone causes the cells to become more permeable to water. D. Both A and B occur. D. Both A and B occur. 33. ADH has the greatest effect on the reabsorption of water in the A. Proximal tubule. B. Ascending nephron loop. C. Descending nephron loop. D. Distal tubule. D. Distal tubule. 34. The movement of substances out of the blank best describes secretion in the formation of urine. A. Blood into the tubule. B. Blood into the glomerular capsule. C. Tubules into interstitial fluids. D. Glomerulus into the tubules. A. Blood into the tubule. 35. Which of the following ions is not normally secreted into the distal or collecting tubules? A. potassium B, hydrogen C, ammonium D, sodium D, sodium. 36. The movement of molecules out of the tubules and into the peritubular blood defines a glomerular filtration. B. Secretion. C. Maturation. D. Reabsorption. D. Reabsorption. B. Collecting duct and the distal tubule. 38. Water will move by osmosis only in the presence of ADH in the A. Distal tubule. B. Collecting duct. C. Ascending nephron limb. D. Both A and B are correct. D. Both A and B are correct. 39. Which of the following is not a normal constituent of urine? A. Nitrogenous wastes. B. Hormones. C. Pigments. D. Plasma proteins. D. Plasma proteins. 40. The percentage of water in urine is approximately blank percent. A. 55 bit 65 circa 80 D. 95. D. 95. 41. Which of the following statements is not true? A. The right kidney is slightly lower than the left kidney. B. The right kidney is often slightly larger than the left kidney. C. The kidneys extend above the level of the 12th rib. D. The kidneys are retroperitoneal. B. The right kidney is often slightly larger than the left kidney. 42. Which of the following structures does not enter or leave through the hilum of the kidney? A. Calyx. B. Renal artery. C. Renal vein. D. Ureter. C. Second part of the renal tubules. 43. Which of the following is not true of the proximal convoluted tubule? A. Highly convoluted. B. Nearest to the glomerular capsule. C. Second part of the renal tubules. D. Contains microvilli. C. Second part of the renal tubules. 44. If the Tmax for glucose in the nephron was 300 mg per 100 ml and a person had blood glucose level of 380 mg per 100 ml, there would be a 300 mg per 100 ml of glucose in the urine. B. 80 mg per 100 ml of glucose in the urine. Circa 80 mg per 100 ml of glucose in the blood leaving the kidney. D. Both A and C. B. 80 mg per 100 ml of glucose in the urine. 45. The nitrogenous wastes in the urine are usually the result of protein catabolism. They include all except a urea. B. Ammonia. C. Creatinine. D. Amino acids. D. Amino acids. 46. A good description of the urinary system function is that it produces urine. B. Balances blood plasma. C. Maintains the dynamic consistency of the internal fluid environment. D. Does all of the above. D. Does all of the above. 47. What is the first branch of the segmental artery? A. Interlobar arteries. B. Afferent arterioles. C. Lobar arteries. D. Arcuate arteries. C. Lobar arteries. 48. Which blood vessels empty into the glomerulus? A. Interlobar arteries. B. Afferent arterioles. C. Lobar arteries. D. Arcuate arteries. B. Afferent arterioles. 49. Which blood vessel drains the vasa recta? A. Lobar vein. B. Arcuate vein. C. Interlobular vein. D. Both B and C. D. Both B and C. D. None of the above are in the correct order. 51. Which structure of the kidney narrows as it exits the kidney to become the ureter? A. Renal pyramids. B. Renal pelvis. C. Renal columns. D. Hilum. B. Renal pelvis. 52. In the average bladder, what amount of urine would cause a moderately distended sensation and the desire to void? A. 250 milliliters. B. 100 milliliters circa 600 milliliters. D. 150 milliliters. A. 250 milliliters. 53. The mechanism for voiding begins with the relaxation of the internal sphincter. B. The contraction of the muscles of the bladder. C. The relaxation of the external sphincter. D. A parasympathetic impulse sent to the bladder. At the relaxation of the internal sphincter. 54. Which nitrogenous waste is the most abundant found in the urine? A. Uric acid. B. Urea. C. Ammonia. D. Creatinine. B. Urea. 55. Which hormone tends to increase the amount of urine produced? A. ANH. B. Aldosterone. C. ADHD. Both B and C. A. ANH. 56. Which hormone tends to decrease the amount of urine produced? A. ANH. B. Aldosterone. C. ADHD. Both B and C. D. Both B and C. 57. As the amount of sodium reabsorbed by the distal convoluted tubule increases, the amount of blank increases. A. Potassium ions absorbed. Also B. Hydrogen ions absorbed. Also C. Potassium ions secreted. D. Both A and B are correct. C. Potassium ions secreted. A. 22. C. Because water reabsorption in the distal and collecting tubules requires ADH, the aldosterone mechanism must work in concert with the ADH mechanism if homeostasis of the fluid content in the body is to be maintained. A. When secondary hypertension occurs, the cells of the juxtaglomerular apparatus secrete renin, which in turn results in angiotensin production and increased blood pressure, so giving ACE inhibitors may reduce the production of angiotensin and lower the blood pressure. D. When the kidney responds to narrowing of a renal artery due to this disease, it will cause an increase in blood pressure and ischemia of kidney tissues. D. Filtration is the movement of water and protein-free solutes from plasma in the glomerulus into the capsular space of the glomerular capsule. 63. If a person becomes dehydrated, which hormone would you expect to find in high concentration in the blood? A. Antidiuretic hormone. B. Atrial natriuretic hormone. C. Para-aminobutyric acid. D. Prolactin. A. Antidiuretic hormone. A. Renal suppression occurs when effective filtration pressure falls to zero and the kidneys shut down, so a urinary catheter would not help this situation. A. Increased urea and creatinine levels in the blood indicate the inability of the kidney to filter creatinine and urea. B. Excess glucose spills over into urine, thereby increasing the solute concentration of urine, which in turn leads to diuresis. D. Reflex closure of sphincter muscles guarding the bladder opening. Form a brush border that increases absorptive surface area of the entire inner surface of the proximal tubule. B. In addition to reabsorption, the nephron loop secretes hydrogen ions. From rapid systemic arterial pressure variations that would otherwise cause large glomerular filtration rate changes. 71. Terry has lupus erythematosus and has been complaining of feelings of urgency, pain in urination, and the appearance of blood in the urine. More than likely, Terry is suffering from interstitial cystitis. B. Renal calculi. C. Renal ptosis. D. Renal sarcoma. Interstitial cystitis. A. Overweight people have lower water content per kilogram of body weight than slender people. 2. The total fluid or water content of the human body ranges from blank of its total weight. A. 15% to 25%. B. 25% to 45%. Circa 45% to 75%. D. 75% to 85%. Circa 45% to 75%. B. Intracellular fluid, interstitial fluid, plasma. 4. In young adults, the percentage of body weight composed of water will average about blank for males and blank for females. A. 40%. 50%. B. 60%. 50%. Circa 70%. 60%. D. 60%. 70%. B. 60%. 50%. 5. Cerebrospinal fluid is part of the blank fluid. A. Intracellular. B. Extracellular. C. Interstitial. D. Both A and C are correct. B. Extracellular. 6. Which of the following body fluid compartments has the same volume in the infant, the adult male, and the adult female? A. Plasma. B. Interstitial fluid. C. Extracellular fluid. D. Intracellular fluid. A. Plasma. 7. Ringer solution is often described as normal saline solution modified by the addition of a sodium and potassium. B. Potassium and calcium. C. Sodium and calcium. D. Glucose. B. Potassium and calcium. 8. Which of the following is not one of the 7 basic solutions used for parenteral therapy? A. Ammonium chloride. B. Lactate solution. C. Carbohydrate in water. D. Liquid protein. D. Liquid protein. 9. Which of the following is not a method used for parenteral administration? A. Intravenous. B. Subcutaneous. C. Intramuscular. D. By mouth. D. By mouth. 10. Parenteral solutions are given to meet current maintenance needs for nutrients, fluids, and electrolytes. B. Replace past losses. C. Replace concurrent losses. D. Do all of the above. D. Do all of the above. 11. Water normally leaves the body through blank exits. A2 bits 3 C4 D5. C4. 12. The 2 factors that determine urine volume are the amounts of ADH and aldosterone secretion. B. The amounts of ACTH and ADH secretion. C. Fluid intake and ADH secretion. D. The glomerular filtration rate and the rate of water reabsorption by the renal tubules. D. The glomerular filtration rate and the rate of water reabsorption by the renal tubules. 13. Abnormal conditions that cause fluid and electrolyte output to exceed input include all the following except vomiting. B. Drinking liquids too fast. C. Hyperventilating. D. Diarrhea. B. Drinking liquids too fast. 14. Which of the following substances is released by the juxtaglomerular cells? A. Cortisol. B. Antidiuretic hormone. C. Aldosterone. D. Renin. D. Renin. 15. When the adrenal cortex is stimulated to increase its secretion of aldosterone, the first thing that happens is a decrease in the kidney tubule reabsorption of sodium. B. Increase in the kidney tubule reabsorption of sodium. C. Decrease in arterial blood pressure. D. Increase in urine volume. B. Increase in the kidney tubule reabsorption of sodium. 16. Juxtaglomerular cells are located in the A. Kidney. B. Adrenal cortex. C. Liver. D. Adrenal medulla. A. Kidney. 17. The thirst center, which contains specialized cells called osmoreceptors, is located in the A. Pons. B. Anterior pituitary. C. Posterior pituitary. D. Hypothalamus. D. Hypothalamus. 18. Which of the following sites of fluid loss can be automatically adjusted according to fluid intake volume? A. Lungs. B. Skin. C. Intestine. D. Kidney. D. Kidney. 19. Which of the following electrolytes is not a cation? A. Calcium. B. Chloride. C. Magnesium. D. Potassium. B. Chloride. 20. The composition of sodium in the blood plasma is equal to blank mx/La. 2 bits 5 circa 102 D. 142. D. 142. 21. Which of the following pairs are almost identical when compared chemically? A. Plasma and intracellular fluid. B. Plasma and interstitial fluid. C. Interstitial fluid and intracellular fluid. D. Extracellular fluid and intracellular fluid. B. Plasma and interstitial fluid. 22. What is the most abundant cation in extracellular fluid? A. Sodium. B. Chlorine. C. Potassium. D. Magnesium. A. Sodium. 23. What is the most abundant cation in intracellular fluid? A. Sodium. B. Chlorine. C. Potassium. D. Magnesium. C. Potassium. A blood contains appreciable amounts of protein anions. 25. What is the most abundant anion in the extracellular fluid? A. Bicarbonate. B. Chloride. C. Phosphate. D. Protein. B. Chloride. C. Blood colloid osmotic pressure tends to draw fluid back into the capillaries. 27. Which of the following is the formula representing the Starling law of capillaries? A. Equal EFPB. Equal EFPC. Equal EFPD. None of the above. C. Equal EFP. 28. As related to the Starling law, which of the following is the greatest pressure at the arterial end of the capillaries? A. Blood hydrostatic pressure. B. Interstitial fluid hydrostatic pressure. C. Blood colloid osmotic pressure. D. Interstitial colloid osmotic pressure. A. Blood hydrostatic pressure. 29. Which of the following statements is not true? A. Men have less body water than women do. B. Adults have less body water than infants do. C. Overweight people have less body water than slender people do. D. All of the above are true statements. A. Men have less body water than women do. 30. As related to the Starling law, which of the following has the greatest effect on water re-entering the capillaries? A. Blood hydrostatic pressure. B. Interstitial fluid hydrostatic pressure. C. Blood colloid osmotic pressure. D. Interstitial colloid osmotic pressure. C. Blood colloid osmotic pressure. 31. When the effective filtration pressure equals 0, a fluid shifts out of the blood into the interstitial fluid. B. Fluid shifts out of the interstitial fluid and into the blood. C. No net transfer of water occurs between blood and interstitial fluid. D. The extracellular fluid volume increases. C. No net transfer of water occurs between blood and interstitial fluid. 32. Edema is defined as abnormally large amounts of fluid in the A. capillaries. B. Cells. C. Veins. D. Intercellular spaces. D. Intercellular spaces. 33. Which large molecules are retained by the selectively permeable cell membrane? A. Sodium ions. B. Potassium ions. C. Proteins. C. Proteins. 34. Movement of water and solids between ECF and ICF spaces is influenced by all of the following except the large protein molecules that cannot diffuse out of the cell. B. Ion transport. C. Positive charges attracting negatively charged ions. D. All of the above influence movement. D. All of the above influence movement. D. All of the above occur. 36. Which body location is not one that is usually impacted by edema? A. Kidneys. B. Lungs. C. Dependent areas of the body. D. All of the above body areas are impacted by edema. A. Kidneys. 37. When the posterior lobe of the pituitary is stimulated to increase its secretion of ADH, the first event to occur is an increase in urine volume. B. Increase in the kidney tubule reabsorption of water. C. Decrease in the kidney tubule reabsorption of water. D. Decrease in ECF volume. B. Increase in the kidney tubule reabsorption of water. 38. The major organ that balances sodium and potassium in the body is the A. Kidney. B. Skin. C. Gastrointestinal tract. D. Lungs. A. Kidney. 39. Aged individuals of either sex may have less total body water because of their reduced kidney function. B. Decreased percentage of body fat. C. Decreased muscle mass. D. Both A and B are correct. C. Decreased muscle mass. 40. Which of the following is not considered a transcellular fluid? A. Lymph. B. Cerebrospinal fluid. C. The humors of the eye. D. Joint fluid. A. Lymph. 41. The body fluid that stays constant as a percentage of body weight throughout life is an intracellular fluid. B. Plasma. C. Interstitial fluid. D. Extracellular fluid. B. Plasma. 42. If two electrodes charged with a weak current were placed in a solution of NaCl, the negative electrode would attract the A. chloride ion. B. Sodium ion. C. anion. D. Both B and C are correct. B. Sodium ion. 43. If two electrodes charged with a weak current were placed in a solution of NaCl, the negative electrode would attract the cations. B. Anions. C. Chloride ions. D. Both A and C are correct. A. Cations. 44. If two electrodes charged with a weak current were placed in a solution of NaCl, the positive electrode would attract the cations. B. Anions. C. Chloride ions. D. Both B and C are correct. D. Both B and C are correct. 45. If two electrodes charged with a weak current were placed in a solution of NaCl, the positive electrode would attract the cations. B. Sodium ions. C. Chloride ions. D. Both A and B are correct. C. Chloride ions. 46. The ion with the least total concentration in body fluids is a chloride. B. Potassium. C. Calcium. D. Bicarbonate. C. Calcium. 47. With an equal milligram percent in solution, Calcium would have a blank mole equivalent than potassium. A greater B lesser C equal D. There is not enough information to determine the mole equivalent. D. There is not enough information to determine the mole equivalent. 48. Angiotensin I is converted to angiotensin II in the A kidney, B liver, C lung, D intestine. C lung. 49. Which of the following two forces tend to move fluid out of the blood vessel? A. Blood hydrostatic pressure and blood colloid osmotic pressure. B. Blood colloid osmotic pressure and interstitial fluid hydrostatic pressure. C. Blood hydrostatic pressure and interstitial fluid colloid pressure. C. Blood hydrostatic pressure and interstitial fluid colloid pressure. B. Blood colloid osmotic pressure and interstitial fluid hydrostatic pressure. 51. The mechanism of action for aldosterone and the mechanism of action for ADH differ because ADH regulates water whereas aldosterone regulates a potassium. B. Chloride. C. Calcium. D. Sodium. D. Sodium. 52. Which of the following is not a cause of hypervolemia? A. Renal failure. B. Ascites. C. Nephrotic syndrome. D. Congestive heart failure. B. Ascites. 53. An intravenous addition of sodium can be used to treat a hypokalemia. B. Hypernatremia. C. Hyponatremia. D. Hyperkalemia. C. Hyponatremia. 54. Potassium-rich foods can be used to treat a hypokalemia. B. Hypernatremia. C. Hyponatremia. D. Hyperkalemia. A hypokalemia. 55. Which of the following is not true of sodium chloride? A. It will dissociate in water. B. It will form ions. C. It has the same type of bonds as glucose. D. All of the above are true about sodium chloride. C. It has the same type of bonds as glucose. 56. Which of the following is not true of glucose? A. It will dissociate in water. B. It will form ions. C. It has the same type of bonds as sodium chloride. D. None of the above are true of glucose. D. None of the above are true of glucose. 57. Which type of tissue has the least amount of water? A. Muscle. B. Adipose. C. Bone. D. Nervous. B. Adipose. 58. Which of the following is not considered an extracellular fluid? A. Lymph. B. Plasma. C. The aqueous fluid of the eye. D. All of the above are considered extracellular fluids. D. All of the above are considered extracellular fluids. 59. The subpharyngeal organ is located in what part of the central nervous system? A. Hypothalamus. B. Parietal lobe of the brain. C. Roof of the third ventricle of the brain. D. Medulla. C. Roof of the third ventricle of the brain. 60. Angiotensinogen is converted to angiotensin I in the A kidney, B blood, C lung, D adrenal glands. B blood. 61. Which of the following sites of fluid loss can be automatically adjusted according to fluid intake volume? A. Intestine, B. Kidney, C. Lungs, D. Skin. B. Kidney. 62. Cerebrospinal fluid is part of the A extracellular fluid because it consists mainly of plasma found in blood vessels and interstitial fluids. B. Interstitial fluid because it flows inside of cells. C. Intracellular fluid because it consists mostly of water. D. Both B and C are correct. A. Extracellular fluid because it consists mainly of plasma found in blood vessels and interstitial fluids. C. Blood colloid osmotic pressure tends to draw fluid back into the capillaries. D. Working in the hypothalamus to trigger a conscious sense of dry mouth and thirst. D. A loss of interstitial fluid causing a drain of blood plasma out of the vessels and into tissue spaces. 66. A solution of sodium and a solution of calcium of equal mg%. The mg/L of calcium would be about blank that of sodium. A the same as before times C twice D 6 times. C twice. 1. The regulation of acid-base balance in the body fluids refers to the control of blank ion concentration. A. Hydrogen, B. Bicarbonate, C. Potassium, D. Chloride. A. Hydrogen. 2. Which of the following would have the greatest concentration of hydrogen ions? A. pH 2 bits, pH 6, C. pH 8, D. pH 10. A. pH 2. 3. Which of the following would indicate a neutral solution? A. pH 7 bits, pH 6, C. pH 8, D. pH 10. A. pH 7. 4. The most acidic substance in the body is a stomach acid. B. Saliva. C. Blood. D. Cerebrospinal fluid. A. Stomach acid. 5. A solution with pH of 7 would contain blank times the number of hydrogen ions as a solution with a pH of 8A. 2 bits 3 circa 5D. 10. D. 10. 6. The pH of the blood is maintained at approximately A. 7.1B. 7.2 circa 7.3D. 7.4. D. 7.4. 7. Ketone bodies are associated with cellular metabolism of the fats. B. Carbohydrates. C. Proteins. D. Vitamins. A. Fats. 8. Which of the following types of acids would be produced as a result of glucose catabolism? A. Acetoacetic, B. Phosphoric, C. Lactic, D. Sulfuric. C. Lactic. 9. Which of the following is classified as an acid-forming food? A. Meat, B. Egg, C. Poultry, D. All of the above. D. All of the above. 10. Hydrogen ions are continually entering the body fluids through acidic ketone bodies. B. Phosphoric acids. C. Carbonic acids. D. All of the above. D. All of the above. 11. An example of a physiological buffer system would be the blank system. A respiratory response. B. Protein buffer. C. Bicarbonate buffer. D. Phosphate buffer. A respiratory response. 12. If the pH of the blood were 7.23, it would be within the normal range. B. Slightly more acidic than normal. C. Slightly more basic than normal. D. Much more basic than normal. B. Slightly more acidic than normal. 13. Which of the following is considered a powerful physiological buffering system of the body? A. Skin. B. Liver. C. Kidney. D. Intestine. C. Kidney. 14. In the body, non-volatile acids, or fixed acids, are buffered mainly by hemoglobin. B. Sodium hydroxide. C. Sodium bicarbonate. D. Plasma proteins. C. Sodium bicarbonate. 15. Which of the following ratios of base bicarbonate to carbonic acid will maintain a normal pH? A. 3, 1 bit 5, 1 circa 10, 1 D. 20, 1. D. 20, 1. 16. Potassium salts of hemoglobin are important in buffering blank acid. A. Lactic. B. Carbonic. C. Sulfuric. D. Phosphoric. B. Carbonic. 17. Which of the following is a true statement? A. Arterial blood has a higher hydrogen ion concentration than venous blood. B. Venous blood has a higher pH than arterial blood. C. Arterial blood has an average pH of 7.41 D. Venous blood has a lower hydrogen ion concentration than arterial blood. C. Arterial blood has an average pH of 7.41. 18. An increase in respiratory rate would result in a decrease in all of the following except the carbon dioxide. B. Acidity. C. pH. D. Hydrogen ions. C. pH. 19. Prolonged hyperventilation tends to produce alkalosis. B. Decrease blood pH. C. Produce acidosis. D. Stimulate increased production of carbonic acid. A. Produce alkalosis. 20. In acidosis, the renal tubule excretion of hydrogen ions decreases. B. Increases. C. Does not change. D. Decreases only when potassium ion excretion increases. B. Increases. 21. Which of the following is considered a direct acid-forming food? A. Citrus fruit. B. Vinegar. C. Cranberries. D. All of the above are considered direct acid-forming foods. C. Cranberries. 22. A decrease in blood pH below normal tends to stimulate increased respirations. B. Produce hypoventilation. C. Stimulate a compensatory increase in blood hydrogen ion concentration through the respiratory system. D. Do both. B and C. A. Stimulate increased respirations. 23. If the blood pH decreases below normal, The kidney tubules secrete blank urine. A fewer hydrogen ions from blood to B, more hydrogen ions from blood to C, more sodium ions into the D. Both A and C will occur. B, more hydrogen ions from blood to 24. Hyperventilation can result in loss of consciousness because the oxygen levels become too high. B, oxygen levels become too low. C, carbon dioxide levels are elevated. D, of alkalosis. D, of alkalosis. 25. When the kidney secretes hydrogen ions, it primarily reabsorbs blank ions of potassium, B, calcium, C, chloride, D, sodium. D, sodium. 26. Hyperkalemia may have a major effect on which of the following? A. Gastrointestinal tract, B. Heart, C. Kidney, D. Liver. B. Heart. 27. When the renal tubules reabsorb sodium ions, they normally exchange which of the following? A. Potassium ions, B. Chloride ions, C. Hydrogen, D. Either potassium or hydrogen. D. Either potassium or hydrogen. 28. For the body to maintain an acid-base balance, which of the following is necessary? A. Buffering, B. Respiration, C. Urine secretion, D. All of the above. D. All of the above. 29. The more hydrogen ions excreted by the renal tubules, the A, more alkaline the urine. B, more potassium ions excreted. C, fewer potassium ions excreted. D, lower the pH of the blood becomes. C, fewer potassium ions excreted. 30. A decrease in blood pH accelerates the renal tubule excretion of ammonia. B causes a decrease in the renal tubule excretion of ammonia. C produces an increase in the pH of the urine through the chloride shift. D has no effect on the renal tubule excretion of ammonia. A accelerates the renal tubule excretion of ammonia. 31. Which of the following would be important in treating metabolic alkalosis? A. Chloride ions, B. Bicarbonate ions, C. Sodium ions, D. Potassium ions. A. Chloride ions. 32. Which of these is true about the metabolism of glucose? A. Aerobic metabolism produces lactic acid. B. Anaerobic metabolism produces lactic acid. C. Anaerobic metabolism produces carbonic acid. D. Both A and C are true about the metabolism of glucose. B. Anaerobic metabolism produces lactic acid. 33. Which of these is not an acid-forming element? A. Chloride, B. Potassium, C. Sulfur, D. Phosphorus. B. Potassium. 34. Which of the following is not a base-forming element? A. Chlorine, B. Potassium, C. Sodium, D. Magnesium. A. Chlorine. 35. A solution with a hydrogen ion concentration of 110-1 per liter would have a pH of A. 10B. -1 circa 1D, none of the above. Circa 1. 36. A solution with a hydrogen ion concentration of 110-4 per liter would be A acid, B base, C neutral solution, D. There is not enough information to determine the type of solution it would be. A acid. 37. A solution with a pH of 6 would have a hydrogen ion concentration of blank per liter. A. 0.000006 bit 0.00000001 circa 0.000001 D. None of the above is correct. Circa 0.000001. 38. A solution with a pH of 6 would have blank ions than a solution with a pH of 4 A more hydrogen B fewer hydrogen C fewer hydroxide D. Both A and C are correct. B fewer hydrogen. 39. Beta-hydroxybutyric acid results from the metabolism of a glucose. B amino acids. C fats. D ribonucleotides. C fats. 40. Carbonic acid results primarily from the metabolism of a glucose. B amino acids. C fats. D ribonucleotides. A glucose. 41. Sulfuric acid results from the metabolism of a glucose. B amino acids. C fats. D ribonucleotides. B amino acids. 42. Which of the following is not a weak acid? A. Hemoglobin B. Oxyhemoglobin C. Proteins D. NO2HPO4. D. NO2HPO4. 43. In the body, which of the following substances might be used to buffer a strong acid such as HCl? A. H2CO3b. Hemoglobin C. NaHCO3d. None of the above. C. NaHCO3. 44. In the body, which of the following substances might be used to buffer a strong base such as NaOH? A. H2CO3b. KHCO3c. Proteins D. None of the above. A. H2CO3. 45. Which of the following is most basic? A. Oven cleaner B. Baking soda C. Household ammonia D. Great Salt Lake water. A. Oven cleaner. 46. The respiratory center is stimulated if the A amount of carbon dioxide in arterial blood increases. B amount of carbon dioxide in venous blood increases. C pH of the blood goes above 7.41 D. Any of the above will stimulate the respiratory center. A amount of carbon dioxide in arterial blood increases. 47. Which of the following statements is true? A. Hypoventilation can cause alkalosis. B. Hyperventilation can cause acidosis. C. Hyperventilation can cause a drop in pH. D. Hypoventilation can cause a drop in pH. D. Hypoventilation can cause a drop in pH. 48. Respiratory acidosis is also a carbonic acid excess. B. Carbonic acid deficit. C. Bicarbonate excess. D. Bicarbonate deficit. A. Carbonic acid excess. 49. An abnormal change in pH in the body could disrupt the functioning of enzymes. B. Cell membrane receptors. C. Hemoglobin. D. All of the above. D. All of the above. 50. The functioning of the NOK pump transport mechanism falls by 50% if the pH falls by 1 unit. B. Falls by 2 units. C. Falls by 3 units. D. Rises by 1 unit. A. Falls by 1 unit. 51. The biological activity of phosphofructokinase falls by 90% if the pH falls by 1 unit. B. Falls by 0.5 units. C. Falls by 0.1 units. D. Rises by 1 unit. C. Falls by 0.1 units. 52. The numerical value of pH represents the A hydrogen ion concentration squared. B. Negative logarithm of the hydrogen ion concentration. C. Logarithm of the hydrogen ion concentration. D. Square root of the hydrogen ion concentration. B. Negative logarithm of the hydrogen ion concentration. 53. Phosphoric acid accumulates when what is broken down in the body? A. Fats. B. Amino acids. C. Ribonucleotides. D. Carbohydrates. C. Ribonucleotides. 54. Toxic accumulation of acidic ketone bodies is a common complication of untreated kidney disease. B. Diabetes mellitus. C. Respiratory distress syndrome. D. Deficiency of carbonic anhydrase in the blood. B. Diabetes mellitus. 55. The most rapidly acting buffer system in the body is the blank buffering system. A. Chemical. B. Respiratory. C. Kidney. D. Both physiological buffering systems act with equal speed and are faster than the chemical. A. Chemical. 56. If HCl were buffered by NaHCO3, the formation of blank would not occur. A. NaCl. B. Water. C. HHCO3. All of the above would occur. B. Water. 57. If HCl were buffered by NaHCO3, what would occur? A. There would be a slight rise in pH. B. There would be a large drop in pH. C. There would be a slight drop in pH. D. There would be a large rise in pH. C. There would be a slight drop in pH. 58. If NaOH were buffered by HHCO3, what would not occur? A. Concentration of NaHCO3 would increase. B. Water would be formed. C. The number of hydroxide ions would greatly increase. D. All of the above would occur. C. The number of hydroxide ions would greatly increase. 59. If NaOH were buffered by HHCO3, what would occur? A. There would be a slight drop in pH. B. There would be a large drop in pH. C. There would be a slight rise in pH. D. There would be a large rise in pH. C. There would be a slight rise in pH. B. A decrease in blood pH accelerates tubule excretion of both hydrogen and ammonia. An increase in blood pH produces the opposite effects, thus maintaining pH balance. 61. A decrease in blood pH accelerates the renal tubule ion exchange mechanisms. B causes a decrease in the renal tubule excretion of ammonia. C has no effect on the renal tubule excretion of ammonia. D produces an increase in the pH of the urine through the chloride shift. A accelerates the renal tubule ion exchange mechanisms. A amount of carbon dioxide in arterial blood increases, so more CO2 is exhaled, thus lowering the blood pH. 63. If the blood pH decreases below normal, the kidney tubules secrete fewer hydrogen ions from blood to urine. B. More hydrogen ions from blood to urine. C. More sodium ions into the urine. D. Both A and C are correct. B. More hydrogen ions from blood to urine. C. Less carbon dioxide remains in the arterial blood leaving the lung capillaries, causing a reduction in the amount of carbonic acid and the number of hydrogen ions. B can trigger fluid and electrolyte imbalances, which may lead to metabolic alkalosis. A. Prolonged hypoventilation may decrease blood pH enough to produce acidosis. 67. A rare but very serious complication of metformin therapy is a hyperkalemia. B. Lactic acidosis. C. Uncompensated acidosis. D. Uncompensated alkalosis. B. Lactic acidosis. B. Alkalize blood by acidifying urine. C. The infused lactate ions are metabolized by the liver cells and converted to carbonic acid, which helps restore the depleted bicarbonate reserves required to restore acid-base balance. C. The chloride ions of the solution will replace bicarbonate ions and relieve the bicarbonate excess responsible for her condition. A. Grapefruit juice is not acid-forming when metabolized. Cranberry juice is acid-forming and will acidify his blood, resulting in a decreased urine pH. D. Eating foods rich in acids, such as cranberries and rhubarb. 73. Which of the following would be important in treating metabolic alkalosis? A. Increasing bicarbonate ions. B. Increasing chloride ions. C. Decreasing potassium ions. D. Decreasing sodium ions. B. Increasing chloride ions. A. A renal physiological buffer system involving the excretion of either an acid or alkaline urine will be initiated within 24 hours. 75. Which of the following type of acids would be produced as a result of glucose catabolism? A. Acetoacetic and lactic. B. Lactic. C. Phosphoric and sulfuric. D. Sulfuric. B. Lactic. D. Increases in hydrogen ion concentration above a certain level depress the central nervous system, and, therefore, produce such symptoms as disorientation and coma. 1. In the male reproductive system, The essential organs of reproduction are called the seminal vesicles. B. Testes. C. Vasa deferentia. D. Cowper glands. B. Testes. 2. The accessory organs of the male reproductive system include all the following except epididymis. B. Vasa deferentia. C. Urethra. D. Gonads. D. Gonads. 3. Which of the following is not a supporting structure of the male reproductive system? A. Penis. B. Scrotum. C. Prostate. D. Pair of spermatic cords. C. Prostate. 4. Which of the following is not a secreting gland in the male reproductive system? A. Seminal vesicle. B. Bulbourethral gland. C. Prostate gland. D. All of the above are secreting glands in the male reproductive system. D. All of the above are secreting glands in the male reproductive system. 5. The supporting structures in the male reproductive system include the penis. B. A pair of spermatic cords. C. The scrotum. D. All of the above. D. All of the above. 6. Progesterone released by cells surrounding the ovum assisting capacitation of the sperm. B. Supply additional nutrient for the sperm. C. Increase motility and attract sperm to the ovum. D. Has no measurable effect on the sperm. C. Increase motility and attract sperm to the ovum. 7. Which of the following is not classified as an accessory organ of the reproductive system in the male? A. Testes. B. Epididymides. C. Urethra. D. Seminal vesicles. A. Testes. 8. Which of the following statements is not true? A. Each testis is 4 to 5 centimeters long. B. Each testis weighs about 10 to 15 grams. C. The right testis is usually lower than the left testis. D. All of the above are true. C. The right testis is usually lower than the left testis. 9. The efferent ductules that surround and protect each testis. B. Are part of the tunica albuginea. C. Drain the reedy testis. D. Do all of the above. C. Drain the reedy testis. 10. Which of the following divides the testes into lobules? A. Seminiferous tubules. B. Vasiferans. C. Efferent ductules. D. Tunica albuginea. D. Tunica albuginea. 11. The dense, white, fibrous capsule that encases each testis is called the reedy testis. B. Efferent ductule. C. Tunica albuginea. D. Scrotum. C. Tunica albuginea. 12. Testosterone inhibits the anterior pituitary secretion of FSH, and LHB helps regulate metabolism and stimulates protein anabolism. C. Promotes kidney tubule secretion of potassium. D. Does all of the above. D. Does all of the above. C. Stimulates the interstitial cells to increase their secretion of testosterone. 14. Which of the following is not an effect of testosterone? A. Promotes excretion of potassium by kidneys. B. Promotes anabolism of proteins. C. Promotes growth of skeletal muscles. D. Promotes lengthening of long bones. D. Promotes lengthening of long bones. 15. The tightly coiled tube of the epididymis measures blank feet inch length. A. 5 bits 10 circa 15 d. 20. D. 20. 16. Mechanical support and protection for developing germ cells in the testis are provided by tunica albuginea. B. Sertoli cells. C. Interstitial cells. D. Reedy testes. B. Sertoli cells. 17. Which of the following is not a function of testosterone? A. Initiation of spermatogenesis. B. Development of secondary male sex characteristics. C. Regulation of metabolism. D. Inhibition of secretion of gonadotropins. D. Inhibition of secretion of gonadotropins. 18. To be capable of fertilizing an ovum, sperm must undergo a process called epiphysioclosure. B. Ejaculation. C. Capacitation. D. Gonadotropin secretion. C. Capacitation. 19. Each of the following is a duct in the male reproductive system except a vas deferens. B. Urethra. C. Epididymis. D. Inguinal canal. D. Inguinal canal. 20. Normally, capacitation occurs in sperma in the testes. B. In the vas deferens. C. In the urethra. D. After they have been introduced into the vagina of the female. D. After they have been introduced into the vagina of the female. 21. In spermatozoa, a helical arrangement of mitochondria is located in the A. acrosome. B. Head. C. Cylindrical middle piece. D. Tail. C. Cylindrical middle piece. 22. As part of the maturation process, sperm will stay in the epididymis for A. 1 to 3 days. B. 4 to 7 days. Circa 1 to 3 weeks. D. 1 to 2 months. Circa 1 to 3 weeks. 23. The duct of the vas deferens is an extension of the A tail of the epididymis. B. Urethra. C. Ejaculatory duct. D. Seminal vesicles. A tail of the epididymis. 24. In the male, the urethra is A. Involved in the reproductive system. B. Involved in the urinary system. C. Classified as a genital duct. D. All of the above. D. All of the above. 25. The structure that connects the epididymis with the ejaculatory duct is the A. urethra. B. Vas deferens. C. Seminal vesicle. D. Scrotum. B. Vas deferens. 26. The temperature required for sperm production is about blank normal body temperature. A. 10 degrees below. B. 3 degrees below. Circa 10 degrees above. D. 3 degrees above. B. 3 degrees below. 27. The opening of the urethra at the tip of the glans is called the A. prepuce. B. External urinary meatus. C. Corpora cavernosa. D. Glans penis. B. External urinary meatus. 28. The urethra runs through the center of the A. Seminal vesicle. B. Keuper gland. C. Bulbourethral gland. D. Prostate gland. D. Prostate gland. 29. The male gland that secretes a fructose sugar used as an energy source for sperm is the A. Prostate gland. B. Bulbourethral gland. C. Seminal vesicle. D. Keuper gland. C. Seminal vesicle. 30. The gland that secretes an alkaline substance that constitutes about 30% of the seminal fluid is the A. Seminal vesicle. B. Keuper gland. C. Bulbourethral gland. D. Prostate gland. D. Prostate gland. 31. Contraction of both the dartos and cremaster muscles, which pull the testes upward against the perineum, is caused by a sexual arousal. B. Cold temperatures. C. Urination. D. Both A and B. D. Both A and B. 32. The foreskin in the male is also known as the A. glans penis. B. Urinary meatus. C. Scrotum. D. Prepuce. D. Prepuce. 33. Which of the following is a part of the supporting structures of the male reproductive system? A. Scrotum. B. Spermatic cord. C. Prostate. D. Seminal vesicle. A. Scrotum. 34. The main factor determining male fertility is the A. Size of the sperm. B. Number of sperm ejaculated. C. Shape of the sperm. D. Motility of the sperm. B. Number of sperm ejaculated. 35. Which of the following is not enclosed in the spermatic cord? A. Vas deferens. B. Ejaculatory ducts. C. Blood vessels. D. Nerves. B. Ejaculatory ducts. 36. Which of the following glands is not a paired accessory gland of the male reproductive system? A. Prostate. B. Seminal vesicle. C. Bulbourethral gland. D. Keuper gland. A. Prostate. 37. Leydig cells is another name for sustentacular cells. B. Rete testis. C. Interstitial cells. D. None of the above. C. Interstitial cells. 38. Sertoli cells is another name for interstitial cells. B. Sustentacular cells. C. Rete testis. D. Tunica albuginea. B. Sustentacular cells. 39. Which of the following is true of the essential organ in the reproductive system? A. It produces gametes. B. It is called the testis in the male. C. It is called the gonad in both sexes. D. All of the above are true. D. All of the above are true. 40. The number of spermatids formed by one primary spermatocyte is A. 2b. 4 circa 60. 8. B. 4. 41. Which of the following cells contain 46 chromosomes? A. Sperm cells. B. Primary spermatocytes. C. Secondary spermatocytes. D. Spermatids. B. Primary spermatocytes. 42. Which of the following is not true of FSH? A. It is produced in the anterior pituitary gland. B. It increases the production of sperm. C. It stimulates the secretion of testosterone. D. Its secretion is inhibited by high testosterone levels. C. It stimulates the secretion of testosterone. 43. Which of the following statements is not true about the fluid produced by the seminal vesicles? A. It contains prostaglandins. B. It is alkaline and viscous. C. It contains glucose as an energy source for sperm cells. D. All of the above are true about the fluid produced by the seminal vesicles. C. It contains glucose as an energy source for sperm cells. 44. Which of the following statements is not true about prostate cancer? A. It is the most common non-skin cancer in American men. B. The cancer can sometimes be detected by palpation. C. The PSA test is used to detect prostate cancer. D. All of the above are true about prostate cancer. D. All of the above are true about prostate cancer. 45. Which of the following statements is not true of the bulbourethral gland? A. It joins the urethra and the prostate gland. B. It is also called the Cowper gland. C. It is a compound tubuloalveolar gland. D. It produces an alkaline secretion in semen. A. It joins the urethra and the prostate gland. 46. Which structure is not found in the scrotum? A. Testes. B. Seminal vesicle. C. Lower part of the spermatocord. D. Epididymis. B. Seminal vesicles. 47. Functional sterility results when the sperm count per milliliter falls below blank million. A. 10 bits 25 circa 100 D. 150. B. 25. 48. Which term means hidden testis? A. Oligospermia. B. Phimosis. C. Cryptorchidism. D. Spermatogonia. C. Cryptorchidism. 49. The male perineum extends from the pubis anteriorly to what structure posteriorly? A. Base of the scrotum. B. Coccyx. C. Anus. D. Gluteal folds. B. Coccyx. 50. The function of ring crystalloids in the Leydig cells is to initiate the release of testosterone. B. To assist in the process of spermatogenesis. C. To communicate with Sertoli cells. D. Uncertain at this time. D. Uncertain at this time. 51. Which of the following is not a function of the Sertoli cells? A. They produce testosterone. B. They produce androgen-binding protein. C. They form the blood-testis barrier. D. All of the above are functions of the Sertoli cells. A. They produce testosterone. 52. Which of the following is not true of interstitial cells? A. They produce testosterone. B. They contain ring crystalloids that appear after puberty. C. They form the blood-testis barrier. D. All of the above are true of the interstitial cells. C. They form the blood-testis barrier. 53. What reproductive duct is divided into the head, body, and tail? A. Vas deferens. B. Ejaculatory duct. C. Epididymis. D. Seminal vesicle. C. Epididymis. 54. What reproductive duct has thick, muscular walls and can be palpated in the scrotal sac as a smooth, movable cord? A. Vas deferens. B. Ejaculatory duct. C. Epididymis. D. Seminal vesicle. A. Vas deferens. 55. What reproductive duct is a short tube about 1 cm long that passes through the prostate gland to terminate in the urethra? A. Vas deferens. B. Ejaculatory duct. C. Epididymis. D. Seminal vesicle. B. Ejaculatory duct. 56. The main advantage of sexual reproduction over asexual reproduction is that only one parent is needed. B. All the offspring are identical. C. There is greater diversity in the offspring. D. More offspring are produced. C. There is greater diversity in the offspring. 57. Which of the following ducts are not paired? A. Urethra. B. Ejaculatory duct. C. Vas deferens. D. Both A and B. A. Urethra. 58. When the tight junctions of the sustentacular cells divide the seminiferous tubules into two compartments, meiotically active cells are near the basement membrane. B. Meiotically active cells are near the lumen. C. Spermatogonia are near the lumen. D. Both A and C are true. B. Meiotically active cells are near the lumen. C. Yes, because the higher temperature inside the body cavity inhibits spermatogenesis, which could result in permanent sterility if untreated. D. Antigen-antibody reaction in males causes destruction of sperm, resulting in infertility. A. Death from prostate cancer can be reduced if detected early enough for effective treatment. 1. Which of the following is not an accessory sex organ of the female reproductive system? A. Ovary. B. Vagina. C. Fallopian tube. D. Mammary glands. A. Ovary. 2. The tube connecting the ovaries to the uterus is called the auterine tubes. B. Oviducts. C. Fallopian tubes. D. All of the above are correct. D. All of the above are correct. 3. Which of the following structures is not classified as internal genitals of the female reproductive system? A. Ovaries. B. Uterine tube. C. Vagina. D. Vulva. D. Vulva. 4. The fundus of the uterus is the A. Lower, narrow section. B. Area above where the tubes enter. C. Central portion. D. Opening into the uterus. B. Area above where the tubes enter. 5. The layer of the uterus from which tissue is left during menstruation is the A. Endometrium, B. Myometrium, C. Parietal peritoneum, D. Visceral peritoneum. A. Endometrium. 6. The layer that is incomplete because it covers none of the cervix and only part of the body is called the A. Parietal peritoneum, B. Myometrium, C. Endometrium, D. Symphysis pubis. A. Parietal peritoneum. 7. Which of the following is not a division of the uterine tubes? A. Isthmus, B. Fundus, C. Ampulla, D. Infundibulum. B. Fundus. 8. The process of egg formation is called ovulation, B. oogenesis, C. fertilization, D. germination. B. oogenesis. 9. The uterus is suspended between two folds of parietal peritoneum that form a partition across the pelvic cavity. These ligaments are blank ligaments. Around B. Uterosacral, C. Anterior and posterior, D. Broad. D. Broad. 10. Which of the following uterine ligaments form a deep pouch known as a posterior cul-de-sac of Douglas? A. Broad, B. Uterosacral, C. Posterior, D. Anterior. C. Posterior. 11. The region between the vaginal orifice and the anus is called the A. mons pubis, B. Labia majora, C. Labia minora, D. perineum. D. perineum. 12. Which of the following is not true concerning the uterus? A. It produces estrogen. B. It's less compact and spongy in layers of lining tissue. C. It is the site for embryo implantation. D. Uterine muscle contraction expels the infant. A. It produces estrogen. 13. The funnel-shaped, open-ended portion of the oviduct is called the A. isthmus, B. ampulla, C. infundibulum, D. fimbriae. C. infundibulum. 14. Fertilization of an ovum most often occurs in the A. ovary, B. fallopian tube, C. uterus, D. vagina. B. fallopian tube. 15. Each of the following structures is a part of the vulva except the A. mons pubis, B. labia majora, C. perineum, D. clitoris. C. perineum. 16. The greater vestibular glands are also called blank glands. A. Bartholin, B. Cowper, C. Skene, D. Huntington. A. Bartholin. 17. The urethral orifice is blank to the vagina opening. A. posterior, B. anterior, C. medial, D. lateral. B. anterior. 18. Salpingitis is inflammation of the A. ovaries, B. fallopian tubes, C. uterus, D. vagina. B. fallopian tubes. 19. The division of the uterine tube that hath an outer margin that resembles a fringe is called the A. isthmus, B. ampulla, C. infundibulum, D. oviduct. C. infundibulum. 20. The final stage in the process of ovarian follicle development is the A. corpus hemorrhagicum, B. corpus luteum, C. corpus albicans, D. mature follicle. C. corpus albicans. 21. Which of the following is not true of the vagina? A. It can act as a receptacle for seminal fluid from the male. B. It serves as the lower part of the birth canal. C. It is a passageway for urine. D. It acts as an excretory duct for uterine secretions. C. It is a passageway for urine. 22. The part of the vulva that is composed of erectile tissue, and is located just behind the junction of the labia minor is called the A. mons pubis. B. clitoris. C. urinary meatus. D. labia majora. B. clitoris. 23. Which of the following hormones causes ejection of milk into the mammary ducts, making it accessible for the infant? A. Progesterone. B. Oxytocin. C. Prolactin. D. Estrogen. B. Oxytocin. 24. The hormone that causes the alveoli of the mammary glands to secrete milk is estrogen. B. Oxytocin. C. Prolactin. D. Estrogen. C. Prolactin. 25. During a 28-day menstrual cycle, ovulation would be most likely to occur on day blank of the cycle. A. 3 bits 8 circa 14 d. 21. Circa 14. 26. The follicular phase of the menstrual cycle is the same as the A. ovulatory phase. B. menstrual period. C. preovulatory phase. D. postovulatory phase. C. preovulatory phase. 27. The phase of the menstrual cycle that occurs between the expulsion of the ovum from the ovary and the onset of menses is the blank phase. A proliferative B. follicular. C. luteal. D. estrogenic. C. luteal. 28. The hormone that causes the follicle to rupture and the egg to be expelled is a luteinizing hormone. B. follicle stimulating hormone. C. estrogen. D. progesterone. A luteinizing hormone. 29. The postmenstrual phase of the menstrual cycle is also called menses. B. the proliferative phase. C. the preovulatory phase. D. the luteal phase. B. the proliferative phase. 30. Which of the following is a synonym for the premenstrual phase? A. progesterone phase. B. luteal phase. C. secretory phase. D. both A and C. D. both A and C. 31. What is the name of the so-called ovulating hormone? A. estrogen. B. progesterone. C. luteinizing hormone. D. follicle stimulating hormone. C. luteinizing hormone. 32. Shortly before menstruation, blood levels of estrogens and progesterone decrease. B. blood levels of estrogens and progesterone increase. C. blood levels of FSH stabilize. D. the corpus luteum secretes progesterone. A. blood levels of estrogens and progesterone decrease. 33. The average age at which menopause occurs is blank years. A. 40-bit 60 to 65 circa 45 to 50 D. 55. Circa 45 to 50. 34. A high blood concentration of estrogens as stimulates endometrial glands to secrete. B. Stimulates epithelial cells of the endometrium to proliferate. C. Stimulates FSH secretion by the anterior pituitary. D. Causes development of a corpus luteum. B. Stimulates epithelial cells of the endometrium to proliferate. B. Decreased myometrial contractions. 36. During the postovulatory phase of the cycle, the greatest percentage of progesterone is produced by the A. Corpus albicans. B. Corpus luteum. C. Primary Graafian follicle. D. Uterus. B. Corpus luteum. 37. The female reproductive system differs from the male reproductive system in that it produces gametes. B. Provides protection for the developing offspring. C. Provides nutrition to the developing offspring. D. Does both B and C. D. Does both B and C. 38. Which of the following is not part of the primary egg follicle? A. Germinal epithelium. B. Oocyte. C. Follicular cells. D. All of the above are part of the primary egg follicle. A. Germinal epithelium. D. All of the above contribute to the increase in the thickness of the endometrium during the endometrial cycle. 40. Which of the following organs is not considered part of the duct system of the female reproductive system? A. Vagina. B. Uterine tube. C. Uterus. D. All of the above are considered part of the duct system. D. All of the above are considered part of the duct system. 41. Which of the following structures is not in the urogenital triangle of the perineum? A. Anus. B. Labia. C. Vaginal orifice. D. Urinary opening. A. Anus. 42. Which of the following is not true of the ovaries? A. They are located on either side of the uterus. B. They are attached to the mesovaral ligament. C. They are attached to the uterine ducts. D. All of the above statements are true of the ovaries. C. They are attached to the uterine ducts. 43. Which of the following structures is not involved with the development of the ova in the ovary? A. Corpus albicans. B. Follicular cell. C. Zona pellucida. D. All of the above structures are involved in the development of the egg cell. A. Corpus albicans. 44. Which of the following functions is not usually associated with the uterus? A. Menstruation. B. Fertilization. C. Gestation. D. All of the above functions are associated with the uterus. B. Fertilization. 45. Going from the ovary to the uterus, the sequence of the divisions of the uterine tubes is isthmus, ampulla, fimbriae, and infundibulum. B. Ampulla, isthmus, infundibulum, and fimbriae. C. Fimbriae, infundibulum, ampulla, and isthmus. D. Fimbriae, ampulla, isthmus, and infundibulum. C. Fimbriae, infundibulum, ampulla, and isthmus. 46. Which of the following glands is not part of the vulva? A. The greater vestibular glands. B. Skin gland. C. Bartholin glands. D. All of the above glands are part of the vulva. D. All of the above glands are part of the vulva. C. Prolactin stimulates the ejection of milk into the ducts of the mammary glands. 48. Which of the following is the least predictable method of determining ovulation time? A. The measurement of LH in the urine. B. The length of previous cycle. C. The change in basal body temperature. D. All of the above methods are equally accurate in determining ovulation time. B. The length of previous cycles. 49. An episiotomy is an incision made through the body of the uterus. B. Through the cervix of the uterus. C. In the perineum. D. None of the above correctly describes an episiotomy. C. In the perineum. 50. An ectopic pregnancy can occur in the A. uterus. B. pelvic cavity. C. uterine tubes. D. Either B or C are correct. D. Either B or C are correct. 51. Which of the following is not found in the medulla of the ovary? A. Lymphatics. B. Ovarian follicles. C. Blood vessels. D. All of the above are found in the medulla of the ovary. B. Ovarian follicles. 52. Which of the following is not a function of the ovary? A. It produces estrogen. B. It produces ova. C. It produces follicle-stimulating hormone. D. All of the above are functions of the ovary. C. It produces follicle-stimulating hormone. 53. Which of the following is not a layer of the endometrium of the uterus? A. Stratum myometrium. B. Stratum compactum. C. Stratum spongiosum. D. Stratum basale. A. Stratum myometrium. 54. The innermost layer of the wall of the uterus is the stratum myometrium. B. compactum. C. spongiosum. D. basale. B. compactum. 55. Which part of the uterus opens into the vagina? A. Fundus. B. Cervical canal. C. External os. D. Internal os. C. External os. 56. Which of the following ligaments does not assist in holding the ovaries in place? A. Rod. B. Mesovarian. C. Ovarian. D. Round. D. Round. 57. The medulla of the ovary contains atheca cells. B. granulosa cells. C. blood vessels, and lymphatics. D. both A and B. C. blood vessels, and lymphatics. 58. Which of the following ligaments that support the uterus is a single ligament? A. Broad. B. Posterior. C. Round. D. Uterosacral. B. Posterior. 'A. The ovaries become functional and produce mature ova one at a time. D. All of the above are true regarding human developmental biology. 2. The normal phenomenon of crossing over occurs during meiosis IB during meiosis II. C in both meiosis and mitosis. D in both A and B. A during meiosis I. 3. The process of spermatogenesis forms blank spermatozoa, each with blank chromosomes. A 2. 23 bits 4. 23C2. 4064. 46. B4. 23. 4. The main difference between oogenesis and spermatogenesis is that in oogenesis the primary oocytes contain 46 chromosomes. B. The cytoplasm is equally divided among the daughter cells. C. Meiosis I does not occur. D. Only one ovum is produced from each primary oocyte, plus 3 polar bodies. D. Only one ovum is produced from each primary oocyte, plus 3 polar bodies. 5. After leaving the Graafian follicle, the ovum lives approximately blank day. A. 1 bit to circa 3D. 4. A. 1. 6. Fertilization takes place in the A. Vagina. B. Uterus. C. Uterine tube. D. Ovary. C. Uterine tube. 7. Implantation occurs during the blank stage. A zygote. B. Morula. C. Blastocyst. D. Trophoblast. C. Blastocyst. 8. The inner cell mass of the blastocyst contains the A. yolk sac. B. Amniotic cavity. C. Trophoblast. D. Both A and B are correct. D. Both A and B are correct. 9. The solid mass of cells formed when the zygote begins to divide is called the A. blastocyst. B. Trophoblast. C. Morula. D. Embryo. C. Morula. 10. The structure known as the bag of waters is the A. placenta. B. Amniotic cavity. C. Yolk sac. D. chorion. B. Amniotic cavity. 11. Which of the following is not a function of the placenta? A. Excretory organ. B. Respiratory organ. C. Endocrine organ. D. Barrier to alcohol. D. Barrier to alcohol. 12. The normal length of gestation for humans is approximately blank weeks. A. 37 bits 39 circa 41 D. 43. B. 39. 13. The chorion, which develops from the trophoblast, becomes an important fetal membrane in the placenta. B. The inner cell mass. C. The amniotic cavity. D. The yolk sac. An important fetal membrane in the placenta. 14. The secretion of human chorionic gonadotropin by the placental tissue peaks about blank weeks after fertilization. A. 2 to 3 bits 3 to 4 circa 8 to 9 D. 13 to 14. Circa 8 to 9. 15. The function of human chorionic gonadotropin is to act as a gonadotropin. B. Stimulate the corpus luteum. C. Maintain high luteoestrogen and progesterone levels. D. Do all of the above. D. Do all of the above. 16. All organ systems are formed and functioning by the blank month of fetal development. A, second, B, third, C, fourth, D, fifth. C, fourth. 17. In the developing human embryo, the heart begins to beat at about blank weeks. A. 5 bits 10 circa 15 D. 20. A. 5. 18. Which of the following is derived from mesoderm during embryonic development? A. Bones and muscles. B. Epithelium of GI tract. C. Nervous tissue and skin. D. Nervous tissue and bones. A. Bones and muscles. 19. The primary germ layer that forms many of the structures around the periphery of the body is the A. Endoderm. B. Mesoderm. C. Ectoderm. D. Epiderm. C. Ectoderm. 20. Histogenesis may be defined as the process during which implantation occurs. B. The tissues arrange themselves into organs. C. The primary germ layers develop into many different kinds of tissues. D. Both B and C occur. C. The primary germ layers develop into many different kinds of tissues. 21. The third stage of labor is the A period of uterine contractions until dilation of the cervix is complete. B period of maximal cervical dilation. C period when the baby exits the vagina. D process of expulsion of the placenta through the vagina. D process of expulsion of the placenta through the vagina. 22. In most cases, stage 1 of labor lasts from blank hours. A. 2 to 4 bit 6 to 12 circa 6 to 24 D. 24 to 36. Circa 6 to 24. 23. Identical twins result from the A splitting of embryonic tissue from the same zygote early in development. B. Inner cell mass dividing into two masses during the blastocyst stage of development. C. Fertilization of two different ova by two different spermatozoa. D. Both A and B are correct. D. Both A and B are correct. B period from the time of maximal cervical dilation until the baby exits through the vagina. 25. As the body develops, the A head becomes proportionately smaller. B face decreases from 1/2 to 1/8 of the skull surface. C trunk becomes proportionately longer. D thoracic and abdominal contours become more rounded. A head becomes proportionately smaller. 26. Birth weight generally doubles during the first blank months, and then blank. A. 3. Triples by 1 year. B. 4. Triples by 1 year circa 6. Doubles again by 1 year. D. 6. Triples by 18 months. B. 4. Triples by 1 year. 27. At what age do boys generally complete rapid growth stage? A. 12 bits 14 circa 16 D. 18. Circa 16. 28. At what age do girls generally begin to menstruate? A. 10 bits 12 to 13 circa 14 D. 15 to 16. B. 12 to 13. 29. Fraternal twins have only one placenta. B. Have two placentas. C. Must always have the same biological father. D. Are genetically identical. B. Have two placentas. 30. During infancy, the lumbar curvature appears between the blank months. A second and fourth, B. Fourth and sixth, C. Sixth and 10th, D. 12th and 18th. D. 12th and 18th. 31. An infant is able to follow a moving object with its eyes by the end of the blank month. A first, B. Second, C. Third, D. Fourth. B. Second. 32. The deciduous teeth that begin to appear at about 6 months of age. B. Are lost during childhood. C. Start to erupt at about 6 years of age. D. Both A and B are correct. D. Both A and B are correct. 33. Between the ages of 30 and 75, the number of nephron units in the kidney decreases by almost A. 20%, B. 30%, circa 40%, D. 50%. D. 50%. 34. The condition caused by buildup of fatty deposits in blood vessel walls is arteriosclerosis. B. Atherosclerosis. C. Myocardial infarction. D. Hypertension. B. Atherosclerosis. 35. Clouding of the lens of the eye is called a presbyopia. B. Myopia. C. Glaucoma. D. Cataract. D. Cataract. 36. The most serious age-related eye disorder is a presbyopia. B. Glaucoma. C. Cataract. D. Hyperopia. B. Glaucoma. 37. If a creature had 36 chromosomes in its normal body cells, its gametes would contain blank chromosomes. A. 72 bits, 36 circa 18, D. 9. Circa 18. 38. If a creature had 36 chromosomes in its normal body cells, the zygote of the creature would contain blank chromosomes. A. 72 bits, 36 circa 18, D. An indeterminable number of. B. 36. 39. The most potent stem cells, those that can generate many types of human tissue, can be found in the A. Red bone marrow. B. Zygote, C. blastocyst stage. D. Both B and C are correct. B. Zygote. 40. DNA replication occurs during a prophase I. B. prophase II. C. Interphase before prophase I. D. Both A and B. C. Interphase before prophase I. 41. Crossing over occurs to reduce the chromosome number in a gamete. B. Assist in tetrad formation. C. Allow chromatin to condense into chromosomes. D. Transfer genes from one chromosome to another. D. Transfer genes from one chromosome to another. 42. After puberty, about how many primary oocytes racemate meiosis each month? A. 10 bits, 100 circa 1000, D. 10,000. Circa 1000. 43. At ovulation, The ovum is at which stage of meiosis? A. Telophase the second. B. Anaphase the second. C. Telophase ID. None of the above. D. None of the above. 44. In the female reproductive system, which of the following does not assist the sperm in reaching the egg? A. Cilia in the uterine tubes. B. Polar bodies produced by the egg. C. Mucus strands in the cervical canal. D. All of the above assist the sperm in reaching the egg. B. Polar bodies produced by the egg. 45. Meiosis I produces what in oogenesis? A. Ovum. B. Primary polar body. C. Primary oocyte. D. Both B and C. B. Primary polar body. 46. The sequence of early development of the fetus is a morula, zygote, and blastocyst. B. Zygote, morula, and blastocyst. C. Zygote, blastocyst, and morula. D. Morula, blastocyst, and zygote. B. Zygote, morula, and blastocyst. 47. A non-functioning yolk sac could hinder the fetus in receiving proper nutrition. B. Producing blood cells. C. Receiving enough oxygen. D. All of the above. B. Producing blood cells. 48. Which of the following hormones is not produced by the placenta? A. FSH/PHCG. Estrogen. D. All of the above hormones are produced by the placenta. A. FSH. 49. Which of the following structures is not formed by the endoderm? A. Tonsils. B. Kidneys. C. Lining of the pancreatic duct. D. Glandular epithelium of the thyroid gland. B. Kidneys. 50. Which of the following structures is not formed by the mesoderm? A. Skeletal muscles. B. Bone. C. Kidneys. D. All of the above structures are formed by the mesoderm. D. All of the above structures are formed by the mesoderm. 51. Which of the following structures is not formed by the ectoderm? A. Cornea of the eye. B. Dermis of the skin. C. Brain. D. Enamel of the teeth. B. Dermis of the skin. 52. Which of the following conditions associated with the eye does not directly involve the lens? A. Glaucoma. B. Presbyopia. C. Cataracts. D. All of the above conditions directly involve the lens. A. Glaucoma. 53. A condition in which the placenta grows too close to the cervical opening is called a ectopic pregnancy. B. Abruptia placentae. C. Placenta previa. D. Eclampsia. C. Placenta previa. 54. A condition in which the placenta separates from the uterine wall is called a ectopic pregnancy. B. Abruptia placentae. C. Placenta previa. D. Eclampsia. B. Abruptia placentae. 55. In the human, the haploid number of chromosomes is A. 23. B. 46. C. The result of meiosis. D. Both A and C. D. Both A and C. 56. In the human, the diploid number of chromosomes is A. 23b. 46c. The result of meiosis. D. Both B and C. B. 46. 57. A tetrad is formed only in spermatogenesis. B. Formed only in oogenesis. C. Homologous pairs of chromosomes that are moved together. D. None of the above describe a tetrad. C. Homologous pairs of chromosomes that are moved together. 58. During human oogenesis, which structure contains 46 chromosomes? A. Ovum. B. Secondary oocyte. C. First polar body. D. Both B and C. D. Both B and C. 59. Theca cells produce an androgen that is converted to estrogen. B. The granulosa cells. C. The oogonia. D. None of the above. An androgen that is converted to estrogen. 60. Only about what % of the sperm deposited in the female reproductive tract actually reach the ovum? A. 10%. B. 5%. Circa 1%. D. Less than 0.1%. D. Less than 0.1%. 61. At fertilization, what part of the sperm cell enters the egg? A. Nucleus of the sperm. B. RNA from the sperm. C. Proteins from the sperm. D. All of the above. D. All of the above. 62. If the process of oogenesis goes to completion, how many polar bodies will be produced? A. 1 bit. 2. Circa 3. D. 4. Circa 3. 63. What layer of the ovum has receptors for sperm cells? A. Zona pellucida. B. Corona radiata. C. Theca cells. D. Both A and B. D. Both A and B. 64. The term used for the fertilized ovum is amorula. B. Zygote. C. Fetus. D. Blastocyst. B. Zygote. B. Gonads attached to the paramyxonephrotic duct. 66. The primary germ layers developed from stem cells are referred to as omnipotent. B. Pluripotent. C. Totipotent. D. Multipotent. B. Pluripotent. 67. Stem cells in adults are referred to as a totipotent. B. Pluripotent. C. Multipotent. D. Adults do not have stem cells. C. Multipotent. 1. Gregor Mendel began the scientific study of genetics in the A. 1760s. B. 1800s. Circa 1860s. D. 1920s. Circa 1860s. 2. Each DNA molecule may be called a chromatin strand. B. Chromosome. C. Gene. D. Both A and B are correct. D. Both A and B are correct. 3. Which of the following is not a true statement? A. The gametes contain only 23 chromosomes. B. A zygote has a haploid number of chromosomes. C. The pair of sex chromosomes may not match. D. The 22 pairs of autosomes always appear to be nearly identical to each other. B. A zygote has a haploid number of chromosomes. D. All of the above are true. 5. Crossing over is the process during which similar gametes fuse together. B. Dissimilar gametes fuse together. C. Meiosis stops after meiosis. ID pairs of matching chromosomes line up along the equator of the cell and exchange genes with one another. D. Pairs of matching chromosomes line up along the equator of the cell and exchange genes with one another. A albinism and will be a carrier. 7. A DNA molecule is a gene. B. Chromosome. C. Genome. D. Gamete. B. Chromosome. 8. An individual possessing the sex chromosome combination XY is genetically a male. B. A female. C. Both. D. Neither. A male. C. Hair color somewhere between light and dark. C. Often provides some biological advantage for a human population in certain circumstances. 11. If an individual has only an X chromosome, then that person is genetically a male. B. Female. C. Neither male nor female. D. The condition of XO can never occur. B. Female. 12. Red-green color blindness shows X-linked recessive inheritance. Assume X is normal, X1 is recessive for the trait, and Y is normal. Then, an individual with a genotype XX1 will be a normal female and a carrier. B. Colorblind male. C. Normal female and not a carrier. D. Normal male. A normal female and a carrier. 13. A female can inherit an X-linked recessive trait if her father is dominant and her mother is heterozygous for the trait. B is dominant and her mother is homozygous for the trait. C exhibits the trait and her mother is homozygous for the trait. D. Both A and B are correct. C exhibits the trait and her mother is homozygous for the trait. D. All of the above statements are true of mitochondrial DNA. 15. The condition called trisomy results from a mistake in mitosis called non-disjunction. B. Mistake in meiosis called non-disjunction. C. Abnormality in a single gene. D. Genetic predisposition. B. Mistake in meiosis called non-disjunction. 16. Mitochondrial DNA is inherited as a result of both the sperm and the ovum. B has the potential for carrying mutations that produce disease. C is present only in lower forms of life. D. Both A and B are correct. B has the potential for carrying mutations that produce disease. 17. Cystic fibrosis, caused by recessive genes in chromosome pair 7, results in the impairment of the A chloride ion transport across cell membranes. B. Sodium-potassium pump. C. Calcium storing capacity of the body. D. Oxygen carrying capacity of the blood. A chloride ion transport across cell membranes. 18. All of the following diseases demonstrate single gene inheritance and are autosomal recessive except A. Tay-Sachs disease. B. Total albinism. C. Huntington disease. D. Severe combined immune deficiency. C. Huntington disease. D. All of the above are true regarding Tay-Sachs disease. 20. A group of symptoms called Down syndrome results from trisomy A. 15b. 19 circa 21d. 23. Circa 21. 21. The syndrome that results from the genotype XXY is A. Turner B. Klinefelter C. Down D. Parkinson. B. Klinefelter. B. Failure to produce an enzyme needed to generate the amino acid tyrosine. 23. A chart that illustrates genetic relationships in a family over several generations is called A. Punnett square. B. Pedigree. C. Genetic grid. D. Karyotype. B. Pedigree. B. Regulates cell division so that it proceeds normally. 25. An ordered arrangement of photographs of chromosomes from a single cell is called a genome. B. Karyotype. C. Punnett square. D. Pedigree. B. Karyotype. D. Genetically altered cells are added to the body. 27. About which percentage of the cell's DNA carry functional genes? A. 1% B. 10% circa 25% D. 50%. A. 1%. 28. The shorter segment of a chromosome is called the A centromere. B. S arm. C. P arm. D. Q arm. C. P arm. B. Both parents have the same genotype. 30. Which of the following is not mutagen? A. Radiation B. Viruses C. Chemicals D. All of the above are mutagens. D. All of the above are mutagens. 31. When one or more DNA nucleotides are missing in a gene, it can be called a deletion. B. Insertion. C. Mutation. D. Both A and C are correct. D. Both A and C are correct. 32. Carriers of cystic fibrosis are thought to be protected from malaria. B. Tuberculosis. C. Cholera. D. The toxic effects of mold growing on grain. C. Cholera. 33. Carriers of Tay-Sachs disease have a higher resistance to malaria. B. Tuberculosis. C. Cholera. D. The toxic effects of mold growing on grain. B. Tuberculosis. 34. Which of the following conditions does not occur as a result of non-disjunction? A. Tay-Sachs disease B. Down syndrome C. Turner syndrome D. Klinefelter syndrome. A. Tay-Sachs disease. 35. A karyotype would not be helpful in determining A. whether an individual has Down syndrome, B. whether an individual has Turner syndrome, C. whether an individual has PKU. The sex of the offspring. C. whether an individual has PKU. 36. Genes determine the structure and function of the body by regulating the body's production of carbohydrates, B. lipids, C. enzymes, D. all of the above. C. enzymes. 37. Which of the following processes does not aid in increasing the genetic variability of offspring? A. Independent assortment. B. Gene linkage. C. Crossing over. D. All of the above aid in increasing the genetic variation of offspring. B. Gene linkage. 38. Assume that A is dominant for normal skin color, and A is recessive for albinism. The parents with which of the following genotypes could have a child with albinism? A. AAXAAB, AXAAC, AAXID, AXA. D. AXA. 39. The parents with which of the following genotypes could not have a child with albinism? A. AAXIB, AXIC, AXID. Both B and C. A. AAXA. 40. In human blood types A and B are codominant, producing type AB. They are both dominant to the recessive O type. Which of the following parental genotypes could produce a child with type O blood? A. ABXAOB, AOXBOC, AOXBBD. None of the above genotypes can produce a type O offspring. B. AOXBO. 40. D. All of the above children could be theirs. 42. Color blindness is a sex-linked trait. Which of the following parental genotypes could produce a colorblind female? A. XXXIB, XXXXY circa, XXXXYD, XXXI. Circa, XXXXY. 43. If a man had Leber hereditary optic neuropathy, a mitochondrial DNA-carried disease, what is the probability of him passing the trait on to his offspring? A. 100%. B. 75%. Circa 0%. D. There is not enough information to determine the probability. Circa 0%. 44. Diet soda containing NutraSweet should not be given to people with A. Tay-Sachs disease, B. phenylketonuria, C. osteogenesis imperfecta, D. Diet soda would have no effect on any of the above conditions. B. phenylketonuria. 45. Which of the following diseases is not a single gene dominant trait? A. Huntington disease. B. Cystic fibrosis. C. Osteogenesis imperfecta. D. All of the above are single gene dominant traits. B. Cystic fibrosis. 46. Which of the following diseases is not a single gene recessive trait? A. Huntington disease. B. Tay-Sachs disease. C. PKU. All of the above are single gene recessive traits. A. Huntington disease. 47. Which of the following diseases is carried by mitochondrial DNA? A. Retinitis pigmentosa. B. Severe combined immune deficiency. C. Ocular albinism. D. None of the above diseases is carried by mitochondrial DNA. D. None of the above diseases is carried by mitochondrial DNA. 48. The genetic code is transmitted to offspring in discrete, independent units that are called the chromosomes. B. Genes. C. Gametes. D. Nucleosomes. B. Genes. 49. The subunits of chromatin wound around a histone protein is called a gene. B. Chromosome. C. Nucleosome. D. Nucleotide. C. Nucleosome. 50. Which of the following is not a type of RNA? A. Mitochondrial RNA. B. Ribosomal RNA. C. Transfer RNA. D. All of the above are types of RNA. A. Mitochondrial RNA. 51. The entire collection of genetic material in each typical cell of the human body is called a diploid. B. Haploid. C. Nucleosomes. D. Genome. D. Genome. 52. The human genome contains about blank genes. A. 200,000 to 300,000 bits, 150,000 to 250,000, circa 75,000 to 100,000. D. 20,000 to 25,000. D. 20,000 to 25,000. 53. Chromosome 1 contains the greatest number of genes, nearly A. 3,000. B. 2,000, circa 1,000. D. 5,000. A. 3,000. 54. Coding portions of DNA tend to lie in clusters rich in which two nucleotides? A. Thymine and cytosine. B. Cytosine and guanine. C. Cytosine and adenine. D. Thymine and adenine. B. Cytosine and guanine. 55. Which is a simple cartoon of a chromosome used to show the overall physical structure of a chromosome? A. Genome. B. Transcriptome. C. Ideogram. D. Karyotype. C. Ideogram. 56. The chromosome that has the fewest genes contains only 200 genes, and is called a chromosome 1b. Chromosome 7. C. Y chromosome. D. X chromosome. C. Y chromosome. 57. The products of meiosis are a gametes. B. Haploid cells. C. Made only of autosomes. D. Both A and B. D. Both A and B. 58. In a pedigree, a half-shaded circle indicates a female that is a carrier for a trait. B. Male that is a carrier for a trait. C. Female with a trait. D. Male with a trait. A female that is a carrier for a trait. 59. If a pedigree tracing the albinism trait showed a square that was filled in, it would indicate a female had albinism. B. Male had albinism. C. Female had normal skin color. D. Male was a carrier for albinism. B. Male had albinism. 60. If a karyotype found an X chromosome, a Y chromosome, and 3/21 chromosomes, it would indicate a blank syndrome. A female with Down, B female with Turner, C male with Klinefelter, D male with Down, D male with Down. 61. Diseases that are known to involve more than one gene are called multigenic diseases. B. Plerogenic diseases. C. Polygenic diseases. D. Codominant diseases. C. Polygenic diseases. B. Most genetic disorders involve huge numbers of genes in affected cells. One. Endocrine glands can be made up of a glandular epithelium. B. Neurosecretory tissue. C. Ducts leading to major arteries. D. Both A and B. D. Both A and B. 2. In comparison with the nervous system, the regulatory effects of the endocrine system are rapid to appear but short-lived. B. Slow to appear but long-lasting. C. Rapid to appear and long-lasting. D. Slow to appear and short-lived. B. Slow to appear but long-lasting. A. Chemical messenger travels a short distance. 4. A molecule secreted by neurosecretory cells and then travels in the bloodstream to interact with specific target cells at a distance rather than across a synapse is called a neurotransmitter. B. Neurohormone. C. Signaling hormone. D. Anabolic hormone. B. Neurohormone. 5. Tropic hormones that target other endocrine glands and stimulate their growth and secretion. B. Target reproductive tissues. C. Stimulate anabolism in their target cells. D. Do all of the above. A. Target other endocrine glands and stimulate their growth and secretion. 6. All of the following are non-steroid hormones except oxytocin. B. Calcitonin. C. Cortisol. D. Glucagon. C. Cortisol. 7. The last step in the non-steroid hormone mechanism of action is the joining with the G protein on the cell membrane. B. Protein kinases activate other enzymes. C. Adenyl cyclase is activated. D. KIMP is formed. B. Protein kinases activate other enzymes. 8. Hormones can be steroids. B. Peptides. C. Glycoproteins. D. All of the above. D. All of the above. 9. Steroids are able to pass easily through a target cell's plasma membrane because they are synthesized from amino acids. B. Synthesized from carbohydrates. C. Lipid soluble. D. Synthesized from nucleic acids. C. Lipid soluble. 10. When a small amount of one hormone allows a second hormone to have its full effect, the phenomenon is called a synergism. B. Permissiveness. C. Antagonism. D. Augmentation. B. Permissiveness. 11. Which of the following non-steroid hormones bind to receptors associated with a DNA molecule within the nucleus of the target cell? A. Thyroxine. B. Triiodothyronine. C. Prolactin. D. Both A and B. D. Both A and B. 12. The compound that is referred to as a tissue hormone is a growth hormone. B. Prostaglandin. C. Adrenocorticotropic hormone. D. Thyroxine. B. Prostaglandin. C. Aspirin produces some of its effects by increasing PGE synthesis. 14. The type of prostaglandin that play a role in the development of a fever is A. PGAB, PGEC, PGFD, PGA and PGE. B. PGE. C. Cells can have receptors for hormones or for neurotransmitters but not for both. 16. The production of thyroid hormone is stimulated by another hormone from the A. anterior pituitary, B. posterior pituitary, C. thyroid gland, D. parathyroid gland. A. anterior pituitary. 17. The many hormones secreted by endocrine tissues can be classified simply as blank hormones. A steroid or non-steroid, B. anabolic or catabolic, C. sex or non-sex, D. tropic or hypotropic. A steroid or non-steroid. 18. Which of the following is not true of steroid hormones? A. They are lipid-soluble. B. They are derived from a fatty acid molecule. C. They can pass through the cell membrane. D. All of the above are true about steroid hormones. B. They are derived from a fatty acid molecule. 19. Which of the following is not a description of hormone interaction explained in the text? A. Suppression, B. Antagonism, C. Synergism, D. Permissiveness. A. Suppression. 20. The immediate effect of a steroid hormone on a cell is the A. Formation of CAMP, B. Increase of enzyme-controlled intracellular reactions, C. Transcription of RNA, D. Activation of adenyl cyclase, C. Transcription of RNA. 21. One of the later effects of steroid hormones on the cell could be the A. Transcription of RNA, B. Making of enzymes, C. Formation of CAMP, D. Activation of kinases, B. Making of enzymes. 22. Which of the following does not act as a second messenger for non-steroid hormones? A. Inositol triphosphate, B. Guanosine monophosphate, C. Calcium comedulin complex, D. All of the above act as second messengers. D. All of the above act as second messengers. 23. Which of the following is not a functional classification of hormones? A. Steroid, B. Tropic, C. Anabolic, D. Neither A nor B is a functional classification of hormones. A. Steroid. 24. Which of the following is not a chemical classification of hormones? A. Steroid, B. Anabolic, C. Tropic, D. Neither B nor C is a chemical classification of hormones. D. Neither B nor C is a chemical classification of hormones. 25. The common molecule from which all steroid hormones are derived is the phospholipids. B. Cholesterol, C. lecithin, D. triglycerols. B. Cholesterol. 26. Which of the following is not a source of non-steroid hormones? A. Cholesterol, B. Protein, C. Protein joined with a carbohydrate, D. Individual amino acids. A. Cholesterol. 27. When a hormone attaches to a target cell, which of the following can occur? A. It can initiate protein synthesis. B. It can open or close ion channels. C. It can activate certain enzymes in the cell. D. All of the above can occur. D. All of the above can occur. 28. The term downregulation refers to a decrease in hormone production as we age. B. Negative feedback system of hormone regulation. C. Reduction of the number of hormone receptors in a cell. D. Movement of regulating hormones from the hypothalamus down to the pituitary gland. C. Reduction of the number of hormone receptors in a cell. B. Two hormones working together to enhance each other's impact on a target cell. 30. Hormones that regulate activity in the secreting cell itself are called the prostaglandins. B. Paracrine hormones. C. Autocrine hormones. D. Leukotriene hormones. C. Autocrine hormones. 31. Which of the following is not a protein hormone? A. Oxytocin. B. Insulin. C. Parathyroid hormone. D. All of the above are protein hormones. A. Oxytocin. 32. Which of the following is not a peptide hormone? A. Oxytocin. B. Insulin. C. Antidiuretic hormone. D. All of the above are peptide hormones. B. Insulin. 33. Which of the following is not an amino acid derivative hormone? A. Epinephrine. B. Norepinephrine. C. Thyroid hormones. D. All of the above are amino acid derivative hormones. D. All of the above are amino acid derivative hormones. 34. Which of the following is not true of prostaglandins? A. Contain a 20-carbon unsaturated fatty acid chain. B. Contain a 5-carbon ring. C. Made from membrane phospholipid molecules. D. All of the above are true of prostaglandins. D. All of the above are true of prostaglandins. 1. The structure referred to historically as the master gland is the A. Pituitary. B. Adrenals. C. Hypothalamus. D. Thyroid. A. Pituitary. 2. Which of the following hormones is not secreted by the basophils? A. Prolactin. B. Luteinizing hormone. C. Follicle-stimulating hormone. D. Thyroid-stimulating hormone. A. Prolactin. 3. The hormone most likely to cause a shift from glucose catabolism to fat catabolism is an antidiuretic hormone. B. TSHC. Adrenocorticotropic hormone. D. Somatotropin. D. Somatotropin. 4. Gonadotroph secrete A. GHB. LH and FSHC. TSHD. Prolactin. B. LH and FSH. 5. Growth of the ovarian follicle occurs because of A. LHB. Estrogen. C. Progesterone. D. FSH. D. FSH. 6. Prolactin effects of the adrenal cortex. B. Body growth. C. Skin color. D. Milk secretion. D. Milk secretion. 7. The principal action of thyrotropin-releasing hormone is stimulating the A. Release of ACTH. B. Secretion of growth hormone. C. Release of TSH. D. Release of FSH and LH. C. Release of TSH. 8. The vascular link between the hypothalamus and the adenohypophysis is called the acirculatory system. B. Hypophyseal portal system. C. Vascular system. D. Releasing inhibiting connection. B. Hypophyseal portal system.